Tell me your story.
I was this close to dying from a brain abscess that was misdiagnosed.
Good to know people care, though.
For a lot of people, the MRIs are clear.
You said you had a lot to tell.
Oh, yeah.
Someone said,
I thought it was normal to have like seizures by yourself all the time.
You definitely will feel guilt a lot.
I so appreciate you putting this together.
thank you.
Am I irresponsible for buying myself an expensive item? New to all of this is I got newly got diagnosed at the ripe age of 22 while being abroad and getting a grand mal seizure. I am still navigating the meds and lifestyle changes. Little background story, I have just had one of the worst weeks of my life. During this past week, I had a relapse. Two grand mal seizures after each other, a cluster, a hospital stay, increased dose on both my meds, and 2 days later, my mom got operated on for breast cancer. Then I had to go back to the hospital for a follow-up, came home after a hell of a day to discover one of my favorite artist merch had gone on sale. This being the cardigan from TS and a bunch of other letters. It made feel good despite my kept rage that I have to endure. It's quite expensive as you would imagine, and now I feel incredibly guilty for spending that much money, although after typing this, I hear how it sounds. That's your budget. At the ripe age of 22, if you made the choice, yeah, it might come back and bite you in the ass, but you already know that if you don't have it. So don't feel guilty if you're not putting yourself in a worse position for more stress. What do you guys think?
I think you hit it right on the head. It's first of all, it's a lot to deal with when you're first diagnosed or have your first seizures.
Particularly when you're
And
just starting to enter life.
yeah, and I think it's kind of a natural reaction to buy yourself something to make you feel better. I don't really think there's anything wrong with that. The only thing I would say is get the hell off the camper if you're already feeling the rage and switch to something else.
Fix the real issue.
Yeah, I'm gonna sound like I know what I'm talking about.
Hey, accepting and addressing the truth is definitely a way to handle it. What do you think, Pookie?
I think I need a second.
All right, no trouble. Just think about if you would ever say no to a shopping spree.
Oh.
I kind of had a shopping spree yesterday. If you count socks, beanies, and a couple scarves and maybe one squishmallow for me. The one squishmallow was like the only thing that I would say wasn't needed, but yeah, I kind of blew through that child support check.
But hey, as long as it
No.
is for the right purpose. We've got
Yeah.
comments on this one saying, no, not at all. I mean, you know your fiscal situation better than anyone here does, but I hope it doesn't sound, or no, they're saying, but it doesn't sound irresponsible at all. Getting diagnosed is difficult and incredibly important to take care of yourself physically and mentally. If getting some merch will make you feel better after an undeniably difficult week, then do it. Also, you bought it on sale. Sounds like a responsible decision to me.
I could use that rationale to justify my rent.
Oh, that's the best. As long as it's on sale.
I didn't get top shelf this week, or was it sale? But it works just as well.
I mean, seriously,
Okay, maybe not just as well, but
my being here is a shopping spree, and I could say, well, like the rent is lower than the what it's worth. So what the hell?
I have a quote. Yes, it's a Jimmy Buffett quote. Spend it while you can't take it when you go.
Yep.
Yeah, spend it while you're here. Can't take it with you. Heard that. Focal. I'm diagnosed with epilepsy and I had a 5-day EEG last year, but they're not sure what type of seizures I have since they just caught a lot of background activity. However, my neuro thinks I could have generalized and focals. I'm just curious if what I experienced yesterday sounds like a focal. I had a point where I had a really intense deja vu, experienced it before, but it was like, in quote, oh, that feels familiar. And then I go on about my day, but this time it felt so much more intense and it lasted longer. And during it, I all of a sudden felt hot. I didn't think much of it until I noticed. I didn't think much of it until I noticed that today. I just felt off and I had lingering headache, nausea, and dizziness, which usually happens if I have a nocturnal. It's saying it's at a focal because
Sounds like
the
one.
I mean, the deja vu is there, the disconnect, but if this is the first one, did they mention anything about maybe having this or having recorded this before? I didn't catch that.
but they just said they caught a lot of background activity.
Okay,
So
so I
yeah,
mean, with the EG coming, test your know your triggers and get ready to make them happen.
record everything. Because some things you didn't know before, you will start noticing when it's down on the page. Because you won't remember next time. And you won't remember the time after that. But the page is eternal. Mostly, unless you toss it into a fire. But you know what I mean.
I know what you mean.
Have you ever had an impulsive shopping spree after a seizure? I know I have bought things that I did not know about. Got deliveries and it was chalked up to you bought this when you were definitely post-ictal and here it is.
Not that I remember.
Done some Amazon shopping at post-ictal.
Yes, that's exactly who pulled up the next day and I didn't know why.
Yeah, been there. But I kept this stuff. I forgot what it was. It's the worst. Ordering stuff you don't need.
I actually have an icebreaker.
Go
Let's
ahead.
hear it.
That's, if you could choose any person from history to be your imaginary friend, who would you choose?
Can I choose two?
Say that again.
Can I choose two?
If you could choose anyone from history, anyone that's ever lived to be your imaginary friend, who would you choose?
Tom Brady.
Tom Brady. There we go. He's the footballer, right?
Yes.
Okay, good. I remembered.
English football.
Yes, American football.
American.
You gotta specify.
I got nothing.
I'm doing some research.
Can I choose two?
Yes.
Yes,
Sure,
please.
why not?
Jerry Garcia and David Crosby.
Ooh.
My two favorite dead people. My two favorite
Two
people.
dead people.
Got a post here. It says, anyone feel this way? Days like today, it just feels like I'm right on the edge of having a seizure, and it makes me just want to lay down all day. It feels like I was active and I just got a heart rate up, or it was overstimulated, so it would trigger a seizure. It's hard to explain, but I have these days where I just feel like I'm right on edge and it's just uncomfortable and it makes it hard to function and be productive. Feels like my nervous system is on edge. The question was, does anyone feel like this?
On edge? A lot.
Every day. I don't know if I feel, well, I do feel on edge a lot, but I don't feel like I'm going to have a seizure. I just feel a weird feeling. I feel weird just watching myself every day. You know what I mean?
I've
Well, you do a
noticed,
lot of editing.
I know, but beyond that,
I've noticed that I can get like, I'll start getting like anxious in the days leading up to before I have a tonic.
And that's what took so long to actually start recording because those are the days that I did not want to acknowledge, just wanted to make it through and get it over with. But it made a difference.
Crackers.
Yeah.
That's why I track stuff like that.
one of the comments here says, I've been living on edge of nothing for weeks now, and I'm just trying to remember my name, let alone what I did 5 seconds after trying to forget I'm a dead woman not walking.
A couple days ago, I missed my happy. Where did my happy go? No matter how long or hard I look, it's just gone. I'm beginning to think that happiness resides in the epidermis. Each seizure I have is just scraping off a little more happy, a chunk at a time. I don't know why I'm complaining. It's been this way for a very long time. I'll get over it sooner rather than later. Much love to all my sad homies. So I wouldn't, if you can make jokes in the post when you're complaining about how your happiness is gone, then just put
You're
that
not
energy
unhappy.
into, yeah, if you put whatever energy you have into, getting back on track with that happy. And this is somebody who maybe like remember doing things for other people can be a better way to, get out of your own
Sometimes intrusive
boo-hoo kind of
thoughts
time.
will get to you, though.
Say that one more time.
Sometimes intrusive thoughts will get to you.
Oh, yeah.
It does get rough when you're too critical of yourself for sure.
But I think that they are going in what you said, they're going in the right direction. They're making jokes. They're going to find new humor and new ways to smile.
All right, the comments are, you're definitely not alone. I've been thinking about this a lot lately. Seems like I'm losing a piece of myself, mainly my happiness, every seizure I have. Recently had one and just feel trapped in my head, but trying to keep it together for my family and hope you all feel the best.
I
Or
want to
hope you all
plug
the
in
best.
something.
Yeah, that's a good way of looking at it. What do you think, Toaster?
Not toast. Therapy. They both begin with a T. Therapy. CBT therapy is like the best at finding happy. I think everyone should have therapy.
I think I need therapy.
Another one of
It's
these
been hard.
comments too is saying, I'm with you. A lot of happiness has been turned into pain and anger. I'm slowly getting it back. CBT and forcing myself into hobbies that are doable has been a life changer. Easier said than done. Talked about it for months before. I hope things get better for you. You guys ever reflect on how long you're planning and brainstorming something before you actually went for it and everything got better? Like, why didn't I do that so much sooner kind of thing? Yes, absolutely. Has
All
that
the
happened for
time.
you guys? You think more this year or within the last couple months?
The last
I'm
year and a
trying
half.
to I'm trying to link like everything to lunar cycles now. I seriously believe in this.
Oh,
Mine is since about 2020. I've always been a procrastinator, but it's gotten way worse since
I
I've been home.
I chalk it up to ADHD. The procrastination's kind of the thing, and also the hopping from everything so nothing gets done.
Yeah, I have that problem too. And then there's I can just lay down next to a pile of work and take a nap.
Yes. This chair looks very nice.
It's too
That pile
easy
of
for me.
laundry that needs folded looks very nice and comfortable.
It's warm. It's just from the dryer.
Right. It'll feel really good on my sore neck.
Exactly.
I got one here. It says, do myoclonics worsen with age? I started having what my doctor thinks could be myoclonic seizures when I was a kid. The earliest I can remember was second grade. It began as a feeling of, in quote, something being off, something missing. A sort of deja vu and a strange, airy, yet electric feeling moving up from my stomach towards my feet. Hold on, moving up from my stomach towards my chest. And in addition to feeling generally space, it came and went as I aged and worsened. But as in, I started getting twitches alongside the feeling in middle school where they were quick chills. In high school, they were longer with a little shock. And as I entered adulthood, when it happened, my right arm and my right side of my body would suddenly jerk out of control. Now, at one tail end of my 20s, they happen 10 times more. Sometimes the in quote shock effects took my whole body. I drop things and make involuntary noise like a vocal reaction to a sudden shock. I can always feel them coming on, but it is normal. It is normal for this, isn't it? Normal for this to get worse. Alongside having migraines for the first time in my life, and sometimes the strange feeling that comes along before the jerking stretches out for hours, and I jerk for hours, and the jerk never what? I jerk for hours, and then the jerk never stops, and then it's 3 to 5 times within the hour. I have other weird and unpleasant symptoms, but I don't want to make this a long read. I'm on lamotrigine for bipolar, and symptoms do worsen if I miss a dose, but never fully subside. Is it because I'm becoming unpleasant? Do the myoclonics worsen with age? Was the question. I
Yes,
don't. They
can.
do.
It
It
sounds
sounds
like
like his seizures are just getting progressively bigger. Like mine started out with focals and then progressed into tonic-clonics.
mine have progressed some too.
At least we're pretty sure it started with focals because I was misdiagnosed for years.
Yeah, my clonics. I just thought for some reason I just thought I was just having random nerve twitches. That's what I thought it was. Didn't think anything of it. Um, yeah, I didn't take mine to
Have
be anything until someone on Reddit told me that's myoclonic. I was like, oh, well, now I can tell my doctor that this has been happening for this long. And
Kate says that we've heard of plenty evidence of medication not working long term either. So if you're continuing the same medicine, that might also the medicine's effectiveness might just be going away. I hope that never happens with me and Excopri.
some of the comments here. One says, mine have done the opposite. I used to have over 100 a day as I walked to and from school, but it is a good chunk less now. What has changed in the different ways they trigger? Used to be sunlight, now it's all sorts. Another comment here says, mine started around 13 to 14, then progressively got worse until I had my first TC at 16. They can definitely worsen if untreated, but if you've been having them for years and they're getting more intense, definitely go get that checked up on ASAP. One more. It says mine started at 19, but I did have a small episode when I was younger. I was also all right during my 20s, having 2 to 3 TCs a year, having 3 to 5 TCs a year. Right after I turned 30, they started getting worse, and I found a great neurologist, epileptologist in my area. It's starting to get more under control now, but I'm not stressed out as I was then. How bad are your myoclonics, Andrea?
I haven't even been diagnosed with myoclonics. I just suspect that I do because I have weird twitches, but I haven't really even talked to them about it.
Yeah.
So I don't know.
Yeah,
Mine
just,
Yeah.
are very small.
do you want to hear the epic going on with my sleep medication, my Ambien?
Go ahead.
Okay, so my neurologist took up my Ambien when I fled the coast last year. And she's been prescribing it for about a year now, and she sent a message saying, ask your um ask your primary to take up this medication. It's not really one that's in my purview. Okay, ask the primary. My primary says no. I'm going to refer you to a sleep specialist. It's like, oh, wonderful. Go back to my neurologist and like, hey, this is what's happening. Get a response back saying, yeah, by the way, did you realize you missed your appointment last week? I had an appointment last week. Even my mom was like, oh my God.
What happened to call for confirmation and things like
I
that?
know usually Duke is like calling and telling me every day.
For a month.
Yeah, it didn't happen. So I don't know how, but we have another one scheduled. I have a virtual one in 2 weeks. Uh, she wants to see me in person, but her earliest in-person appointment is in May.
But you get put on
Yeah.
the list of call for
Oh yeah,
cancel.
yeah.
I just got on that list and I just got a call. I think
But
I got one for next month
that's
instead
why
of it being in March.
I have I have a concoction of medications that I can manage life with pretty much, I think. I just want to, if I could just get someone to take my word that I do not sleep. But no, I'm going to have to do a mini EMU.
The sleep study?
Yeah, the sleep study.
I had one.
Just to prove that I don't sleep. But the worst part, I think, is they're in a sleep study. They will not let you have books, cell phones, anything to
Is it one
keep
of those
you
ambulatory ones that you're gonna wear around, or you go
No,
there?
I'm going
Oh,
to have to go there. I haven't actually even met with a specialist yet. I just know this is going to happen because this is what always happens. And those nights are the worst because all I can do is lay there and stare, and they're just so long. And I can't
At
stop
least they know
moving.
you can't sleep.
Yeah, I know. But the last one I had was actually up in Raleigh, and I swear I had one of the rudest nurse. They took it as an affront that I wasn't sleeping because it's like it's, it didn't have my medicines.
we have another one here saying legs not working for hours. I woke up fast and suddenly couldn't walk or talk and fell to the ground. I gained my speech back somewhat, but still couldn't hold myself up or lift my legs while lying down for about 7 hours. Anyone else experience something like this? I only experienced focals, but this is totally different than I remember ever experiencing. You wake up fast and couldn't walk or talk and fell to the ground. Okay, so you woke up fast, and if you fell that fast, then maybe you were stood up. Couldn't walk or
Yeah,
talk and fell to the ground. That's like one of those seizures that you have on the way out, like on the way when you're waking up.
but they do have drop seizures. I don't think I had enough information to specifically say it was a drop seizure or not, because the person are just saying they just got up. Um,
Well,
yeah,
after that, they make the point that I gained my speech back somewhat, but still couldn't hold myself up or lift my legs for 7 hours. 7 hours of not being able to move limbs definitely exceeds anything I've ever had in a seizure or ever heard of anyone having in a seizure. That's one I would have probably recommended a 911 on.
yeah. 34 and pregnant and experienced my second TC seizure. I'm 34. I'm 17 weeks pregnant. I just experienced my second tonic-clonic seizure in 2 weeks. 2 weeks ago, I crashed my car. Luckily, I was in a parking lot, so it wasn't anything big, and there was no clear witnesses, so we were not sure if it was a seizure. This one was in yoga class right at the end, and a doctor was in the class that could confirm it. So at the hospital, I started Keppra. I was originally hesitant because I thought my first episode was when I was heart related, and I also did not want to harm my body. I've also always been prone to PMS, migraines, and thought it could be hormonal. But after today, seeing my blood vessels popped around my eyes, bruised on my face, and bitten tongue, I can no longer be in denial and took a loading dose of Keppra. Anyone in a similar boat? Any advice? It's such a new scary diagnosis. I can't be pregnant, so I can't be a part of that conversation.
Both pregnancies, my seizures went down, but if that happens, why can't they have a spike? Hormones are weird.
Yeah, I'll just say that
Absolutely.
sucked.
My heart goes out to you. I hope your pregnancy ends well.
Try to find a doctor that specializes in something that handles that kind of thing.
Bright side is you get monthly pictures. Forgot what that's called.
Sonogram.
That thing.
That thing. Yeah, I didn't know what the name of it was, but there you go, monthly sonogram. Um, I'm assuming that's a good thing. To be honest, I don't know.
Yeah, so they check on fetal distress and formation.
High risk pregnancies get it more, right?
Yep. And
I
having
remember going to the
seizures
doctor.
would bump you up to high risk.
Sorry to hear that, ladies.
I thought it was kind of hilarious how nobody ever said anything about a natural birth to me. It was always just like first trimester, okay, let's schedule your C-section.
I
Did
ended up
both of
having
you
a
have
C.
did both of you have C-sections?
Uh, Jeffrey, it was an emergency C-section. And the other one was going to be.
Mine were two
Both
10-month C-sections.
Oh, wow, 10 months?
Yes.
big babies?
6 and 7. He was 6
That's
point
not
something.
that big.
Something. No,
Jeffrey was
not bad at all.
small.
Both of mine were one was 6.9, the other was 6.10.
Jeffrey was
And
6.9
you can remember those numbers. That's cool.
or 6 point something.
6.9.9 and 6.10.4.
Can remember it to the hundredth, to like the thousandth. What?
Yeah,
I
That's
don't remember
amazing.
what time they were born, but
Oh, whatever.
my mom remembers what time I was born. She
I
calls me.
remember
She
the
called
date.
me. She called me at 6 a.m. and I was
Aw.
asleep. And at
That's
that time,
adorable.
it was so late. I mean, so early that I didn't even know what day it was. I was just like, "All right, mom." She just as soon as I picked up, she's singing "Happy Birthday" at six
Oh,
a.m. So yeah, that's what happened. It was hilarious.
And some parents
I,
even remember the day of the week it was.
I
Yeah,
was born on a Monday. I think my daughter was born at like 9:30 something and my son about 11 something, but I'm not positive.
I was born on a Tuesday. Tuesdays. I hate Tuesdays. They're the worst day of the week.
Why?
Because they're still at the beginning of the week, but they're not Mondays where you have all that energy at the beginning of the week. I can do this. It's
That's
not
how you feel on a
Wednesday.
Monday?
Oh, it's not a Wednesday where it's like, okay, I can get over the hump. Thursday is tomorrow's Friday. Friday is Friday. Now I love Tuesdays though.
Friday is Friday.
Yeah.
I was born
You-
on the 35th week of the year on a Thursday.
Nice.
Uh,
He is 9 days younger than me.
so you were born uh, on a Tuesday.
Yes.
Okay. Wow.
That's why you're my little brother.
So I got a comment here. It says, "Talk to your OB."
OBGYN.
Oh, I was gonna say Obgyn. Okay. Yeah. OBGYN. Okay, I was trying to figure out how to pronounce it. And I was gonna say Obgyn.
It's an acronym.
Yeah, I see now.
But now that's a short.
Yeah. So talk to your OBGYN ASAP. This very well may be a hormonal issue. Also, they need to know about this and as soon as possible. Another comment here says, I did have my first TC when I was 14-ish weeks pregnant. I did ended up having three my whole pregnancy. I was put on the Lamictal and I only had three, after the pregnancy. But after the pregnancy, I had one. Everybody thought it was a hormone thing, but I have since been diagnosed with treatment resistant epilepsy, and I'm in the process of planning surgery. Though I will add, it turns out my in quote panic attacks for the last 12 plus years have been focals.
I said, welcome to the club. Happened to me too.
So that post about the one that was weak or numb for 7 hours, one of the comments is Todd's paralysis. And that's that thing they describe as a temporary post-seizure neurological condition characterized by weakness or paralysis that most often affects one side of the body. But get this, it also involves slurred speech or vision problems. So that's another, post-ictal, not common thing, but that's a post-ictal thing. Paralysis typically resolves on its own within 30 minutes or 36 hours. And it
Quite a
mimics a
range.
stroke. Yeah, mimics a stroke, considered benign, and a phenomenon that doesn't require specific treatment beyond rest and managing your seizures. Wow. How would they treat that? You treat it like you would have to treat it like a stroke, but then just come to the conclusion that you're all better on your own. So it must be the paralysis. I've never heard of this in epilepsy.
I gotta get my paralysis checked on.
How's yours doing?
Um, I need a new neurologist to check on it. I don't want to take things into my own hands ahead of time because I don't quite understand it. Um, yeah.
I mean, since this might not be, and I mean, what if they prescribe like physical therapy or something? Couldn't that be a PCP thing?
Mm.
Especially if it's like linked to the stroke?
So the thing about physical therapy, if it's not indoor at the hospital, then it might not work for me, being the distance between me and the hospital now. I'm not near my hospital. So, yeah, not being near the hospital is difficult because they might have programs for people who are in that area or something like that. You never know. Um, yeah, you never know with that. Because last time they tried to prescribe me for not prescribe me, give me a physical therapist for the after stroke care, and had to tell them that I'm not going to be in the area. So you guys are trying to refer me to only do this county, and did
I'm not
not.
there.
So I didn't get after stroke. I mean, after care, post stroke. Um, Everything I found on YouTube.
Yeah,
Um,
so now you're totally prepared to, for that next appointment. Whether they ask you the questions or not, this next one has to at least be able to, even if you don't vibe with them, they could give you the referrals that you need. You could still, I keep wanting to say like cash in the referrals, but you use that, at least get what you need, pharmacy to hold the prescription and or try the new medication, whatever you want. Get like a really strict plan on one of those new meds that you can, not new medication, but like a new medicine for you that you can try really gradually. And once they have that strict plan, that's what made me feel like I was finally making progress, is when they said for the next 2 weeks you take this, another prescription, or just like stop breaking it in half or something. They came up with like a really detailed plan of what to do, and then I didn't feel so, I don't know, kind of like having to do it on my own.
okay. Um, I do got something here. It says boyfriend trying to get his license. Hi, I'm not very familiar with posting on this Reddit or with this sub, so I don't know if this is the best place to ask, but my boyfriend is 22 and was diagnosed with epilepsy at 16. Due to his epilepsy and other circumstances, he hasn't been able to practice driving or apply for a permit until recently, as he is now 1 year seizure free. My question is, how exactly do you go about getting a permit or a license with epilepsy? I've tried looking online and found forums mention and Epilepsy Foundation mentions needing a hearing, but most information seems to be about drivers already with their license. I just can't seem to find any other clear answers for his situation, and I don't want him to go to the DMV and not have everything ready. We live in upstate New York, and any experience or advice with this would be super appreciated. Thank you. It depends on how far you live from the hospital. I mean, the DMV hospital. I used to live close to a DMV and go there for anything. Yeah,
Sounds like this one needs to get a medical professional involved. At least get like a doctor maybe to tell you that DMV driver's license, like that's just not the right route to go.
Yeah, the it sounds to me like his doctor's telling him it's okay though, because I mean I don't agree with it, and I don't think anybody should be driving if they're having seizures or have been diagnosed, but it seems like a lot of people are going to do it, but they're going to have to go through their neurologist for paperwork. I know that. And I would start there. Maybe they can answer any further questions. But I say don't drive. It's not safe. You never know when you're going to have another seizure, and your seizures can change at any moment in time.
right. Imagine, since I have wandering off seizures, imagine if I just drove off somewhere. That would be insane.
That
I
can
mean,
happen. That can
um,
easily happen.
Imagine if I was driving through the Kirby Mountain roads that were going like this through the hills and all of that, and I just went into the absence seizure that unconscious, and I totally don't remember it for about 15 minutes. And my son told me about it later. Like
so you're speaking
Yeah,
on
he's,
something that
just
happened
while you're
already,
driving,
right?
especially on those roads, those like really thin
I
roads.
wasn't
So,
driving, I was in the
oh, okay.
passenger seat,
Lucky.
but
Oh,
like crazy. He had to pull over in like some crazy spot, and he's like, "Yeah, a lot of people were really pissed off where I stopped, but you were tending to you having a seizure in the seat next to me was way more important to, I was off the road." So,
yeah, those are
but
the ones that I
yeah,
definitely feel bad for.
right. It's just like there's times like that. It's like, oh my God, if I would have been driving, how many people would I have hurt? Or, what would I have done? That's terrifying. Driving down the highway in a big SUV in, 70 miles an hour on the interstate during rush hour in a, you know, 4,000 pound SUV. It's just people do it all the time. It's crazy.
One of the comments here,
Sorry,
it
I
says,
ranted.
huh?
I said, sorry, I ranted.
That's what
No.
we all love.
Yeah, you learn something every time someone says something. I like
I'll
your
be here for a
hair.
little while.
I like the
I didn't
pigtails
see
too.
it's not pigtails.
No, I'm
It's
saying I like the
braids.
pigtails too from earlier. Oh no, you said those are braids?
Yeah, I just braid it. I just like split it on each side and I braid this side and I braid that side. That's it. That's
Oh,
why it's
wow.
all pretty and that's why it's all pretty and wavy
How long you
because
been
I had
growing
it.
your hair?
I stopped going and getting it cut regularly in 2020
Oh wow.
and it was probably about this long then. And now, well, I didn't go at all, I don't think I cut it at all for 2 or 3 years. And then now I'm at the point where I pretty much just go schedule a trim every about 6 months. But she cuts off like, a good chunk of it to get it healthy again when I go in. So
Do you even
I'm
bother
just cheap.
looking through the styling books to decide if you want some kind of like pattern cut in the back
No,
or always just a
she,
totally straight cut?
yeah, she has cut my hair for forever and she knows I'm going to wash it and I'm going to let it dry. I don't style it. I don't.
No framing the
No,
face or layers.
I did that when I worked a job and I had to. You want to know the one and only styling tool in my house?
Straightener? Blow dry? Oh, okay. Good old wide tooth comb. Can't go wrong.
I got one sitting right here next to me. I got one in my bathroom and I got one in my shower.
Got a comb for every room and every place.
Do
I
you have
don't
that many rescue meds spread out?
I don't have rescue meds.
Me either. I need to do that. I need to get that. Yeah, that's something I need to write down to get to my mother.
I just go unconscious. I've only had seizures with other people on 2 occasions.
Lucky you.
But if you're
No, I'm always by myself.
clear, well, if you're clearing
Uh,
up in between clusters, like during a cluster, I theorized in one of my notes that I could have gave myself the nasalium on this one, but the family that was around said that I was so positive that I didn't have a seizure just now.
I argue with everybody that I didn't
Exactly.
have a seizure. I didn't have a seizure. What are you talking about? They're like, yeah, you did. You just had a seizure. No, I didn't. I'm fine.
Unless the incontinence happens, then I'm saying no.
yeah.
I can't wait till I have one around my mom because her and I don't get along as it is. If I do that with her, it might get ugly.
I think I had a seizure this morning. I'm not sure. There was a lot of confusion.
Did you rest afterwards, at least before you got on here?
No, it was. It felt like in the beginning. In the beginning, I felt really confused, and I was just yeah, it was a little bit of everywhere in the beginning, and that's where I feel like I might have had something. You never know. Um, but I'm all right. It didn't graduate into a TC, luckily.
That's good. That's good.
Yeah, and you
Yeah.
got a time for it.
Say that again.
Sounds, I was saying it sounds like you're getting details for it too, like there was an approximate time and the length. It sounds like you said you know it wasn't like a long one or it definitely didn't get to a TC, so being able to tell kind of what happened from how you feel after is really good.
Yeah, it was just like in the beginning, like you guys noticed, like I was really like reading slow and just all over the place. Now I feel back to normal. What is normal these days?
You're normal. That's what we can go by. Somebody
I'm
else
sorry.
has having a problem here. They're saying epileptic. Does anyone have a problem with this term? I'm not keen on being called an epileptic person, but referred to as an epileptic is something I really don't like. It's like that's what I am or something, like it defines me. I would tell this patient, don't take it so personal. I don't know. Have you guys ever taken offense to that?
No,
I
but
don't.
and I don't take things like that offensively, but also I've dealt with people who took a lot of offense to the word epileptic, and yeah, I met someone on Reddit who didn't want to be friends with me anymore because I allowed someone to say epileptic in a comment and I didn't comment back, and yeah, this person was really disappointed. Yeah, Andrew, you're looking like what? Yeah,
Yeah,
it was that difficult.
somebody quit being your friend because somebody else said that to you.
Yes. Because I didn't comment back and let them know that it's not nice to say that. I should tell them they should say person with epilepsy. That's what she said. And she's like, I don't want to be your friend anymore.
People will reveal their true colors.
Yeah, that's a
And
very nice way to put what I had in my brain.
one of the comments with a lot of likes here is don't let it define you. But you are an epileptic, right? I am, so I don't mind when I'm called an epileptic. Just make sure to tell people how I get through life with epilepsy. Most people will look at you with strength, not weakness, if you present yourself well. It sucks being disabled, but don't let it define you.
I think the same
I'm a
is it's
teacher.
very similar with like the word disabled. A lot of people find being called disabled or, saying that they're disabled really bothers them, where other people, like, it doesn't bother them at all.
That's a
Yeah.
pretty easy tell of where they are on acceptance. Just
Well,
I've
overall
and
accepted.
confidence and self-appreciation or whatever you want to call it.
the stigma of the word as well is huge. But I don't know, I think there's kind of a lot of words like that across the board, and a lot of people have a lot of different feelings about them.
Personally, it doesn't bother me. And I told her that, the person that decided they'll never come on the podcast again. And yeah,
Still hope you're doing well.
yeah. Hope you're doing well if you're watching. So Sorry to say. What would you do, Andrea? If a friend told you, I'm not going to be your friend.
I would probably tell them that it's none of their business how, like, I let people talk to me. I mean, I don't know. I can't put into words right now what I have in my head, I guess. It's like it's not their place to tell you what to say, especially if they don't have epilepsy. It's just that's out of place. It's out of line, and as far as I'm concerned.
Got one that says night sweat or nocturnal seizures. I wake up a lot of days soaked in sweat, but my head and my body aren't sore like a seizure. Is this my epilepsy or just me not controlling my body temperature? I have never been able to control my body temperature in particular.
Especially at night, harder then.
Yeah,
Try cooler blankets, you know, or pajamas or whatever, and see if it helps.
yeah, I just
Because it
try not
doesn't
to.
sound like a seizure. It doesn't sound like a seizure to me, but
Might be the medication
yeah.
because I get night sweats quite a bit, and I always blame it on the medication. Um, yeah, I sweat so
Yeah,
much. Not every day, but yeah, it's like a
I
bad
used
some
to.
days. It's like which is
Yeah,
fun on some days where I'm just waking up and now I just
in a
sleep so much
puddle.
better. Yeah,
Are you
it's
guys
much.
ever suspicious of drinking more leading to like if you drink more water, it's easier for you to sweat?
I don't think so. It just makes me have to get up and pee more often.
Some of the comments here on the nocturnal night sweats, or it says night sweats or nocturnal seizures. A few of the comments here. One says, just it's not every night. Another one says, if you want to be sure, you should install the app Prime Sleep Recorder. I've been using it for years just to keep track of my nocturnal seizures and on to decide what medication doses are the best. You can re-listen to every noise during the recording and maybe find a pattern and whether they're nocturnals or not.
What's
There
it
you
called?
go. Take your notes and look for the pattern. Prime, it sounded like.
Um, Prime Sleep app. I mean, Prime Sleep Recorder app. Let me know what it is. On to the next question. Question about anesthetic. Hey gang, I have a planned surgery for once. Ha ha ha. Every other surgeries I've had were emergent, but this time it's elective. Just getting a just getting a pesky organ I don't need I do not need removed. My question is, how did you find anesthetic reacted with your seizures, if any at all? I did want to flip out. I don't want to flip out if my seizures start stacking up on me after being fairly under control lately. About anesthetic. I've gotten put under um, recently, and it didn't bother me. Yeah. How does anesthetic bother you guys if you get put under? And
Doesn't bother me at all. I've had like 15 surgeries and I'm a professional. They love it when I go in.
Medications is one of the triggers for me, so every time I've been within like 3 or 4 hours after, like I guess when it's almost done, that's when I'll have a grand mal. It was better after the RNS, like it was shorter, not so severe. all 3 or 4 times it was in I know after the RNS surgeries I wasn't at the hospital, but after the pregnancies I was. So like half the times it was in medical care, and they all agreed that it was shorter, less severe, and because of that.
Hey,
I
Angel.
really like,
Oh, go ahead, Andrea.
I was just gonna say I really like that white stuff they give you right when they roll you, right before they roll you in to
Yeah,
knock
then
you
they tell
out.
you, and they were telling me it's
Just,
gonna burn a little bit for a second, then it'll go away. And then they were
just
like, you're
count
gonna go.
backwards. I love it. Count backwards from 10 and you're like 10 and you're gone.
I think I just laughed, and they were like, "Are you all right?" And I was like, "Yeah, I'm all right." I was just like, "I know what's gonna happen," so I found it funny. They're just like, "Oh, okay." And yeah, I guess I didn't wind down as fast as everybody else because they asked me, "Am I all right?" a few times, and I was like, "Yeah, I'm good. I'm good. Yeah, I'm still
Sorry, I'll take
here."
a big deep breath.
Yeah, it's like I'm
You
still
weren't
here.
breathing
I'm
deep
still
enough.
awake. Angel, have you had any anesthetic? Have you had any procedures? Could you explain how it went?
I only had a biopsy. Sorry if it's loud.
It's not.
Yeah. Okay. Because I'm at a Burger King playground and the kids are being loud. Um, I had a biopsy for my liver and they gave me something then. I think the only other time they gave me something was when they gave me morphine to pop my shoulder back in when I dislocated it.
Yeah.
But yeah, I think the biopsy was the only thing close to a surgery that I can say that I can remember.
Okay. Yeah, this person is basically just looking ahead of time, I guess. Yeah, they're gonna get something planned and wanted to know whether to be worried or not and how. Yeah, you're not worried, right?
No, I don't think you should worry. I think, I mean, there's horror stories and everything, but then there's also good success stories too, you know. You don't know how anything's going to turn out. And worrying just pretty much lowers your threshold on seizures, if anything.
One of the comments here says propofol and most general anesthetics are very strong anticonvulsants. Your anesthesia provider, CAA or CRNA or anesthesiologist, is very knowledgeable about keeping you safe before, during, and after your procedure, just as long as they avoid flumazenol, flumazenol. Um, Kate, can you pronounce this for me? It's FLUMAZENIL.
How do they come up with this stuff?
It's a
Want to call it
benzodiazepine.
Romazicon?
Huh?
Brand name, the brand name is Romazicon or Anexate, but flumazenil, I guess is the
Flumazenil.
phonetic pronunciation. It's a benzo.
Yeah. It says it's a benzodiazepine reversal agent, which they will. You'll be fine. Uh, some of these medication names, like, yeah, like Andrea said, where do they get these from?
Apparently,
Let's
that's
just
something they give
jumble
you
up
if you
the
OD
alpha.
on a benzo.
They just throw them all in a sack and shake it up and grab some out and throw them on the. And let's put them in order. That's what we're gonna name this one.
Who put that in the bag, in the sack? 'Cause
It's like Scrabble, but they just make it up as they go.
we're gonna give you 6 letters and make a medication name.
No, it's not 6. It's got to be like 15.
Mm.
You got to have like 5 syllables.
Yeah, it could be a lot of syllables, but I'm saying,
There's probably rolling the
oh,
dice in there somewhere for more
And it's
Add a
gotta
A E
end
syllable.
I O
with,
U A E I O U whatever I'm going for.
Vowel. Vowels.
and
Thank you.
it's gotta
Add
end
a
with the
vowel.
AM.
yeah.
Is it like Wheel of Fortune? You could buy a vowel.
Yeah, and like your currencies, how many seizures you have.
There are a couple more comments here. One says, I had my gallbladder removed last year, no side effects. Seizure wise, best due. But due to the time of my surgery, it was I was able to take all my medication at the usual times. Maybe worth mentioning this to your surgical team. I have no related problems related to my epilepsy during or after surgery. And everybody else here just says I had no problems, bunch of surgeries. Yeah.
I was never had any problems with my meds. I just was they always do the like pre-check-in stuff and go over everything and all of that ahead of time and talk to them and make sure you know, like, this is the meds I really have to take because it's my seizure meds. And they'll, they always let me take those at least, even in the morning when I wasn't supposed to eat or drink anything because of anesthesia. They just told me, a little sip of water, not just a whole glass of water type thing.
I read something on a post that I put. I posted something that it said about like if you were to miss a dose, and it's like since I take my pills at 10 p.m. If I was to miss a dose and then I remembered at like 7 p.m. or 5 p.m., do you wait till the next dose or do you take that and then still take it at the 10? Um, Somebody just told me that my medication, if I do that and I double dose, it could mess me up. And I didn't know that because I've double dosed quite a bit. Some just in case doses when I can't remember. Then he specifically said my medication in particular could be really bad double dosing. You guys ever been told that?
I think with the clobazam, the controlled substance, I asked it of the pharmacist though, not the doctor.
Hmm.
Yeah, I talk to the pharmacist about my meds more than I do the doctors because I feel like they're a lot more educated than the doctors are. The doctors don't have a clue. They think they do, but the pharmacists are the ones that really know what's going on and they know all the rest of your meds too. So,
Yeah, I need to get my doctor on deck. Um, Got another post here. It says apparently I had a seizure. Um, I'm not sure how to make that a question, but there's question marks after that. It says apparently I had a seizure. Question mark. I'm not sure. Also another question. Bit of a rant as well as a question. Sorry. So yesterday I was doing something, not exactly sure what I was doing since I have a horrible memory, lol, and my sisters freaked out because I had apparently started drooling and had that outer space look and ran to my mom screaming. End quote. I think she's having another focal. And they both shoved a pill in my mouth an hour before I take it. And the thing is, I felt fine. I mean, I really felt fine. I didn't lose consciousness. I was well aware of my surroundings. So, yeah, not sure when I'm actually having one because I space out a lot. Another thing is, so I have two molars I need to get rid of. I need anesthesia to get both of them out, and they don't want to send me into an attack by stressing me out when they do that. Currently taking two pain meds to help with my tooth pain, tramadol and penicillin. I just read a bit ago that tramadol reduces the effect of my epilepsy med will have on me. like unsure how to explain it. It makes it risky. But my doctor gave me the meds for pain, so I don't know if I can still take this or not.
My first comments is tramadol I wouldn't probably take because it's saying it lowers your seizure threshold. You need to talk to your doctors and have them prescribe you something different. And the other one is not a pain medication. It is an antibiotic to keep you from getting an infection or to fight an infection that you already have.
I
So,
like
in
that answer.
essence, you need to go back to your doctor and your pharmacist because if tramadol and your seizure meds do not get along, and it is very high likelihood that you could have more seizures because if you take the tramadol, it will lower your seizure threshold.
You give great advice because I just learned something.
For once in a moment, my brain worked and put it all together.
Perfect timing. Um, there is a comment here. One says, regarding the medication part, talk to your pharmacist about possible interactions with the two medications. My first neuro told me a certain med was fine to take with my anticonvulsant, but it actually wasn't. Never be afraid to ask for multiple opinions when it comes to your health and medication. Yeah, I'm never afraid to ask for second opinions. Sometimes I go best to three. Um, yeah, these days you can't just listen to one doctor.
Epilepsy Foundation saying acetaminophen, the Tylenols are the safest for epilepsy patients.
Wait, say that one more time.
The Epilepsy Foundation is recommending that acetaminophen, Tylenol is the safest medication for aches and pains.
Something tells me the Tylenol's not cutting it for this tooth, which is why they gave him the tramadol
Yeah,
or
because they're not
Toradol
supposed
or
to take
whatever it is.
hydrocodone.
Mm.
Yeah, I think they gave me Lortabs and or Percocets after my hysterectomy.
I
Yeah,
think
but
that's why they gave
specifically
me morphine.
tramadol, they're definitely saying should be avoided by patients with epilepsy or susceptible to seizures unless there are compelling circumstances. So
I've
unless you
wondered,
really need it.
I've always wondered if my long-term opiate use is part of the reason that I have seizures because after I quit taking all of the pills is when I started having the seizures.
Mm.
That can't be a coincidence.
Or it could be, that maybe all of the opiates that I was on was, just calming my brain enough that I wasn't having the seizures.
Possibly.
Who knows? I don't know. Weird.
All we can do is experiment on ourselves now.
Yeah. I don't take them now.
We can
Like
pride
unless
ourselves.
even when they cut out organs, I think I took two of my pain pills when I got home. Heating pad worked
Nice.
just fine. Just don't do much and use the heating pad. That was all right.
You're in Kansas, aren't you?
I am stuck in the middle of nowhere.
All right, so you can relate when I read this post. It says driving
Try.
in Kansas with epilepsy.
Driving in Kansas? Good luck.
It says I had my second seizure 5 months ago with a head injury. First one was 2 years ago. I was told the other day that you need to report your seizures to the DMV. I've never been told that by my doctor or NP, who has treated me for my seizure or injuries. I was only ever told not to drive for 6 months. So my first time I had a seizure, my driver's license was up to date the whole time. This time, my license expired during my seizure period. I'm on 1,500 milligrams of Keppra XR and 60 milligrams of Prozac. Both seizures were on days I had very minimal sleep, lots of physical and mental exercise, and had forgotten to take my medication. I started taking Keppra after my first seizure. First was a TC, second was unobserved with head injury, both complete loss of consciousness. My neurologist has communicated to me that we believe sleep deprivation and overexertion was the cause of both seizures. EEGs without hyperventilating show normal activity opposed to EEG when I was hyperventilating. What is the best advice you guys can give me for what to do next month rolls around? How should I go about renewing my license? Personally, I don't think you should. I think you should just
You
like
cannot renew your license in the state of Kansas.
you can't.
Nope. There is a question you have to answer at the DMV that asks you, have you had a seizure within the last 6 months? And if you answer yes, I'm sorry, we will not issue you a driver's license. Here is your state identification card. They did it to me in January. And in order to get your driver's license back, you have to get paperwork from the state medical board, and you have to take it to your neurologist and any doctor that is prescribing you medication and your eye doctor and get all of them to sign those forms saying that you are fit to drive. Then you have to go to the DMV with your own vehicle and take a driving test, and then you can get your driver's license back. And that's after you've been free for 6 months, of course, at least.
So this post could celebrate how long they've been seizure free, all the good data they've gotten in the meantime, for knowing what their triggers are, and take it from there
Yes,
on making arrangements,
absolutely. I would highly recommend
acquiring a
finding
support system.
a support system, and transportation means other than driving yourself because you cannot do so legally or safely at all. Do not risk it. It's not worth your life or the lives of anybody else. Yes, it's a major pain in the ass, but that inconvenience and pain in the ass is not worth taking someone's life.
You know
I'm
something?
having some good rants today.
Does anyone else have facial tingling? Hi, I'm 28-year-old female with generalized focal epilepsy. I have had tingling, light electric shock sensation on my left cheekbone for about 15 years now. It's not constant and it doesn't hurt, but it's pretty annoying. My doctor diagnosed with trigeminal neuralgia.
Trimengal. I think it's like
Trimental?
trimengal. I think it's trimengal neuralgia or something like that.
Trimental
Might be
neuralgia.
trimenial. I'm not sure. I'm not
Okay.
sure exactly how to pronounce it, but
I like your pronunciation better than mine. Um,
Trigonometry.
my doctor diagnosed me with trimental neuralgia for this about 10 years ago. Last December, I noticed that this tingling electric shock sensation in my left cheekbone rapidly began spreading all over my entire face. This obviously concerned me, so I made a doctor's appointment to discuss it. Well, the night before that doctor's appointment, I ended up in the ER after experiencing my first grand mal. Since then, I was diagnosed with focal epilepsy, and I have seen a barrage of doctors. Yet every single doctor, even the neuros, have all dismissed my facial tingling as, in quote, unrelated. How? I refuse to believe it was just coincidence that my facial tingling suddenly spread from my face to my left cheekbone to my entire face right before I had a grand mal. I don't understand. Every single doctor has dismissed me and said I was not epilepsy related. Does anyone else experienced anything similar? If so, what kind of epilepsy do you have? There are only 3 comments. And one says, as a child, yes, mostly all of my seizures started as tingling feeling in my cheeks, usually right hand side. This eventually changed after puberty. You guys have anything similar to that? I don't have any facial tingling that I can remember personally. The ringing of the ears, they didn't say, but that I do get.
I have ringing and weird ear shit going on, but the only tingling I get's like in my arms and stuff. It's not in my face.
What's
Um,
the king got to say on this one, Angel? You ever get
Yeah,
any facial tingling here?
No, just I don't recall any facial except for tooth tooth problems. That's about it.
Well, apparently facial tingling is associated with epilepsy, a part of benign Rolandic epilepsy, BRE, a type of focal seizure that commonly affects children involving the face and tongue. It can also be a symptom of other focal seizures, like those originating in the frontal lobe or parietal lobe, or Jacksonian seizures. These ones are associated by, or they're characterized by tingling, numbness, or twitching in the face or mouth, and may include other symptoms like the drooling or difficulty speaking. But yeah, that is a type of epilepsy. And to say that it's and from seizures originating in the frontal or parietal, then those are pretty big brain lobes. It sounds like if one of the doctors, I think in the post, they said we're trying to convince them that it wasn't associated with the trigeminal neuralgia.
yeah,
And it looks like when it is associated with the neuralgia, then that right after their face tingles, it'll be painful. So if there's no severe facial pain, then maybe that does point in the direction of an aura for a seizure.
yeah, they were asking, yeah, if that had anything to do with their generalized focal epilepsy. Another comment here. One says, my tongue tingles every day. My hands and individual fingers will from time to time. It's all caused by my insular epilepsy, confirmed via SEEG. I just learned a new type of epilepsy.
I've heard of it. Don't really know anything about it though.
Got it. Insular epilepsy is a form of epilepsy originating from the insular cortex characterized by diverse seizures and complex clinical features, making diagnosis and treatment challenging. I mean, is there a certain type of seizure you have when you have insular seizures?
Sounds like all kinds
It
from that
says
description.
insular epilepsy arises from the insula, a region of the brain located deep within the lateral sulcus, um, often referred to as the fifth lobe of the brain. This area is involved in various functions, including sensory processing, autonomic control, and emotional regulation. Seizures originating from insula can present with a wide range of symptoms, making them difficult to distinguish from seizures arising from other regions of the brain.
Yeah, so overall difficult to diagnose. Throat constriction, painful sensations, those autonomic changes, like you said, heart rate and goosebumps. And that's why they're so difficult to diagnose because the cortex of the brain is such a deep part. That's why they have to get that SEEG to go under your skull and be able to pick up such a deep focal point.
Did you have that done?
Yeah.
Did it hurt? Like, was it bad to get done?
SEEG, I didn't take notes on, so I really don't remember.
You don't
I know,
remember?
yeah, I know there were no major complications from any of the year before RNS when they were doing all the diagnostic stuff. But it definitely got to be a blur, all the inpatient EEGs and then the SEG and yeah, waiting on insurance to get the results and say it's okay.
Be right back.
That was annoying.
I'm just getting ready to go into all of this testing. I was just like, oh my God, I hear about all these tests. I wonder what the hell they're gonna want me to do.
Well, here we
You
are
know,
5 years later and no regrets. So you can look at it like that.
I'm glad to hear all of the great stories. Honestly, it's made me feel a lot better about deciding to do all of this
Can't you see
because
this as like a time of transition for you? Like something kind of light at the end of the
it
tunnel?
scares the shit out of me. It's what it does.
I got one here. It says hormone therapy. I did not read it ahead of time, and it is quite long. So hold on to your seats. I was going to say ladies and gentlemen, but it's just two ladies here. It says, and hormone therapy. I'm in perimenopause, 49, and so far I had no symptoms other than insomnia. But then with lamotrigine, I never slept well, and it's only getting worse in the past few years. I'm being extra careful and took advantage of some downtime in between contracts I'm consulting to do literally more than 100 tests. Yes, 81 were items in the blood work, and I didn't even know such number was possible. Everything all right, liver included. Lamotrigine plus benzos was worried. High cholesterol, but in 6 weeks with pitavastatin, I went from 300 to 200 with no muscle pains. Also check my heart in every possible way: blood pressure, abdomen, ears, throat, and nose, bone density, lady parts, etc. The only thing I did was an EEG, which was ironic, but those never show anything. I'm averaging 1 to 2 tonics per year, so it's not perfect, but I do prefer to increase the dosage. The OBGYN gave me some cream with estradiol. These are
I think it's
ESTRAD.
like estrogen.
Yeah, it's like a synthetic estrogen, I think.
Okay. So I'm assuming it's something lady like. Um,
Yes.
okay, the OBG gave me the whatever the extra something is to use every night. They lower threshold for seizures and progesterone pills for 10 consecutive days each month, and those increase the threshold. So you see they're supposedly balancing each other out, but the 20 days where I don't take progesterone, I get afraid of seizing. So much so that I agreed with the doctor to use half a dosage for a month and then titrate. She was okay with that. That was 2 months ago. I'm glad I started this because the scientific literature now says that you don't have to wait for full menopause because symptoms start earlier anyway. The ideally, you never allow your hormone levels to reach rock bottom to then make them rise. By the way, my seizures, TCs, were never correlated to periods, so not catamenial. I like to hear about experiences of ladies in the same position. What did HRT change for you, brain activity wise, and anything else? When did you start your HRT, and did it interfere with your meds? Did they give you any more energy? I'm still waiting on one. Lamotrigine makes me so tired.
I never had hormone replacement therapy, but that's probably just always going to be ill-advised for me because of the catamenial, and we know medication and hormonal fluctuations are definitely a trigger for me. But it was an option after the tubal ligations. They said that you could always go full hysterectomy and um, do the hormone replacement therapy, and that's pretty much what turn me off from it. Did you ever do any HRT before or after epilepsy? Okay. It looks like that's used by individuals with epilepsy, but it requires careful consideration due to potential side effects on seizure control. So the OB and the neurologist would definitely have to be on the same page with that, agreeing what to do with the patient's medication when they start and, how gradual. Maybe they would make it more gradual for an epileptic patient just to see how it affects their seizures. Start at a lower dose kind of thing.
There is one comment here. It says, I have no relevant experience, and I know you said your seizures are not catamenial, but there is catamenial universe. Might have a higher concentration of people to chime in. It's a smaller sub, but a lot of people there are navigating HRT and epilepsy.
Good recommendation.
Yeah, check out that catamenial universe. Got something that says, does anyone relate? I've had epilepsy since I was 10. It started with absent seizures, like a lot of them. I have then absolutely no memory of my life from the ages 10 to 13. I don't know if it's because of the epilepsy or because of something that happened to me at that time. Has this happened to anyone else? There are little bits and pieces of the story that I've lived that I don't remember. There are then a lot of stories that I do remember, though. So I don't know what I don't remember until someone asks me about it, and then I say I don't remember that. But otherwise, I have decent memory that I know of. I mean, that I can remember. Um, yeah, but there are some things that, like I said, there are some things where I'm sitting there like, what is it? What is it? I know it, and then I end up not being able to remember, and then end up forgetting what I'm talking about, so I can't describe it to people. Yeah, it's quite difficult.
I'll still look at it as a benefit because I can watch when we talked about Kill Bill the other night, I watched both of them like it was the first time. I didn't memorize any lines. I didn't like any of it down, but I know I've seen those movies 100 times. And same thing, Reasonable Doubt on Hulu. I'm watching the whole thing all over again, and like it's the first time. I don't know what's gonna happen yet, and I know I just watched it like last year. Oh
The
yeah,
good thing,
memory
the
loss
good
you
thing
can still
about
use to your benefit.
Amazon. Say that again.
I was saying we can all use the memory loss to our benefit, never having to like buy more stuff
Mm.
for entertainment.
I watch the same shows all the time. And I think the thing that bugs me the most about like when it comes to remembering my past is like when my daughter or my son or somebody's like, you remember, hey mom, you remember when blah 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 or whatever. And I'm just like, nope, sorry, I don't. Tell me all about it. Because I do not remember it at all. And it's like I feel awful because I don't remember, but I don't remember.
Um,
We're gonna hear a lot of that around the holidays.
Well, and sometimes it's like if they start talking about it, I'll like, oh, I do kind of remember something about that, but I don't remember the details. I just remember bits and pieces as they tell me. There's no way I could tell them like what happened. It's just familiar when they tell it to me.
Like you can't tell if that's your memory or if that's them telling the story again. Like maybe I just heard you say, tell this 6 months ago or last year, whenever the last gathering was.
Right. Did you tell me this last week?
Yeah, is this
I'm,
how you met? Like something you tell me every time we talk?
how many times do you scroll back through your text messages to see if you already told somebody something?
I hate how you have to like you can't search. Like Control S is the or Control F is the shortcut for find on an email or like on a desktop, and I can't use something like that on the text messages on this stupid iPhone. I can't figure out how to search a keyword in this like millions of messages of like, do you already know? Yeah, that's annoying.
you guys got any memories? Well, Any memories that you don't remember is basically what it's asking. I can relate to not remembering things around the age of anything before 20 can get a little fuzzy. But I believe in between 20 and now, kind of more there than my earlier childhood.
But that's impressive because it
You
sounds like
really
your brain
cracked me up.
adapted.
Say that again.
I was saying that's
As-
amazing because it sounds like your brain adapted. Like your memory got better.
Um, it's just like childhood memories. Somebody would have to remind me, and then I might be like, "Oh yeah." But other than that, there's a lot of stuff I do not remember enough to just bring it up and be like, "Oh, talk about a certain story or anything." But yeah, it's there if someone tries to get a memory out of me, and I could probably, yeah.
That's
But
a
there
big
also
deal.
is, there's a lot of times lately my mother's been asking me stuff, do I remember? And then I was gonna tell her, I think you're tripping, but I could be tripping, so I don't know what to say. Sometimes I'm like, I think I know if I've been through this, but I don't want to argue with you because you might know better. But yeah, there's some things that my mother was telling me that I wanted to say. I think you're tripping. I think you got some times missed up.
You can totally test family members by asking about like, okay, if you have like a scar that's pretty easily recognizable and you've heard a million times, you know how they told you got it once upon a time. But those same family members change their own stories, whether or not they realize it. So you could kind of throw that out there as a test question. You know what her answer would be to this question. Ask it again. See if her answer changes, then that's a better indicator of how often they might be coming up with things that didn't really happen that way. But we're always going to be taken for less reliable when it comes to looking back.
I had a whole
Why?
wardrobe
Okay,
at my mom's house.
did it still fit?
Yeah. Um, yeah, I forgot all the clothes that I left here because I got on the train and came down here and then end up getting back in an Uber and the car didn't have enough space for me and my children's clothes, so I left a whole lot of clothes. And now that I'm back here, a lot of these clothes I've been looking for. I did not know they were here. I got like two huge duffel bags of clothes and clean stuff that I just forgot was here. A pair of
Oh, your
shoes that I've been
signature
looking
outfit's
for.
coming back to you.
Yeah, it's like these Jordans. Like I didn't know where these were. I didn't know they were even down here. I gave up on them. I thought I left them at someone's house. I don't know how I lose shoes.
But now they're wiped down and brand new.
And I wiped down, but they're new. I mean, they feel good on the feet, so I guess that's all that matters. But yeah, I'm finding stuff. You guys ever leave stuff at someone's house and then didn't remember until you found it?
I'd have to go to someone's house first.
Yeah, it was that way with mother keeping my keepsakes, but for the most part, she got rid of all the teenage stuff after the, fell out of touch thing. She still has teeth though, baby teeth.
My mom still has a bunch of crap in her basement, of course, from, growing up and this and that and whatever. That was mine. But I probably don't need any of it at this point because I don't even know what's in there and haven't looked at any of it in about, a couple decades at least.
More likely arts and crafts than like extra socks.
She's got like my grade card from kindergarten.
Your attendance award or something.
I'm not kidding. She will. Every award I ever got. She has a file cabinet as tall as me.
That is love. There's something she
Exactly
remembers
what I was
good
about to
about
say. That's
those.
love right there.
There's something that
She's
she likes about those that made her keep them.
and she's a very much organized person that is worked in compliance.
Is she a hoarder?
Oh no, not at all. But by God, if there's papers on her table, her house is destroyed, in her opinion.
Ever go to sleep with dishes in the sink, I bet.
No, as soon as you're done eating dinner, you get up and you do the dishes, clean the
Mm.
whole kitchen, wipe down all the counters, you
The
change all the sheets,
the
do all
door
the
frames
laundry,
and the fans every
dust,
time.
you dust, vacuum everything every weekend, wash all the bathrooms every Saturday and Sunday.
Don't you dare call the floors clean unless you went over them 3 times.
I'll bet they mop twice a week. I bet you she mows probably twice a week.
And then during COVID, you had to do all that with the Clorox.
I don't know. I stayed home.
Yeah, then it was just like all different chemicals, more germ killing and more bleach stuff.
Oh no, she's on the no chemical, some really expensive. All you got to use is water, some special. I don't know.
Yeah, I
It's
don't know.
magic.
Of course. It's probably some kind of glorified dish soap.
It's magic.
Were you guys one of those people to go on trips and vacations during the pandemic?
Once on quarantine,
I did
because
not.
Florida left stuff open.
Yeah, someone got my grandma sick. I think it was another family member. Well, I know it was another family member, but recently he said that someone had got him sick because they had just went on a vacation. So then I was like, yeah, my
Well,
grandma
let's put it
passed.
this way. Let's put it this way. I'm so sorry.
It's all right.
Um, I stayed home and I never got COVID, and the family members that go get on the planes and go jumping all over the country to visit this grandkid and this grandkid and this child and that child. She had COVID 7 times.
Um,
Talk about careless. AJ says, yes, I did. During that time, I left the house most often. So what was the result on catching COVID? You feel like you got sick more often because you went out more often?
for some reason, I stayed in way more often than I've ever done in my life. Um, I had just got into a relationship like early in the beginning, and then I stayed in the house a lot after that, and had way more on the list than I'd want to admit. Like I was having like six, maybe eight, 6 to 8 a year, which is really high for me. Um, yeah, it was closer to 8, but sometimes it was 6. And yeah, my mom, I used to tell my mom and my dad, I used to be like, it's her. It's not COVID, it's her.
So you
Uh,
did actually quarantine with the new girl.
yeah,
Oh, wow.
I moved in with her and her kid. And yeah, they both got it, I believe. And I quarantined with them.
AJ is saying, nope, in my case, I did get COVID and treated with vitamin C. So even though AJ went out more often during that time, you get COVID and treated with vitamin C. In that case, and that you didn't catch it like 7 different times, different strains or whatever.
I got one here, you guys. For some reason, I want some chocolate. Um, yeah, I don't know where I get these urges from. But I have something here. It
Make note of
says,
the urge too.
oh, think that could be triggering. Um,
You never know.
we'll see. Got something here that says, help, advice. The sister of someone with epilepsy. Hello, I'm pretty sure my sister is in the state of psychosis, probably due to a seizure. I'm super scared to take her to the hospital because last time they didn't really understand and transfer her to a psychiatrist facility. The ER hospital staff was abusive with her as well. So I'm pretty traumatized from the experience. And if I'm traumatized, I know she's probably more so. Any advice how to get her back to normal? I gotta look up the word psychosis because I actually don't know what that means.
So she was in psychosis during a seizure, after a seizure, they said?
Let's
AJ
see.
says time, it takes time. Post-seizure psychosis is a rare psychiatric condition that occurs after a seizure and involves symptoms like hallucinations, delusions, agitation, often appearing hours or days after a seizure. So this can hit you even days after the seizure. AJ went through that saying it felt like shit. How long did it happen after the seizure for you? I couldn't imagine somebody having delusions and being so agitated, possibly days after a seizure. Happens more often in patients with drug-resistant epilepsy. 3 days after the seizure is when you got psychosis. Wow. Lasted for 2 months. That's ridiculous.
AJ, you
Really
gotta
just
come on and tell me this story, man.
yeah, please.
I need the story. Timeline. Your stories are amazing. How you're alive, man. You tell me some stories and I'm be like, wow. Like a lot of them I'm like, how'd you make it through? You are resilient.
I have no idea. I just did one day by one.
Some posts in 2006 said that post-ictal psychosis is common. AJ, did you know anybody else that ever had this, or did your doctor tell you maybe this happens? Like, don't think of this as rare?
I actually did not spoke with my doctor about this, but oh yes, I did, and I was like, I have no idea what's going on with my mind. Pretty much, I was I was in a state of mind where um I was swearing a lot. I was in divine stuff, and I was going nuts because I was constantly thinking that I was doing something wrong, but I was not aware of what I was doing. And I was swearing and believing I did a blasphemy. And I was pretty scared.
Seriously, so was there a psychiatrist more handling the treatment for the psychosis?
No, I went to my neurologist and told him about my symptoms, and he said it's normal and you just have to keep your values in the right place and never fall from them, or like, I don't know, just how it was.
So they reassured your morals. They spoke, like talked you through it, or were you actually provided some
Um,
kind of treatment plan?
he, I believe he changed my treatment and increased my doses. He was like, okay, we can no longer wait. You must initiate the treatment with Xcopri and we will see. I'm still experiencing some episodes, but it's not like that.
So in that state of mind, was the transition on medication done inpatient? Or did they send you home with the new meds and just, keep us posted kind of thing?
Um, yeah, the second one. I mean, it's pretty awkward or weird the way our system is working. I'm still trying to figure it
I
out.
bet, because when you're in that state of mind, you're a danger to yourself.
Yeah, I was.
So
I
it's like
had
benzos to short-term treatment typically involves benzos and low-dose antipsychotic medications too.
I had a period of time when I was getting some rage moves, and I was like, I don't know what's going on. I was like capable of murdering my mother, and I was hearing voices that told me that I should kill her, and I was like, no, I don't want to do that. I love her. It was pretty rough, and I was hearing voices and voices and voices.
And at this point, all you can tell about that time period when the psychosis was induced was what medications you were on and what doses, but you have no other to do to avoid psychosis anymore.
I don't know.
Like, are they recommending that you just never take those meds again, or?
In that
I'm
period
seeing
of
here
time,
that they say insomnia are a sign of psychosis.
In that period of time, I was taking Zonegran, and I developed the Tourette syndrome. So I believe it was something because of it, or because everything in my body was not working. So yeah,
Yeah,
my
go figure.
brain was
Psychosis
affected.
is one of the side effects listed for zonisamide, Zonegran.
Oh, I did not know that.
Irritability, hostility, paranoia, isolative behavior, so just like withdrawing from others, intrusive, experiencing those intrusive thoughts, and
Yeah,
mental and cognitive changes.
I'm still recovering from that.
All right, so we watch out for the Zonegran.
You ever took that Zonogram?
Yes, I took it for 2 years, and
Yeah,
last
that
3
was one of the
months
ones that was
were
supposed to be safer
the
for
worst.
pregnancy too. So it was like the higher dose of the Zonegran that got.
I can't hear you.
Oh,
Can
sorry.
you
Did
repeat?
did did the psychosis get worse the more Zonegran you took?
Um, Actually, it's a funny story. I was on the highest dose, 300, and I went to my ex-neurologist and told her I'm not okay, and she was like, "Oh, you don't have seizure, you have PNS," and I was okay. And what I should do? She said, "Stop the treatment immediately and never take it." And I was not okay with that. She lowered my doses to 100, and eventually my medical situation worsened in like 1 month, and I had the doses, and the situation got worse and worse and worse, but I was not aware. And eventually I stopped the treatment because I suspected it was giving me Tourette syndrome. And once I stopped it, everything went to normal.
You said Dravet syndrome?
Yes, Tourette syndrome.
What is that? I heard of it, I believe.
It's when your lymph nodes are swollen and your spleen and liver are affected. It starts to hurt really bad. And I also experienced bone pain, like severe bone pain. And I was having some rash on my skin that was itching, and I was prone to bleeding.
Yeah, it says Dravet syndrome, previously known as severe myoclonic epilepsy of infancy, is a genetic disorder that leads to catastrophic epilepsy. It typically manifests in the first year of life, often triggered by fever or high temperatures. The condition is associated with mutation of the SCN1A gene, which affects sodium channels in the brain, leading to abnormal electrical activity and seizures. I'm sorry to hear you're dealing with that. Um,
Yeah. Um, about what you read? Read about what? The Dravet syndrome?
it says Dravet syndrome.
Oh, I don't have the Dravet syndrome. I had Dravet syndrome. It's an
Oh,
allergic reaction.
Dress.
Yes.
Okay. I was gonna say that is Dravet syndrome is
No, I
serious,
don't have.
and that didn't sound good. Dress syndrome, drug reaction with there's a,
Systemic failure.
there you go. There's another word. It's I don't know how to pronounce it. Drug reaction with EOSINOPHILIA. Um,
I
yeah,
forgot the first two letters, so I don't know how it's pronounced.
it's EOSSINOPHILA. Dress
My brain is not
is
braining.
I don't know how to pronounce that. Eosinophilia.
Ah, yes, yes. It's something that affects your white blood cells in your body.
Eosinophilia
Yes,
is a
these blood cells are the reaction when they get multiplied when you have a reaction like allergy in your body.
okay. This is a severe hypersensitive reaction to certain medication characterized by a combination of skin rash, fever, multi-organ involvement. Um, Serious drug hypersensitivity reaction typically occurs 2 to 8 weeks after exposure to triggering medication. It is classified as a severe cutaneous adverse reaction and can lead to significant morbidity or mortality. The condition is characterized by following symptoms. Yeah, I learn something new every day. Skin rash, fever, eosinophilia, lymphadenopathy, swollen lymph nodes, basically. Yeah, multi-organ involvement. This includes liver, kidneys, lung, and heart.
Oh yeah, I forgot about those.
Huh?
I forgot about kidneys and heart.
Liver and the lungs and the
Yeah,
heart.
and liver.
Is there like medication to help you get through with that?
I mean, steroids. I mean, from what I've heard, or stopping immediately the treatment, which was my um solution. But I believe I should seek a doctor because I'm still having symptoms. Not so worse, but they're still there.
Back to the post. There is some comments here. I'll read one. One says, one that's saying help for advice with a sister with someone with epilepsy. One says that's the joy of the community at large, believing epilepsy and seizures are mental disorders and or possession by demons. I've had such happen to me as well and have also had wonderful treatment. The ER in the United States has become a repository for those who can't afford basic care yet, still need to be kept from dying. I am one of those, so I have just accepted my fate that I won't get proper care because I am not well off. Another comment here says, in an ideal situation, you would be her neurologist. HIPAA forms or equivalent for outside the U.S. that would allow you to contact the neurologist and let the neurologist give you guidance. The neurologist will also be able to give a hospital a heads up so that your sister is treated properly. I'll go ahead and say that you or someone she trusts needs to be put in the neurologist files to give this authorization in the future events. You can still contact the neurologist office and kind of hope someone overlooks the HIPAA laws and gives you a guidance or speak with a in quote hypothetical sense and see if it gets you somewhere. I work in the medical field, so I can say that in these situations, if there is something staff can do, they will. I don't believe that one. But anyhow, the rest of it says, so don't be afraid to call, but ultimately your sister needs medical help and may need to go to the ER and be prepared by vocal advocate. Tell them her history, what happens before, etc. I'm so sorry you're going through this. Thank you for caring. Many with epilepsy have nobody to help them in these situations. And that's correct.
So this one's all about support system. You know, somebody that one caught me off guard that was saying anybody who can help you will in a medical setting.
Yeah, they have the
Sounded like
good
most of
ones.
those comments were about getting a support system or count on, I guess.
Yeah, that's what I think is getting a support system is the best thing to do because someone who knows what you're going through and understands you and wants to listen to get an understanding for you. That's the good people. Um, my mother wants to, slowly, but she wants to. I do have another one here. It says med times. What time do you consider the window of time that is considered on time? Exactly right on the dot? 10 minutes, 30 minutes? I'm interested on other people's perspectives. I consider right at the time as on time, but also try to make myself feel awful if it's within 30 minutes. This especially happens in the morning for me. I never take it on time. I'm always 5 to 10 minutes late, or if I'm further than that, then like today, I was like an hour and something late because I went and got it. I went and got my meds. I went and got the water, and then I answered the phone, and the pills and the water were sitting next to me until like 11 o'clock. And it was like, I waited a whole hour and forgot what I was doing after that phone call. So yeah, I
Don't you love
can't
how when
forget
you're
this.
talking to somebody, like making an appointment and you schedule it before you get off the phone and they're so like, you know, they act grateful like this appointment's so important to you. You want to schedule it so soon, and I don't even bother just letting them know. No, it's like if I don't schedule this now, then I'm not going to show. So
But
it's cool when they think like that. Just let them take it as a compliment.
yeah,
Somebody here is saying, why do I enjoy music much more after a seizure? Every time I have a seizure, the next few days, music sounds 100 times better. I had a seizure Sunday night, and since then I've had my headphones on all day, every day. I'd say it's the only good thing about having a seizure. I would think to agree with this to a certain point. If it's a song or anything that sounds familiar, that's what feels better after a seizure. That would sound better if you somehow like knew the words or, you know, if it's a good song. But I guess after a seizure during that little bit of post-ictal time when I think I'm kind of hyper aware, I could see music sounding better. But that's why I'll never watch stand-up or like something that has a lot of clapping. Not right after a seizure anyway.
yeah, I
You ever
like
you
music
ever had
after a
something like that?
season. For some reason, yeah, music's always good after a seizure. music and laying down because I'm usually laying down listening to the TV. But I can imagine good music and laying down after a seizure would go really well. Um,
Are those after hour days, or what are you going for then?
Say that again.
I was asking which album you were listening to because I was thinking after hours, but I didn't know if you still had preferences like that.
Um, Usually when after a seizure and I'm laying down, I just put on a mix and I just let it mix by itself. And it's usually a lot of the weekend. Um, or if it's not the weekend, it's someone similar to him or a feature with him in it. Uh, yeah, but I do have a wide variety of music that does play on when it does play on random.
This comment is agreeing with the post saying your brain is flooded with dopamine. This causes a euphoric, excited state, almost a high, quote unquote. Your senses are heightened and that music hits. So that's a better way of explaining it. I like that one.
There's been times where I have seizures and then I can't get a song out of my head. There's been those, and when I can't get the song out of my head, then I just usually go to, um, I think it's Google, or maybe Siri, one of those guys. Um, there's this thing where they have the music and you just hum to it and it tells you the song, and I hum the words that I don't know, and it usually just picks the song out for me, and I'm like, there I go. Thanks for doing that for me. That's a good thing to have.
Anything to get a song out of your head for sure.
Right. Then after I search it, I need to listen to it like 5 to 10 times. Then I'll put it in my playlist.
Wow. Hey, at
And
least it's
most of the
not some kind
times,
of commercial.
and most of the times it's a song that I don't usually listen to. And once I hear it in my head throughout the night and I'm humming it and I don't know the words, that's when I need Siri to let me know what song am I humming so I can play the actual song.
And then
Um,
the whole rest of the song is way different than like that hook or the chorus or the part you remember. Yeah. Somebody else says asking, how do you get over the fear of SUDEP? Oh, okay. AJ's saying you don't. You don't get over the fear of SUDEP. I think you can change the way you look at it. You know, if it is actually a fear, then the only thing you can do is try to become accustomed to it. The first comment, for example, is saying, one day I'm going to die. Doesn't matter how I go, but one day we all going to go. So fuck it. Have fun. Tell people you love them and keep it pushing. And that's something that says I remind myself of this often. And yeah, somebody else comments on that saying, we do your surgery. Okay, someone that's had the talk. We do your surgery or SUDEP is going to take you real soon. They're saying that's lovely, so, you know, something you really want to hear before you have a surgery. Saying if we do your surgery, if we don't do your surgery, SUDEP is going to take you. And they're saying first thing I did after the talk, I took on a good part of Mount Washington because fuck it, if I'm going to go out somewhere cool. Okay, so maybe that's a hiking thing. They climbed a mountain. Yeah, if you have accomplishments on a bucket list, then that's something to they'll be happy that you have those accomplishments before anything takes you. And somebody else is reminding them too that it is super unlikely. It's like 1 in 1,000 people with epilepsy die from SUDEP.
that's quite a thing to come back to the conversation here. Sudat.
Welcome back. How do
That
you get
caught
over
me
the
off
fear
guard.
of SUDEP?
Say that again.
How do you get over the fear of SUDEP was the question.
I it might sound easier or dumb to some. I just don't like pay attention to it. Don't think about it. It's just it's there. There's no reason to keep thinking about it and wondering when and how and all that stuff. And yeah, when it comes, it comes. I'm not gonna say it's the inevitable, but it's like something we can't prevent. So um
Accepting it.
yeah, because inevitable means it's gonna happen for sure. So it's not gonna happen for sure, but I don't worry about it because you stress yourself out about it. Then you might have a seizure, which could be that seizure or anything. Yeah,
It's
I
just
hate to
so
be the
obvious
bearer of
that
bad
why you
news.
don't want to live in fear. It did
Um,
let us have that comment of I'm more scared of shitting my pants in public than suit up. So there you go.
yeah,
It's not worth the fear, not worth the energy. A lot of comments on this one, just saying their situations. I'm 52, been living with epilepsy for over 30 years. Suit up is rare, random. I won't know if it happens. That's another point. There's nothing I can do to prevent it except continue treatment. Been working with an epilepsy center since '05. Been through brain surgery for the RNS. Put in my best effort to prevent seizures. What happens now is outside of my control, and I'm not going to worry about it. More concerned about living the best quality of life as an epileptic. Welcome, Kev. Came in on a question about how you handle SUDEP or how you don't get scared of SUDEP. And a lot of the comments are saying just don't let yourself get scared of it.
Right. The odds are very small, and just like everything else, you could get hit by a car or struck by lightning. Anything else, any other tragedy. I mean, it does pertain to us, but it's still very, very small. Don't get yourself worked up.
there's a few here, and I got one because it says something we could all relate to. I'm afraid that I'll never have a job. Has anyone achieved a somewhat normal life while still having seizures, pretty regular seizures? Someday I want to have money to own a house, have a boyfriend, and almost have a normal life. Has anyone yet achieved this? I live a normal life. Um, I wouldn't say I have money. I have some money. Yeah, has anyone achieved having a good life? And I have a good life. I say you just got to find things in this good life that makes you happy, that makes you excited to wake up and do or look at or um,
Yeah, I was living a very comfortable life outside the house for a while. Um, for several, almost a year, when I was going to school, and I was still having seizures, but I had a job, was going to school. It was great, but I had to move back into my parents' house for reasons completely out of my control. The guy lost his house, and I was renting in his house, and he lost his house, and whole mess. That was a real tragedy, and yeah, I was really enjoying it out there, and it's one of those unfortunate things. But yeah, it's very possible. I mean, I think uh,
Ed, are you afraid you'll never have a job again?
I guess I would see if a job was in my future. It's a nice surprise. Not expecting it, trying to do whatever I have to do to live without it. But obviously, that could come back, and that's just more reasons to, keep myself capable if it does get to that point. It could be a reality. I think we can handle it if we have to. Keep some skills exactly for
One
that
thing,
situation.
have you achieved somewhat of a normal life since you have epilepsy?
Not really happy with how it's going. Normal,
With it,
probably not, but I'm still happy with it.
I say mine's normal. It's good.
Yeah, not completely, but yeah, it's you know, life is
It's a cool life.
yeah, life is compromises, right? I mean, so yeah, I mean, can't complain that much. I mean,
And it's really
Um,
important that you can adjust your own standards. That's for sure.
mm,
one of the comments here, it says it's definitely possible for many of us. I'm 34. I've been a homeowner for 11 years. I have a husband and a daughter, and I have a decent career in accountancy, finance. I was diagnosed with epilepsy when I was 31, but my focal seizures started when I was 11. So I achieved all of that with temporal lobe epilepsy. It's challenging at times, but I count myself lucky. Yeah. Another comment here says, yes, I've had epilepsy seizures since I was 13 and I'm 40 now. I went to college. I have 2 master's degrees. I lived on my own for over 10 years. I have a full time job. I got married to the love of my life last summer. I've never been able to drive, and epilepsy definitely impacted my life deeply. I think when you have a disability like epilepsy, you have to get creative about transportation, work, and just having a life. It took me a long time, but I was able to cultivate a tight group of friends and date eventually. What made my big difference was living in the center of my own city and living distance within a job. Do not ever let anyone tell you that you can't have a good life while having epilepsy. Right. Don't let anyone hold you back. I have a good life with epilepsy. I haven't accomplished much with epilepsy besides this. In children, that was an accomplishment. But yeah, we'll move forward.
This question about pets is saying, so I had a pretty bad seizure where I had to be taken to the hospital, and since I've been back, my feline child has been constantly by my side, but also acting a bit strange. Has anyone else noticed a change in your pet's behavior after a seizure? I'm afraid I may have scared and stressed him out. He's doing weird things like scooting and going to the bathroom a lot. I'm going to take him to the vet. I'm just curious if anything like this has happened to anyone else. I don't have a cat, but the dog gets really clingy after a seizure.
Yeah, when I did stay with my sister, she had a dog, and it was like a little more standoffish after I had a seizure. But when I look back on camera, the dog would like be there, just like watching me have the seizures. But then, like after I come to, I noticed that it wouldn't come to me as much. Um, but even if I call out his name, he wasn't coming as often. So I don't know if it's like a thing like right after I have a seizure, then it was scared like I was gonna do something. That's what how I felt. It was like I used to think like I just had a seizure, like it's not gonna do anything to you. He's always like cowering. Yeah, like I'm gonna hurt him.
Dogs get nervous around a lot of stuff. They just don't know that, haven't been introduced to anything new.
Yeah.
Good thing you didn't get aggressive though.
Well, it was a chihuahua, so I mean,
They can get aggressive over anything.
yeah. Um,
Hey,
yeah.
do you ever have any pets that reacted to your seizures? Other people are saying yes. My fur baby was very skittish after my first few seizures, or after my last few seizures, but she tends to relax after a week and always keeps by my side. She's my only companionship, doing my best to keep her happy, but being a cat, I can only spoil her so much. The stress and shyness after having a seizure where you jerk around, especially if they sleep on or around you, is something I'm going to say is almost expected. But the scooting is always something I worry about. Did she just start her? Has she been doing it? So, yeah, the comment is saying the cat might act weird, but if they're actually like going to the bathroom a lot and get like physical, signs, then maybe they do need to go to the vet. Somebody else is just saying this happened to me recently. Haven't noticed anything unusual in the cat. More that he was super happy after I came back from the hospital. But that always happens if I go out of town for a few days too. So yeah, there's that.
Um,
And AJ says my hamster did not care about me seizing. He always shows me their butt. Okay. That's rodents, of course.
I do have a post here. It says, partner having new seizures. My 26-year-old male partner started having seizures in his sleep last week. It was in the middle of the night, and I had no clue what was happening. I just saw blood from his mouth. He bit his tongue and the thrashing with his eyes open. I truly thought I was losing him. So I was screaming at 911 to hurry up. Everyone came, firemen, paramedics, and police. When they finally got him to come, he was just a little confused and I felt awful. Anyway, I'm now incredibly terrified to sleep. I'm scared. It's going to happen every night, and I really don't know how to process this at all. We have a newborn, and I have just been trying to get through each day and night. Someone help. I haven't had a baby. Um, uh, or after a seizure. I mean, after a baby came, I think I've had some seizures. Um, Kate, do you think you can help me with this one?
Uh, Give me a summary. What are we working with?
This person is saying that their partner started having seizures. They just had a baby, and it's the woman that's not having seizures. It's the guy that's having seizures, and she's afraid to go to sleep because she's afraid he might have them in his sleep. But she just had a baby also, so afraid to go to sleep isn't always good because you're gonna need some of that sleep eventually.
Yeah, you're gonna need the sleep, but if you're in the same bed, then that's when you would look forward to going to sleep. The sooner you get good sleep, then if he has some kind of convulsions or anything that would wake you up, then you'd want to have some kind of chance of a clear mind when you wake up to tend to him. Remembering where the emergency meds are and exactly what to do. It's definitely stressful, but I mean, practice, go over it, talk about it with each other, and just more things will come up that way. If you talk about this is what I'll do first, then you think, okay, I don't know where the meds are, or it'll slip off of this. Don't put it on the headboard. Put it on the dresser. Like pick a better spot for the rescue meds. Have a little hospital bag. Maybe want to have that prepared in case it does have to be a call. So you and little one will have what they need. You have to go. Yeah, definitely for an infant, you just want to be prepared for every situation. Have your to-go diaper bag and like have the to-go hospital bag.
Mm.
That was a newborn thing.
I had a seizure the day my daughter was born. I actually had it while holding her um, newborn.
Wow.
So
Wow.
yeah, yeah,
Well,
I
you
was
got to
holding
elaborate
her.
now.
So I was holding her, and like I said, it's newborn. And I think my stepmom said she seen the look in my eyes, and she said, "Somebody get the baby." And she said, as it was happening, I guess is when I kind of threw the baby a little bit. Um, so luckily there was someone. Yeah, there's no such thing as a little bit. So I threw her, and I guess I don't know who was closest to me. It might have been my stepmom to get her, but yeah, I passed her on to whoever was nearest. Yeah. And they were like, him or the baby. Um, I mean, I'm sure it didn't go like that, but they didn't save me. And I woke up in the emergency room downstairs and I didn't have pants on. And I was worried that I had things in my pockets that I was going to go to the jail for. It's like, oh my goodness, I have drugs in my pocket. Um, things have gotten better with the drug laws these days. So, yeah, I made it through that. Got something here?
Yes, you did.
No, little
Daddies,
comments.
make it through that. Good job.
Yeah, made it through live, but didn't go through my pockets and go to jail. But I got
More
some
and more to be
comments.
proud of every time you bring it up. Go ahead.
One of the comments, one just says sending love. Same thing happened with me, but my partner is the one who woke up and found me. He wakes up anytime I make a sound. The after effects are so brutal, tongue hurts, headache, extremely exhausted, to the point where I sleep for the next 24 hours. The week following is a blur. Please just give them love and know that you just being there is such a comforting feeling. Another comment here says, I'm so sorry to hear that. You've also experienced this, witnessed a loved one can cause feelings of PTSD. For your own mental health, I would make sure you're seeking a support, self-care, therapy, or anything that helps you take care of yourself, because the anxiety can be debilitating. The feeling for you, I feel for you so much as someone who has also witnessed a seizure. I hope you know that you're not alone on this journey. He has seen a neurologist. I don't know, has he seen a neurologist? Has he started medication? Please keep us posted. Hey Jeff, how you doing? It says partner having seizures. I mean, your partner's not having seizures, but you're having seizures. Um, and the person was basically saying that they see the person's in bed and they don't want to go to sleep. They're the person watching the person who just had a seizure. Um, yeah, you're the only one having in a relationship. I was going to ask you, how does that go? Does that make people nervous that we have seizures and then they have to sleep next to us?
It does make her nervous, but it's been different for me because I don't regularly get tonic-clonic. As far as I know, I've only had one, and it was at night, and I really don't even know if it was one or I fell out of bed, which I don't think it was. But I I get focals almost exclusively, but she's always worried about me. You know what's happening, where I'm at, and I don't think sleeping is any different. Um, and I don't know where else to go with that.
Yeah, this person, they were saying she said she was trying to get some sleep. It's hard to go through that process because she needs sleep because they just had a baby as well, and she just seen him have a
That's
seizure.
another
So
good point, though, because anybody who's like a new parent, if you convince yourself that you got everything checked off on, like, in the best interest of the newborn, then, rest assured you can stay calm, do what you got to do, and baby's good too.
The other thing is, if you're a new parent, you need your sleep. The baby has to come first. And if your partner has a seizure, you're going to know about it if you're sleeping next to them. So don't worry about it. There's nothing you can do to you can prepare yourself for how to react, but that's all you can do is prepare yourself. You have to stay calm and just be prepared. Go to sleep like you normally would.
Probably
There are
easier
enough
said than
things in
done.
our world to worry about.
Great advice. It's probably easier said than done.
Yeah, there's no
But
question.
yeah, I couldn't imagine waking up to someone having a seizure. Uh,
But your staying up is not helping them not have a seizure.
right. Yeah, you're just watching someone sleep and hoping they don't have a seizure. But I do got a new one here. It says waking up with a swollen lip. Anyone else get this? During the day, anyone else get this? During the day, I have focal seizures, lose awareness, etc. But ain't biting my lips. But sometimes wake up in the morning with a big swollen lip and no memory of biting it. So it must be happening during a nocturnal seizure of some sort. Um, the question was, anyone get this? Waking up to a swollen lip. I woke up with the insides of my cheeks chewed up. Felt like I was like biting something hard. Sometimes it felt like I don't know how to exactly put it. Sometimes it felt like I intentionally just like attack biting my cheek. Um, yeah, that's the only way I can think of explaining it. Feels like I was like aiming for my cheek. Like that sensation of just like trying to bite something. That's what it felt like. Like I was
And
trying
how
to
does
do
it
it on
end up that
purpose.
same spot?
Right. It felt like I was trying to do it on purpose. Like, yeah, it's a bit of complicated trying to explain. Um, yeah. Waking up with a swollen lip, you just,
And
I just
talking
rinse my
different
mouth.
for like 3 days.
Yeah. I just rinse my mouth and try to go back to sleep. I don't have nocturnal seizures that I know of, but don't take my word for it because I have woken up in some sticky situations. Um, yeah, one comment here says, last seizure I woke up with bit into my lip and I'm still healing. At least no scars, but I bit into the nerve and still regrowing. Sounds like me. 3 days of that. That's usually how it goes, and I'm back. You guys ever bit yourself pretty bad?
I never had stitches, but I know some of them have definitely been like deeper than others. Does your tongue or your cheek bleed more? For me, it's a tongue.
Yeah, for me it's the tongue because I'm always touching it. I mean, not always touching it, but like always using it. Uh, the cheek hurts a lot, but yeah, tongue I hate. There's nothing you can do about it. Then you want to eat, and you're hungry. Yeah.
You can do something
Yeah.
about it.
Say that
I don't
again.
have top. You can do something about it. I don't have top teeth. I have a plate that I take out at night. So I can't bite down on my tongue. I bite down on my cheeks.
You
If
ever
I
got a
bite,
bad bite?
yeah, I always get bad bites,
Yeah, okay.
but not on my tongue. One time I had really bad tooth marks on the underside of my tongue, but it never went through because there was nothing on the other side. And I guess I do have tonic-clonics because when I was in the EMU, not recently, but last year, they diagnosed me with nocturnal seizures. So
Do you tend to have worse ones nocturnal, or has there ever really
well,
been a pattern?
I guess the worst ones are nocturnal. When you wake up all dazed and confused and sore and
think it seems like those are the longest post-ictal ones.
Yeah.
If I have them early in the morning before I'm actually awake, those take longer to recover from, but only mentally. It's during the
Yeah.
day when I got up kind of early and I've been busy and not really taking a break. Those are the tonic-clonics that surprise, but whether they're short or not, those hurt for longer too. So,
I also have a problem sometimes because of my situation, knowing where I am. Uh, until I open the blinds in my room and see either palm trees or, snow, I sometimes don't know where I am. And that's a little unsettling.
Yeah, you guys got something in particular that you rinse your mouth with when you get a bad bite?
No.
Yeah. Someone suggested, my sister suggested there's a name of a rinse. I forgot. That's a good one. Hydrogen peroxide.
Yeah.
I've heard someone say hydrogen peroxide. Thanks for that, AJ. Or water with salt. Yes, good one, AJ. Water with salt, I heard, is worse than the peroxide. I heard the peroxide is disgusting, but it's the best one, I heard. Um, so yeah. I got another post here. It says, how do you cope with tiredness? For some context, I have epilepsy for about 8 years and I'm in my 20s. I'm currently living by myself with a cat. I stopped working about a year ago. Is it just me that finds life absolutely exhausting sometimes? I don't know if it's my medication or the fact that I have epilepsy and it's a chronic illness with its own side effects. I just feel like a zombie. I've been told I'm too young to have any aches and pains, and I'm too young to be worrying about why my body hurts, and I'm not allowed to stay in bed because I'm lazy. When all this stems simply from my diagnosis, I've just had enough, really. Most of my old friends are married or have children at this point, and I'm here wallowing, have epilepsy, and can't seem to drag myself out of bed without pure exhaustion. I feel to make I feel I used to make music and constantly and slowing slowly losing the effort to even do that. My parents keep telling me I need to get out there and volunteer or just go back into work when I don't feel any of that is possible. The question was coping with epilepsy, and then another question was, is it just me that finds life absolutely exhausting sometimes? Um, you're not the only one who finds life exhausting at times. And how do I cope with the tiredness? Uh, I got some B12 here by Nature's Made.
Shout out to Nature's Made.
Um, right here. Shout out to Nature's Made. Yeah, I keep those around. That's helped with the morning fatigue mostly. And by the nighttime, I'm usually uh yeah, the fatigue is usually gone by the nighttime, and I'm either watching something on TV and hoping that the insomnia from the lamotrigine goes away so I can go to sleep. Um yeah, for some reason I don't get that fatigue that I get in the day that I used to get in the daytime. I don't get that at nighttime anymore. Would be nice. Another comment here says you need to get outside and do things. Just laying around will rot you away. Find a job, any job that will allow you to work and do it. Find purpose and don't give up.
That's kind of the problem. I think this person was stating in the first place. They were saying everyone says just get out and find a job, and you know, this post is, but that is important. I do agree. You can. Um, I I got a treadmill over there, and I might just do a mile, just walk a mile, just to sort of wake up, do something to get the blood pumping, and you know, I don't know, uh, something, anything.
Some comments here. One says B12 and naps. One says go check your thyroid. One says I don't know that word, so I'm going to go down to the next one. It says Adderall is the only thing that allows me to make it out of the house, to be honest. Unfortunately, I know stimulants can exacerbate epilepsy for some, but for me, the seizures are actually worse when I'm off of it because my seizures are tied to my sleep state. The more tired I am, the more the seizures I have. Another one says, yeah, no, the tiredness is for life. We require more rest for our brains to function, especially after a seizure. Medicine side effects are brutal, and most of us have comorbid illnesses.
He should come on here and find out how to cope.
Yeah. If you're listening to this, Jeff just said it best. Come
I
on
was in
here
that
and
same state. That was my life.
yeah, I was
And now
there.
I'm happy as shit.
I'm
You saw
there.
how I was. Yeah. You saw how I was.
Yeah, you hit it pretty good because I didn't see all that, but then after you pointed it out, then I was like, "Oh, okay." Um, yeah, of course, no one wants to come in like that. Kevin
Yeah.
came in and he had told me he had no seizures, and I was like, "What?" His life was already taken off.
Yeah, that's great. But
Yeah,
but you had the surgery, right?
I did.
So, and how long ago was that? 6 years ago?
9 years.
9 years. And how many were you having before that?
Well, before the surgery,
Yeah.
the myoclonic clusters were very bad,
Mm,
immobilizing, let's say.
yeah.
I
I think if I were
couldn't,
younger, I would definitely do it.
yeah, no regrets on my part, obviously,
Yeah.
and I was having the tonic-clonics as well, and yeah, it was a pretty big mess, and it's obviously a tough decision for anyone. I know Mark just had it, and I'll support anything he decides. So that's what we're here for.
Hmm.
So
How bad
It's
were your myoclonics? Because mine are small related to what I hear you say. Mine's are just like nerve twitches. They're really annoying, and they were too often at one point. But can you explain to me how your myoclonics are?
okay, imagine you blink, and in that second you blink, half of your side of your body goes down. You lose control of almost that. Those were the worst ones, all of, or your legs would just go out. It wouldn't be a jerk. It would just be a loss of control of a limb or a leg. So my body would just drop straight down. I wouldn't fall over. I would just fall onto my knees and hyperfluctuate them, and it's like uh, so. Trying to go to the bathroom, I would just blink and then start falling over towards and this was everything. This was happening all day, and I couldn't make food for myself. I couldn't, you know, you know, yeah, I couldn't do very much, and
That sounds
uh,
bad.
and these were happening not once or twice. These were happening in clusters. So, you know, I would get up and fall down again, and then uh, yeah, I mean, they were just not a very livable situation.
That sounds
Um,
horrible, Kevin. It really sounds like a hell of a way to live.
Yeah, and it was very, very difficult, and
Yeah.
much better here now. And this is, yeah, I'm glad I made the decision for the BNS, and uh, hope Mark has the same success. And yeah, and but the yeah, it's those are one of the seizures that nobody knows about or very little about, and it's difficult to educate people on all those seizures. Yeah, I suppose.
yeah, before I knew what it was, and I was just dealing with the nerve twitches, I didn't think it was much. I didn't think much of it. I didn't even think to point it out to the doctor. Um, I mean, to the neurologist, I didn't think to point it out to him. Like I said, I was going through it for 10 years before I actually got on Reddit and someone told me that's what it was. And I was like, oh, myoclonic.
Wow.
Well, time to point it out now. And
Well, that was my
yeah,
original diagnosis. Was JME, juvenile myoclonic epilepsy. They did an EEG, and that was what it came out as.
When you twitch,
how
is it
they,
like a big twitch or is it just like you're like that, like your arms are just shaking a little bit?
It could be the range can be. I can feel it in my skull. It could be like a. It could be like a shock, and it's basically a shock. It feels like a taser. So it could be like a small anything from like feeling several of them in your brain, and those are auras too, because the the more frequent and powerful they become, that's telling my body that I'm going to have a tonic-clonic,
Get ready.
which always happens. That's the that was the big thing that um, yeah, that's the big thing to remember for my situation. Um, but yeah, the power, the range would be anything from just a little shock in my head to losing complete control of my body. I could I would just fall down, uh, and it would be maybe a leg or my arm, you know, twisting but yeah, the okay.
when you said just fall down, it made me think of gelastic seizures, like drop seizures. You ever get tested for that, or you think
Yeah,
you're talking down with something else?
I will look into that. Gelastic seizures. What's that? Like
Drop seizures.
gelastic seizures are they're characterized by sudden uncontrollable bursts of laughter that are not. I'll look up drop seizures.
Hey, Mark, how you doing?
Hey,
Mark,
pretty good. How about you guys?
I'm good. So far, so good.
Yeah.
Um,
You ever heard of gelastic seizures?
Of what?
Gelastic seizures?
Uh, what? Gelastic? Like
Yes.
elastic, but with a G at the beginning?
Yes.
Uh, can't say that I have. It's
My stepsister gets those.
almost, it's like, I don't know. I can't
That's the
even.
laughing seizures. My stepsister
Oh,
gets those.
who does?
My stepsister.
Really?
Yeah.
Just like laughing fits, uncontrollable laughing fits? Or,
Yeah.
oh,
Involuntary laughter that can last from a few seconds to a couple of minutes. The laughter often sounds forced or unnatural and occurs even in inappropriate social situations.
I've never stopped to consider whether laughter could be a seizure of some sort. I mean, I suppose the inappropriate context is kind of a big flag. That doesn't, involuntary, inappropriate laughter is, yeah, I don't know. It's a new one for me. That's for sure. But um, can't say I'm surprised that the brain can figure out a way to laugh while it's seizing.
Yeah. My stepdad was quite confused at that, and he was like, "Oh, that's a seizure." It's like, "Oh, all right." They didn't really look too much into it. It was just like, "Oh, she's having these laughing seizures," and yeah,
It reminds me of uh, the myoclonics. Didn't Lufa mention that uh, myoclonic seizures can sometimes manifest as hiccups, like extreme, like to the point of like painful hiccups can be a myoclonic jerk of the diaphragm muscles there that are, you know, um, I wonder if there's a similar, like a myoclonic muscle contraction of, you know, that, I don't know, whatever region would control diaphragm that might come across as laughter, that might be a reason why it sounds odd or forced or something. If it's,
have you guys heard of insular epilepsy?
no.
I mean, I know the word insular, but I've never heard of insular epilepsy. Is that,
It says insular epilepsy is a form of epilepsy originating from the insular cortex, characterized by diverse seizure types and complex clinical features, making it diagnosis and treatment challenging.
insular cortex? Where is that in the brain? Someplace deep, I think, right? Just from the name, it sounds like it's gotta be, insular's gotta be in somewhere.
Yeah. Um, I got something here though. It says, should I switch to Breviact? Right now, I currently take 1,800 of Keppra and 25 milligrams of Lamictal. And it's kind of driving me crazy and wanting to know if it would be a good idea to switch. Haven't personally taken Breviact. I don't want to suggest anything that I haven't exactly tried or don't know much about personally. I heard it's good. If you like to sleep, um, someone told me it'll help me sleep if I need sleep because lamotrigine causes insomnia. Um, yeah, I was told to ask for Briviac that'll help me sleep. I'm gonna stick to what I'm taking because I hate trying all these different kinds of pills. With no testing, I'll stick to what I'm at.
Yeah, Briviact is, I mean, it's still patented, so there is no generic form, but the name of the drug, were it generic, would be brivaracetam. So, the name brivaracetam is an indicator. It is very, very structurally similar to leveracetam. So if they're already on Keppra, the selling point that I was given for Briviact was, um, uh, well, first off, its mechanism of action is different from the meds that I'm on. The Vimpat and the Lyrica both work on sodium channels, among other little, but the brivaracetam is, its primary mechanism of action is the same as Keppra, but in the trials and everything, it has been reported to have significantly fewer side effects. And yeah, if they're already on Keppra and their doctor is proposing, like a cross taper to switch over from Keppra to Briviact, so I mean, that might be a great way to reduce some side effects if that's something that they're struggling with. But if they're considering adding the Briviact on top of the Keppra, then that's something to be aware of, that they're both the same mechanism of action. So the efficacy of each of them, it's not like you can take however effective Briviact is and just straight up add it to the Keppra. They've got to compete for those pathways to exert their therapeutic effects. So I've never been on Keppra, so I can't speak to that, but Briviact did not respond well in my system. But I was put on it because of, the mechanism of action. It's something to be aware of. So yeah, if they tolerate that mechanism of action already with the Keppra, then odds are they'll have, at worst, similar side effects. Most likely, less intense than the Keppra, if everything that the doctors are saying about it is to be believed. It's, like all of these things, it's a cost benefit, how much could you potentially get from this medication, and is that worth what that medication could take away from you or do to you in some way. So I don't like Briviact, but I'm not going to say it's a bad drug because it does great stuff for a lot of people. So I don't know. I feel like I kind of danced around or answered yes and no. It could be good, it could be bad, but that's my thoughts. Worth a try if it's something you're inclined to try. Just make sure you're self-informed before going into it. On top of what doctors say, they don't always necessarily remember all of the little details just offhand. So, yeah, as always, do your own research.
Gotcha.
Mark, earlier on you mentioned Lyrica. And what is it about the medication that's primarily prescribed for nerve pain that would work on seizures?
It is a central nervous system depressant. So the backbone of Lyrica, it was built off of the neurotransmitter GABA, which is gamma aminobutyric acid. It is the primary inhibiting, like down-regulating, calming neurotransmitter in the brain. So the idea when they set out to design it, the thought was if we take this neurotransmitter and we alter it in some way, we might get a drug with therapeutic effects that act at GABA that don't mess up the body's own production of GABA itself. So they did these trials, and it turned out that it wasn't exactly the like GABAergic sedative hypnotic they were kind of expecting from doing that. Something that would be in the same sort of ballpark as the benzodiazepines or phenobarbital, any of the barbiturates. But it wasn't acting on the GABA receptors in that way. It wasn't going and causing those strong sedating, hypnotic, eventually just like complete knockout, tranquilizing sort of effect. There was a noted decrease among the test group, though, that some patients who had been experiencing neuropathic pain, I think it was initially like a diabetic neuropathy that the an improvement was found, even though it wasn't the one that they were targeting. And so they researched that more fully, and they found that rather than acting like the sedative hypnotic drugs that they expected, given the gamma backbone of the molecule, what it did was act on the voltage gated sodium channels in the brain. And that effect is how gabapentin behaves and how it acts in the brain. So, purely by accident, they stumbled upon this new medication in this other class. So now there's, not just the standalone gabapentin, there's what they call gabapentinoids, which are the drugs that act in that way on those particular voltage gated calcium channels or calcium, sodium. I don't know, maybe both. I'm, foggy a little bit, but yeah, it's
You think it's effective?
it's effective. I was diagnosed with fibromyalgia before my seizures were identified as seizures, back when they were panic attacks. Um, so they gave me clonazepam to treat the panic attacks, and they gave me pregabalin to treat the pain from the fibromyalgia, both of which I'm now back on for the epilepsy, which seems to be the correct diagnosis, even though they got most of the same medications, same correct medications to treat, everything. So I don't know. I thought that was kind of interesting that I'm back on everything, or not everything, but back on pregabalin and clonazepam now for the epilepsy, even though it's what they were treating for the same stuff with a different diagnosis 10 years ago. So, uh, yeah, but it's it's a good drug. It takes a high dose, a high level of it to reach a therapeutic anticonvulsant level. So like my 150 milligrams 3 times a day is a heavy dose of the Lyrica. That's kind of at the upper limit of what they're recommended to prescribe. And there are exceptions to everything, and some will go higher, but where I'm at, I'm happy with the level that I'm at. But yeah, it's
Yeah.
the body
I
is,
took Lyrica 30 years ago.
huh?
I took it 30 years, over 30 years ago, when I
Yeah.
was diagnosed with fibromyalgia.
Did it do anything for you?
No, because I had Lyme disease in addition to the fibromyalgia. So it didn't really do anything. But now I'm wondering if I should call my pain doctor and take some more of it.
I mean, it shouldn't hurt your epilepsy, at the very least. Um, I don't know. Does
All
Lyme,
right, thanks.
isn't a lot of the pain associated with Lyme disease from like nervous system, nerve pain?
Well, at the beginning, yes. But what happens is it destroys every joint in your body.
Okay.
So I have severe arthritis in every joint in my body. And not like just the 5 fingers. There's 14 joints in each finger.
Yeah.
So it
Yeah.
feels like there's a knife sticking in each one, which is why I'm in the desert, because I don't have that pain here.
Nice.
But that was really the worst. The fibromyalgia was nothing compared to the chronic line.
Yeah. Yeah. I went off of the pregabalin before I don't know, I went all medically non-compliant for a few years and had some ill-advised adventures, but uh, yeah, um, what was that? Why did I say that? There was something.
We've
And
all had those ill-advised adventures.
uh, I'm sorry.
Angel's laughing his ass off.
Uh,
The last thing you were talking about was how you went into some ill-advised adventures that year or something. I don't know
oh,
if that might bring it
oh
back.
yeah, the going off of the pregabalin and you know, yeah, I was back in pain again, but it was enough of a baseline, like a constant baseline pain that it just kind of ends up like, tinnitus in the background. I don't really experience it unless I focus on it. Other than that, I know it's there, but it's just, but
Right.
adding the pregabalin to help the seizures did kind of remind me that, yeah, there was pain there and it's a bit better now. So, you know, got two birds stoned at the same time.
Nothing wrong with that.
To the post of the person act, should they switch to Briviact is where we're back to now. Um, Kevin, I don't think you were here, and neither were you, Angel. Um,
I
or
think Kevin was
I think only Angel wasn't here when I asked the question. And Kate. There we go.
No, I
Oh, it
was
must
here.
have been after I was leaving Burger King.
here.
What are your thoughts on Briviact, Angel?
I had that medicine before, and I was on a few medicines, but I know I did not like it. It it was definitely the out of the five I was on at the time, it was definitely like the strongest with the drowsiness, and that was before I got on Xcopri.
Yeah, there's someone here saying they take 1,800 milligrams of Keppra and 25 milligrams of Lamictal, and it's driving them crazy. Um, so they're trying to figure out which one would be worse, or wanted to know which one would be a good one. And their thing says, should I switch to Briviac was the main question.
React is a better version of Kepra. I believe that is true. Um, but for me and my seizures and everything, until the medical resistance, took its effect, the Vinpat was way better and everything.
Okay. Um, One comment here says I took Keppra first and thought it was awful. It made me depressed and angry all the time. I take lamotrigine
Yeah.
now, and it's been so much better. Just personal experience.
Breviac doesn't have that strong Kepra rage to it, but it does. It's pretty much like, okay, we're taking that Kepra rage out of that and calling it Breviac. That's all they
Like
did.
maybe
Pretty
turn
much.
the dial from 10 down to like 7 or something. I
Yeah.
definitely got angry at nothing at all. I was sitting in my room, there was nothing happening, but I was angry at it. Why?
Well, it looks like Angel's calling the shots here. The Briviact and Keppra are both anti-seizure medications that target the SV2A protein in the brain. So they definitely prescribe both of them for focal seizures. Briviact, it sounds like, is what they're saying is more exclusively for focals, but it's definitely targeting the same thing as Keppra, and they're closely related. And apparently, I got off of it for the pregnancy, but it never controlled seizures for me either.
Okay. Yeah, two more comments here I'll read about that. It says, I take B6 and B12 folate with my Keppra every day, and it works great to stop the side effects. The reason it causes that is because it slowly depletes those in your brain. You need both B6 and B12 to take those. If you take those, you should have less and no side effects. Works good for me. One more comment says everyone's response to the medications is different. I've had some which gave me drastically bad side effects with those, but these same drugs keep others seizure free. It's definitely something to discuss with your doctor. Someone told me your what's medication resistant is once you try more than one, or I think someone said two.
I think it's two or more. If you've been on two and they're not controlling and they keep going, add a third or something, two or more that don't control it is when my doctor said that I was. So I don't know. Because I started on Lamictal and then that gave me sun sensitive rashes and then switched to Vimpat, and the Vimpat wasn't doing it with focals, and then had the Lyrica. And with the yeah, sorry, I got distracted. Yeah, the
I know you had your hand up too, so I was waiting for you to get your.
that was a follow-up after I just had an idea about they're mentioning the B12, B6, B12, and I was wondering, it seems like I've heard that about some specific medications. I've heard that about just all medications, all anti-epilepsy drugs. I'm wondering if we've ever gone through and discussed and maybe identified, are there particular like specific anti-epilepsy drugs that deplete the B12 and B6 more than others? Like, cause it sounds, they're saying the Keppra, right? Keppra,
Yeah,
or was it Cat, or
they said
both?
Keppra.
Keppra. So yeah, Keppra, maybe we should make a post about it and like a flag sticky announcement post or something and just have, um, medication, I don't know, some notice about medications that, like a public service announcement. If you take these medications, you likely need to take more B vitamins or something because that is something I've never heard from any of my doctors on any of my visits. They just
Dang.
throw the prescription at me and then that's it. Send me to the pharmacy. Nobody's ever warned me about make sure you take vitamins, Oh, I don't know. I'm hoping I'm not the only person who's been oblivious before talking to all of you guys.
Yeah, now the
No, I
challenge
think
is just going to be trying to figure out where I did actually learn that stuff from. I don't
Yeah,
know if I always
I
just
think
looked it up myself or heard it from somebody else. I don't think we heard it from doctors though. Good.
Yeah, I learned a
I don't
lot.
think it's definitely been from a doctor's office because we all been doing these little tips and tricks that we learned on our own.
Yeah, I was gonna say most of what I learned is learned here. I don't talk to a doctor as much. I don't think I've talked to a doctor or met a doctor as much as I met with you guys. Um,
I don't have time to talk to people like us.
yeah,
I'm
I've met with you
move
guys
on
more times than
to
I've met with a doctor. Um,
They
because my
wouldn't
doctor
tell
was
us
like
about vitamins anyway.
twice a year, and I've met with you guys over 50 times. So yeah, I haven't seen that doctor. I've seen you guys more times.
like 10 hours each time. That's 50 times. 500 hours.
I
Wow.
seen my doctors quite a
I
few
don't
times this year, but that's just to get my seizures back under control.
Right. I think I've seen my doctor maybe twice this year and a video chat
And nine
with a
times out
different
of
one.
10, we go to these people like not too long after a seizure, so we're not going to remember anything they have to say.
But then you remember it when someone else here says something. So then, like I said, I talk to you
Oh,
guys more.
well, everything they say is also on my chart, so I have to reread my chart after the appointment.
thank God it's there on my chart to reread, though, right?
Yeah,
Yeah,
because
the
you
only
get, go ahead.
I was gonna say with my chart, the appointment I just had with the new neuro, it was everything I said in the order I said it. He just wrote everything what I said, and I was like, this really just kind of made me pay attention. I was like, you just wrote what I said and then prescribed me Envy based on what I said. I was like, what I didn't tell you should be something, you pay attention to, because I didn't tell you stuff that happened in the past. I told them what had happened most recently. And that's why I was like, no, I think I'll just get another neurologist and I'll tell him everything and see where me and him go from there. But this other one, he went off what happened to me in the last year and wanted to give me Omvi. And I got it just in case. Um, we can't sell medication, of course.
Which one is that again? Oh,
They gave me Omvi.
oh, I don't know what I'm blanking on.
I forgot the what's it called? The generic name.
Clobazam
Lebazan.
is a prescription usually used to treat seizures associated with Lennox-Gastaut syndrome, and it's a
Yeah.
benzo,
Hmm.
GABA neurotransmitter.
Yeah, I don't want to take that for my whole life, so I don't want to get started with it. And
Yeah, be really careful when any doctor tells you to take a benzo daily.
yeah, see, coming here taught me a lot. Before coming here, I would have took that medication like, all right, doc, gotcha. I'll take that.
And that's exactly how they started me on the benzos, agreeing to say, well, let's just try this until our next 3-month appointment. At that point, I'm already dependent on that medication. And if I decide that I don't like how it's working, then I'm going to trigger a cluster. Just getting off of that one gradually. And they spread that out over the course of 2 months to get off of like the lowest level they'll prescribe. So it was like a
And
6-month ordeal every time I just took them up on the offer and tried another pill. That took a lot of time.
This guy, he told me that he's not going to be in the office for long. He's going to retire at the end of next year. So I was just like, there's no reason of like getting to know you really, or you doing a bunch of tests on me to get me nowhere.
it's like a substitute teacher.
Right. He's like, I can give you medication. He's like, but I'm leaving, so there wouldn't be too much time for me to get to know you. And yeah, within 12 months, I'll probably see you once on video. Um, yeah, so time to move to the next neurologist. Hopefully, I don't
So
talk to him only over video.
I don't know if my for me going on a benzo was the same reason. Well, I wouldn't say the same reason, but a fair reason. Because when I went on to a benzo, it was what actually stopped the seizure because they couldn't get something else to stop the seizure. So I don't know if I can be a fair judge in that case, but I did get myself off the benzo. Hey.
So I do got something here. It's not benzo, but it goes along with our last question. The last question was, should I switch to Briviact, I believe. Oh, yeah, should I switch to Briviact was the last question. And this one is overnight switch from Briviact to Keppra. My doc told me I got 100 milligrams of Briviact to 1,500 milligrams of Keppra overnight because Briviact is on shortage where I live. I used to take Keppra before I started Briviact, and I know I had good seizure control. I have read that Keppra takes more time to build up in the system, so it is really safe. So, is it really safe to switch like this? What is your opinion? Uh, Basically, cold turkey. I would never do that with any medication. Talk to your neurologist and ask them, is that the only option, going cold turkey? Because it doesn't sound like a good idea. But I'm no doctor. I'm just going off. It sounds like you might have some seizures just going cold turkey. It just sounds like the possibilities are endless. I wouldn't do it. I wouldn't put myself at risk for a seizure, and I think that's what would happen.
And remember how long these meds stay in your system, because Keppra is one of the ones I think takes like months to actually get off of altogether. So if you're starting another medication at the same time, that interaction might not have a good effect either.
I think
Yeah.
I read somewhere a rule of thumb: if you look up a drug's elimination half-life, and multiply that by 5, and that is approximately how long it will take for that to be completely eliminated out of your system. So, yeah, with a lot of drugs like clonazepam, with um, a 48-hour half-life, 48 to 72 hours. I mean, that's
Yeah, and
weeks,
I
you
will
know.
attest to it that it will give you a seizure.
Wait, what'll
They
give you
give
a
a
seizure?
non-epileptic
Keppra?
person a seizure if they try it.
Clonazepam.
Yeah, Klonopin. That's just the one I know offhand the best because I've researched it. But yeah,
I
half-life
researched
times
it,
5 is,
and the pharmacist told me, be
yeah.
careful. It will give you a seizure, most likely.
Most likely. That's
The seizure half or the half-life of seizure medications can be anywhere from a few hours to several days, and it's influenced by factors like age and what other medications you're on.
Yep. And it's like the withdrawal period from it. That's basically what it was that I think I faced that last seizure with.
You do not suggest Briviac switching overnight. Well, it doesn't look like this person had an option.
No.
Also, yeah, it's basically just acts and opinions. Um,
But that they're keeping records.
yeah, I'm gonna go through these two comments. One says Keppra and Briviac are direct replacements for each other. Their mechanism of action is identical, and neither medication requires titration. They full effectiveness within 30 to 60 minutes of each dose. There'll also be lingering Briviac in your system. The other comment says, so I took both and I don't have the feeling that either one builds up faster or slower. The effect is similar. Kepra's a little stronger and a tiny bit safer, but that's just my personal experience. Basically, I think that the quick change is not a problem. It worked well for me.
I wonder if they're considering them direct, like one-to-one replacements for each other without having to do any sort of like cross taper or titration. I wonder if they know, like, well established exactly how much Briviact is needed to replace exact amounts of Keppra, because if that's something that's different with each individual, that still might take a little bit of adjustment. you know?
I think earlier. Go ahead, Angel.
Well, I think I mentioned this in the last episode where because I when I look around on the Reddit and I notice a lot of people that complain about like the Kepa rage, it's because they've been on like 2,000 milligrams or plus. And you never hear pretty much the people that's under the 2,000s complaining about Kepa rage. So I think Kepa rage may have that. Um, it's like at this point, you're going to get that Kepa rage feeling, you know? Like if you hit the 2,000, it's too high, but you know, at that risk, you know, you're off, you're trying to prevent a person from seizure, but at the same time, you're putting their, I wouldn't know what you call it there. Like, I wouldn't call it personality or something. You're changing their personality to basically be like bipolar.
Anyway,
Yeah.
there's another post here saying, how do you journal your epilepsy events? Looking to test a new way of taking notes of the events and show to the neurologist. What kind of experiences have worked for you? Notepad on iPhone. What about you?
For me, I tell my mom. For some reason, I think other people remember better than me. Nobody remembers better than writing it on paper, but yeah, when I tell my mom, she pretty much writes everything down, and that's pretty much stuff I can do.
And
And
for
I
a lot
don't
of us,
know why
papers
I
get
don't.
lost.
Yeah. Or if one of those papers get lost, it's in my mom's memory, um, which isn't that good at all now that I think about it. Um,
I hated doing that for a while with text. You know, whenever anything happened that was worth noting, I would text like the same, kept it in the same thread. So it was a record. You know, it had a timeline on it, but it was just texting every little thing to this one person. So that's another reason I had to change. Talk about a morbid conversation.
I got something here though. So I got something here. Photosensitivity life. Hi there. For those who have photosensitivity, how does it impact your life? Are you restricted from certain activities? What specific types of light, etc., affect you? Some more than others? Has your neuroepileptologist told you you can, you can or can't do X thing? Thank you for your input. I don't have any photosensitivity. Lights don't bother me whatsoever. Um, yeah, so my epileptologist or doctor or neuro says I actually don't have one. So no one's told me anything about lights ever. And also being that I was almost had them. I mean, so when I started having them in front of a computer, so they thought my seizures were photosensitive until they had me in front of that flashing strobe light thing, and they ruled that out. But yeah, that was over a decade later. Um, yeah, and yeah, anybody having a problem with photosensitivity or lights?
Maybe one or two seizures that I could think of, but no, generally. I mean,
Would
like my first seizure was a photosensitive seizure. I was playing a video game and drinking lots of hot chocolate and stuff, and you know, so I'm assuming is that the definition of photosensitive?
Yep. Seizures triggered by light is basically that.
A little kid, like really focused on this video game, and yeah, so maybe there was another one, with video games, but um, no, yeah, I'm not a photosensitive person.
There is one comment here. It says, not photosensitive for the most part, only when I'm really struggling, super bright lights in the corner of my vision, and when I'm in a car and the sun passes through the trees and does that flickering thing, I know someone will get me. I'm not exactly photosensitive. It's difficult to say because then you're going to be like, well, that kind of contradicts what you just said. I'm not photosensitive. I'm just going to say it. And I don't have seizures like at concerts and stuff where there's a bunch of lights flashing and everywhere. But if someone was to take a laser and just like go right across my eyes, then I'd have a seizure, which is very confusing because like I can go to a concert and I see all the lights everywhere and it did not bother me. But if someone just takes a laser directly and stick it in my eyes,
Oh no, I could totally get that. I mean, there's a difference between how do I put this? Organized light and stuff. Okay, here's something I hate. I hate car lights. They're so bright, and, you- and does anyone notice? Okay, it's just me and you here talking, but they're halogen lights, and they're extremely bright, and uh, they're not causing me seizures, but they're just so bright, and oh my God. But, but, the last concert I went to, it was lights everywhere and it was fine. Didn't bother me at all. I mean, just, yeah. I mean, I could be annoyed by light. I could be, yeah, a little put off, even, dizzy, they can even make me dizzy, but, definitely not affecting, the epilepsy at all.
there's another post here I'm on. It's pretty long, so you guys sit back and listen. It says, as a caretaker, how do I support him better and get him to keep up with his medical while I struggle with my own? I'm so frustrated and scared. My husband has seizures. After a focal, he is more than likely to have a tonic-clonic. I have hurt my bulging disc in my back to keep him safe. The last one, I woke up him falling off the bed backwards, and the image still hasn't stopped intruding my thoughts over and over. It's been over a week that I have been asking him to ask for a refill of his emergency med. He said there was a problem with the insurance yesterday, and this evening he said he had no refills left, so the doctor had to approve it. He just had a focal seizure, which I was already on guard for because I've been seeing signs, and I woke him up yesterday morning calling for help because I herniated my disc in my back trying to bathe our daughter before school and couldn't walk or stand. I asked for his phone and looked for my chart. It only shows that he requested it tonight after hours. I can't talk to him about this because I can't cause stress after a seizure, but I plan to when he is better. I'm sorry, but I plan to when he is better and has had time to recover. I'm not sure how though, or what would be the best way to go about it. I'm in so much pain myself and still can barely walk with my cane. I really needed him to be on top of it this time. He has been before. I trusted him when he said he already had. I left a voicemail with his neurologist, and a day or so before I herniated my disc, I never got a call back. I'm terrified. He always pushes back when I call 911 to send him to the ER because I have done all I can and the seizures keep happening. I need the emergency med because he chokes on his blood from his tongue more times than not. I know he cares. I know he cares about me, but when he does things that when he does things, I feel I know he cares, but when he does things that I feel he cares more about how little he cares for himself than how much he cares for me. I don't know what to do now. I don't know what to do to not end up in this situation or not help him through this. It's been 3 years, how slow, steady growth, but he still won't go to the primary care doc. He won't go do his blood test. He won't go to the dentist, and he won't go to the eye doctor. Does he just expect me to watch him deteriorate right in front of me? I'm exhausted, but I can't sleep because of how scared I am. I barely get quality sleep because I'm always half expecting him to have a seizure, and I don't know if it will ever be the worst one. Where could I the worst one where I could lose him or not? I feel like I have PTSD from it too. I also don't explain it to him because he is the one going through it and he already apologizes when he has a seizure. But I don't know how to feel when he does and I don't have an apology. I've asked him to not apologize because I feel guilty every time he has one and every time he has one and he is the one who is going through the seizures. I want him to take care of himself and will be there when he needs me to the best of my ability. My body is falling apart, taking care of him, taking care of the gaps of his disability leaves me leaves me that that are out of his control. I just want him to control what he can and not apologize for what he can't control. He downplays things when I say how serious it is and how scared I am that I could lose him with every seizure and how much scarier it is. It is without a plan, feeling helpless and alone, watching the timing and calling the ambulance. I don't have family around to call for help. And we have 3 kids. I can't go to the hospital with him when he does go. So I moved us closer to a better one. My cash up. I added my cash up to his Uber account in case he has to go to the ER so he can get home after. I did most of the lifting with moving because he didn't have anyone to watch the kids, and I am the only one who can drive. I feel so overwhelmed and I don't know how to do better. I'm so scared right now. Wow. The question was, how do I support him better to keep up with his medical while I struggle with my own health? Oh, that was quite a bit. Sounds like you're going to need help from someone around you. And it sucks that I'm just thought about it. You said you don't have anyone around you because family or no one was close. Um, I don't know. You got to tell him. I know you said it could stress him out of going through that argument with him, but you have problems of your own. You got to put yourself first sometimes, because 2 people with problems isn't going to help at all. Um, yeah, you can't help him if you're broken. Um,
That may not be so easy to I mean, people are so dedicated to each other, you know, that they'll drive themselves into the grave taking care of um, a, a person who and this is happening all over America. You know, we can't take care of sick people, and we have to do that in our homes, and it's a real shame. It's terrible, and yeah, that's what it's sounding like here. This woman is way over her head. She can't. She needs help from. She needs help emotionally and medically. Uh,
Yeah, they need to have a serious conversation. She also said she has her bulging disc in her back, trying to keep him safe. So
yeah, right. Uh, I suppose every conversation with him would be necessary, but um, just changing this person, best of luck, because I've seen similar situations. People, they're hard to change, but
yeah, and this person kind of seems a little selfish. I'm sorry, for lack of better words. Like if you tell this person that, actually, I think she said she wasn't telling him because of his mental health. I mean, because it could stress him. But for this person to just not be taking care of themselves, um, yeah, this person is an adult. They should be able to see that you need help, and to not be helping you because putting their epilepsy first, knowing you have problems, is a little selfish. Um, that's just personal opinion. I think that person is not very caring about your problems, and like I said, two broken people can't help each other. So you just getting worse and worse and worse isn't good, and you not being able to point that out because you don't want to set them off, or I don't have a word for that, but yeah, it's not good for anybody. Uh, I can go down to one of these comments. Yeah, Kate said it just takes a conversation. One of these comments here says, you have to go talk to him. He can't play around with meds. He has to be taking care of his daily meds too. You also can't pour from an empty cup. I'm a hypocrite saying this too, by the way, because I am terrible at it. I'm a full time caregiver for my kid's grandma with Alzheimer's dementia. I'm great taking care of her and my kids, but terrible at taking care of myself. But we have to. Got to take care of you to be able to take care of him. And goes along with what I said. You got to be able to take care of yourself before you try to take care of someone else. Another comment here says this is a really difficult situation, but it can definitely get better. For me, for example, a big problem was that I wasn't even aware of how I appeared to others. It took me quite a while to realize how powerful this medication was, how exhausted I felt, and how much of a burden I was putting on those around me. Often the effects are only recognized when the relationship has gone and has already shown serious cracks. I would definitely recommend going to the neurologist together. In this case, probably changing doctors and discussing everything in detail. This way, the both have a clear idea of what to do and where things stand. Got something right here. It says, Has anyone had the same experience as me? I've had epilepsy since I was 6 years old. At first, I only had absent seizures. Then at 14, I had my first tonic-clonic seizure, and something weird happened. When I regained consciousness, I felt like I was seeing everything from the outside. I was crying and screaming and couldn't calm down. Since then, it's happened every time I have a seizure. It's as if my body and my consciousness are completely separate from each other. I can think clearly and talk to myself while watching myself panic, cry, and scream. I don't know if this makes any sense, but has anyone ever experienced the same thing? I got something. It says, anyone have seizures while sick? Just like the sub says, I'm polling the crowd. If you guys have minor sickness, say it's a cold, etc., do you find you have more seizures? I seem sure see I seem sure to anyways as I'm fighting the plague right now. Ha ha. Just wondering. Does anyone have seizures while they're sick?
Yeah, I mean, I've had vocals while I was under the weather with COVID, um, beginning of this year, and um, and when I had it last year. So it's, I mean, I don't know if COVID is in a different class. If they, by sick, they just mean like your run-of-the-mill sinus infection kind of thing. That's not,
COVID causes fever, so it will clash.
yeah, yeah, I guess the biggest fever-inducing things I've had were COVID. So I haven't had a like a rhinovirus cold really knocked me down like that. But now that I've said it, it's gonna happen, you know. That's the way it goes. But did they say they had a fever? Was it
No,
just
it's
like do get seizures when sick?
um yeah, this person is saying they're fighting the plague right now. So they're just wondering.
The plague. I wonder if that's a euphemism for like COVID.
Yeah, that's what I'm thinking. It says I seem to oh, the question was anyone have seizures while sick, and it said I sure seem to, as I'm fighting the plague right now.
Yeah. So yeah, I sure seem to too. What about you guys? You Pookie, you ever have COVID?
For some reason during COVID, I had a lot more seizures than normal, and they were out of control, and I don't know why because I was like eating good and like in a healthy place. Um, yeah, my seizures were not good during the pandemic. They were up and down between 6 to 8, at the most maybe 9 tonics a year, um, every other month, which now it's like every 3 to 4.
Yeah.
And I'm 7 days past 4 months, so headed to 5.
Mhm. Yeah.
Keep my fingers crossed.
Nice.
Yeah,
Did you have COVID during the time, like in the lockdowns at all, to like
dude,
possibly explain that?
I did not have COVID, and I did not get vaccinated. So
Maybe you had like this the sneaky asymptomatic long COVID or something.
I would hope not, but it is possible. And
I mean, it seems like anything is possible with COVID.
yeah, Yeah. I'm glad that I did not get the vaccine and I did not get COVID. Some of the
Anybody
comments,
else
well,
get COVID here? Just sorry, just wondering, like Kate, Angel, Kev, any of you guys get COVID and seizures during that or
No,
associated with the sickness?
didn't
Few
get
years
COVID
ago.
or
I've had COVID twice, Mark.
Yeah.
Yeah,
Seizures?
Yeah.
when COVID started, I had COVID.
Yeah. Did it change anything with your epilepsy for you guys?
I
I
know I
didn't
was
have
having
epilepsy at that
seizures.
point.
I was really sick though. I had I was the sickest I've ever been in my life. I don't think it was the flu. I think it was something else. I was sick for like 6 or 7 weeks.
wow.
Just yeah, and just horrible lung stuff, everything. Um, I think it may have been a minor form of pneumonia, even. But had laryngitis, couldn't talk for 2 weeks. Yeah,
Mm,
I was just, but no seizures. That was good.
mm,
That held
nice.
up. But yeah, I was horrible. I don't know, terrible sick. But yeah, I'm good now.
High five to that.
Yeah.
I do have a couple comments here. First one says basically the only time I had a seizure when I was sick was when I had the flu when I was little. I had to stay home from school for like a week. It might sound really nerdy, but I was kind of, to be honest, I like some classes, specifically history. And when I got sick, I think I missed out on a lot of ancient history week. For reference, that's my first period to learn about. I think they were doing Egypt or Greece, especially my favorites. Anyways, during that time, I was barely eating anything, though I was staying hydrated. If I wasn't eating anything or sleeping, I was either throwing up or having a seizure. Yeah, clusters. And being sick at the same time sucks. Even if you're even if you are sick and can watch movies all day if you want. Seizures all day sucks. Another comment says, yes,
Amen.
illnesses. Come again?
I said, Amen. Seizure all day sucks. Amen.
Yeah. Another comment here says, illnesses are stressor on the body and your immune system, leading to a temporary lowering of your seizure threshold. This comes with symptoms like fever, which increases neural excitability and can destabilize neurons. Immune system response involves an increase in cytokines, which can increase neural inflammation. This combination can become enough of a stressor that can result in breakthrough seizures. I don't understand people who were going to museums and stuff like that then. I mean, I'm just afraid to get sick. I'm afraid of COVID. I've seen what it did to some people.
Yeah, but I do think there is a certain amount of natural immunity you have to build up. You can't just hide inside all the time. So, I mean,
Yeah.
I
um,
beg to differ.
And
but
I think it was more.
I'm not talking about COVID, but
I
there's
was just saying
germs.
I can hide inside forever.
Yeah.
The world is dirty and filthy. I mean, so you have to be exposed to it, and you know, see when your body encounters a germ, you have to be able to kill it, and or whatever happens. So you got to build up immunity to said uh, crap that comes into your body.
I agree with Kevin. There is a certain amount of immunity that you have to build up, and it's not going to be by staying away from it, you know?
I got another post here. It says, "What type of seizure is this? Myoclonic? I was diagnosed with epilepsy after my second seizure a few years ago. I'm currently on Lamictal, and I get these jerks where it feels like my brain does a factory reset. I can be doing anything for a second, my body will jerk. Random part of my body, it feels like I black out for a second. I stutter a little bit if I'm talking, and get a rush of anxiety if after it happens. I will forget what I'm talking about in some situations, and they will last for a split second. Does anyone else experience this? I have experienced that um, several times, and I've taken it as maybe I'm just sleepy and blacking out because it's more like a, and I don't know how exactly long it is, but I've had those, and it always seems like I just had missed like 1 second, like a blink of. I always take a nap afterwards because I feel like I'm sleepy. But yeah, I've heard a few people say those might be seizures, so I will be getting that checked on someday. Anybody have any idea what kind of seizure that is?
Oh, talking about the brain twitch, the blacking out for a second. Yeah, those were the smaller myoclonics that Jeff asked about. Yeah, it definitely sounds could be anything. But I wouldn't rule that out as a myoclonic, definitely, because I had those all the time, and I had this constantly, you know. But what else did you have? She,
On the Lamictal, get these jerks. Diagnosed with epilepsy after second seizure. Says I can be doing anything. And for a second, body will jerk. Random pieces. Yeah, it says random pieces of my body. Stutter if I'm talking. Black out for a second. Then I get anxiety after for a second.
yeah, that could sounds sounds a lot like it, I suppose. Definitely ask your doctor, bring it up.
A few of the comments here. One says this sounds similar to what I'm experiencing. I'm not diagnosed with epilepsy, and it only happens at night for me. But the factory reset and rush of anxiety is the same here. I just made a post on here if you want to read it. Another one says, yes, those are myoclonics. It's good to have Reddit and be able to ask people who are going through this, what is it? This one here is, I'll say long. It says, boyfriend had his first seizure, badly bitten tongue. My boyfriend is 37, experiencing his first seizure this past Sunday. We were told due to low sodium levels, not sure if I should be posting this here or in seizure subreddits. My main question is, he bit his tongue bad. We went to the hospital for Sunday afternoon until tonight, which is Tuesday. His tongue has been really hurting since it happened, and nobody at the hospital really did anything to try and treat it other than lidocaine and tramadol. Tramadol, not until today, though. They never suggested a saltwater rinse until today, so he basically went 2 days without anyone giving him any advice on how to properly clean it or take care of it. He has had a yellow to white coating. His breath stinks, and it seems like the side that he bit has a scab forming. Is it? It's raised and has ridges on the side. Infection is obvious. Infection is obviously nothing to delay care about. He hasn't gotten much sleep at the hospital at all, which I know could affect his healing process. We were thinking of seeking treatment from a different hospital tomorrow morning if it doesn't look any better. But I wasn't sure what a normal looking, really bad bitten tongue after a seizure looks like or is treated versus getting infected. Any advice or tips or tricks would be greatly appreciated. It's been a whirlwind of time. The last 3 days, I just want him to have some relief. I know it'll take time. It'll take a while to heal. We we go him protein shakes, numb numbing spray, etc. I'm really just wanting to make sure it's not infected by those that have had experiencing or knowledge about it. TIA. What's TIA?
Thanks in advance.
Oh, I almost said never mind, but that's a good one.
Where's Toaster at? She's the expert on tongue and seizures, bites.
Yeah. She said she'll come back. There's some comments here. One says, I would do a liquid blend soft soupy diet with lukewarm saltwater rinses after every meal. Try not to use the numbing spray. That's going to irritate the injury. Ibuprofen for pain, not the numbing stuff. Even swishing around slightly warm, not hot water after drinking anything other than water should help to flush the wound. Until it starts healing, I wouldn't drink anything with sugar. Honestly, I just would drink H2O, no milk, OJ, or even sugar drinks, even zero sugar drinks. It's all going to irritate the open wound in the mouth. Just drink room temperature water and rinse the salt water after every meal, and it should resolve fairly quickly. If it doesn't after a day or two, I'd ask for antibiotics, but limit any form of sugar right now as it feeds oral bacteria. Good luck. I hope he has a speedy recovery. One more comment. It says, if that's what he needs, if that's what he needs to get nutrition, it's okay. But it does have natural sugars or sugar substitutes, which will still impede healing or aggravate or cause pain to oral wound, as it is food for bacteria. So if he needs to drink these to get nutrition, he should be using salt water rinse after drinking, and getting as much water as possible is key. Staying hydrated is going to help it so much faster. Lightly brushing his teeth, tongue, cheek, wherever in his mouth is tolerable, just with water, and then using salt water to gargle and flush his mouth will help a lot. Oh man, those were long responses. Go ahead, Mark. Ugh.
So I mean the piercing aftercare for the tongue piercing is basically just you rinse your mouth with a disinfecting mouthwash after every single time that you eat or drink anything except water, and after every single time you smoke anything or vape anything, inhalation, anything that goes in your mouth that is not water, you rinse your mouth out with mouthwash afterwards. And I mean, that worked really well for my tongue piercing, and I followed that every time I chewed up my tongue, and they heal, I mean, really quickly. So that's something that I would suggest, and something that I didn't hear mentioned among any of these other people. They're talking about sugar and this and that. I mean, the sugar in your diet doesn't matter if it's not staying in your mouth. Rinse your mouth out, wash it out, clean it out. And if you're thorough with that, then you're not feeding any of that bacteria there anymore, you know? Like, you don't need to be that careful with your diet and change your diet afterwards, specifically if you follow up with the oral hygiene. I mean, in my experience, maybe I haven't chewed my mouth and tongue up as badly as some others, but I think that what they're saying is overkill. Just brush your teeth, make sure you do it at least twice a day, and rinse your mouth out with mouthwash after every meal and anytime you smoke.
Yeah, I read those comments and now I have another post here. It says, "Am I having many seizures?" Listen, I know this may sound stupid, but I want questions answered. So basically, I have autism and ADHD, and I take 36 milligrams of methylphenidate phenidate pills for concentration, and I have been on methylphenidate since around May or June this year, and I experienced this weird thing, especially when I'm trying to work where I want to get some work done, but then, especially if I feel overwhelmed, I sort of lose control of my body while still feel like I have control. But when I tell my body to do something, it just starts moving weirdly. And when I start, and then I start feeling like I'm uncomfortable in my seating position. Then I continue to move weirdly. Then it would just stop. Then I would take a nap or try to get back to what I was previously trying to do. By by the way, I've never blanked out or had any convulsions, but I'm wondering if this is just advanced neurodivergent paralysis, especially ADHD, caused by feelings, being overwhelmed by the work I have to do, or something serious like a seizure. Um, if you're not diagnosed with epilepsy, I don't want to just be like you have epilepsy because, yeah, you have some other things. I don't want to just say those seizures could be anything. That stuff you're going to need a neurologist for. I don't have the answers exactly. Any of you guys have the answers for that? Many seizures.
I mean, what they describe could easily be a form of like a short, small scale, like shutdown, auto or autism spectrum shutdown. They mentioned neurodivergence, so um, that's clearly on the radar already. Um, and it is something that happens where just in the midst of something that is extremely intense, either emotionally or cognitively, um, just the brain can sometimes short, or the neurodivergent brain can just short circuit and just like an abrupt shutdown that's, I mean, to describe to an external um, observer, for lack of a better term, it sounds kind of similar to some like a sort of absence seizure. So I can see why that is a question in their mind, but without their history and without more information on their um, psychiatric background and their upbringing, it's difficult to make any sort of guesses about that. The best I could say is to recommend that they speak with their neurologist and specifically see about um, speaking with or getting a referral to a psychiatrist, if possible, a neuropsychiatrist, someone with a a special focus, not just on the therapy and the diagnosis, but of the nuances of those conditions that come along with a lot of our sort of funky brain wiring. So there's definitely something there. If it's bothering them enough to ask the question, it should be a question to bring up with their doctor. And it certainly sounds like a very, very valid question to bring up to a doctor. It's not, you won't sound crazy going to a doctor and saying, hey, I got this and this going on, and I'm wondering, it's a very reasonable question, even if they'll reassure you and say, no, it's just, this other thing, and send you on your way. But yeah, I'd follow up.
That's the problem, though, these days. It's like very few of us have very good doctors that are actually helpful. Like, most want to dismiss it right away.
Gonna go to the comments. One comment here says, kind of sounds more like overwhelm or meds side effects from seizures, other than seizures. The in quote still aware part doesn't really match seizure stuff. Another comment says, it's not stupid. It's not stupid, but you should see your doctor. Write detailed notes and when, where, how, and often, and what was going on before. I wouldn't jump to seizures. Could be a few different things. Could be as easy as changing your meds. Another one says maybe focal tics. I would go see a doctor. I have ADHD and low spectrum autism. I have not had anything like this, even under severe stress. I also take a stimulant to help me focus on getting things done. While Reddit has a lot of people to share experiences, it's best in a situation like this to go see your doctor. One more
Yeah,
comment. It says,
just to know, I don't know if it was covered or mentioned when the question was read out, but the methylphenidate that they mentioned that they take is Ritalin. So it is a stimulating ADHD medication, fiddling with the dopamine directly. So that's another factor.
or what'd you have to say, Kevin?
So could the medicine be causing some sort of tremor or something in this person's um, biology? I mean, it seems we're, putting the cart before the horse here. It seems like um, because they have ADHD, they're taking a medicine, and the stimulant might be affecting their body in a negative way.
How negative? Which part? Please elaborate.
Well, it's a stimulant, correct?
Correct.
All right. Well, I don't know. Perhaps this person doesn't even need this medicine. I don't know. But if you're, we all know that doctors do assign medicines, and perhaps they don't need this, or maybe it's a throwing that
That's
out there.
A couple days ago, somebody was saying, I feel so beat up after my cluster yesterday. Anyone ever refuse to be taken to the ER? I had a reaction to a cortisone shot, proceeded to have 7 seizures within a few hours. Boyfriend kind of freaked out, called the ambulance, refused to go because I've been in that nightmare before. They give you a benzo and then keep you up all night checking on you. Refused to go, yes, because I was aware enough to know that I didn't want the bill.
Sometimes I'm just awake and I don't want to go, or sometimes I don't think I need to go. But then there's always those family members who are like, you need to go, and you're having a seizure. It's been a seizure. Most of the time, it's those ones who've never experienced it, who are just for sure going to be like, call the ambulance, or they wake up in the ambulance. And even if I tell them I don't want to go, then they're arguing with you about why not want to go. And you didn't see it. You didn't have to go through this and that, and so on. Yeah. We don't have to see them. So every time someone argues, it's usually family about it. And then I end up going. Go ahead, Angel.
Yeah, it's like the people who don't have to, it's like you said, the people who never felt it or anything don't realize it. But then there's another side to it where stuff like if people are filing for disability or something, a disability lawyer wants you to go to the ER every time, even if you don't need to.
Yeah, it looks like they were saying in the comments that I have a couple times refused to go. Same thing over and over again. And I don't need to hear it every time. I have strict rules regarding when I need to be taken to the ER.
Yeah, even the ER says you don't have to be, even your doctor will say, like, you don't have to go to the ER every time. You know, like they say, if it's more than 5 minutes, then yeah, go. But it's like some people want to send you right away just because you're having one.
And this one's saying if I'm coherent enough to be asked if I want to go, I'm not going. So that's a good way to put it too.
Yeah, there's times where I didn't want to go, but I just couldn't get the words together, and I just kept not talking right. They're like, we're gonna take you. You can't form words, and then I'm frustrated, and I'm like, I can't get it. I'm not sure why. And then I just rant off into another speaking words that make no sense. And yeah, do that a few times, and I still tell them I'm talking right in my head, but they don't take that as an answer, so they take you to the emergency. And then they never pay for the bill, so yeah. Don't you think people who send you to the emergency room should get the bill? You're like, I didn't call the ambulance.
100%.
I wonder how many customers have ever tried to ask that.
Yeah, it's be like, I don't remember going there. Sorry.
Easier to take an Uber. He's having a
Easier to
seizure.
stay home.
Call him an Uber.
We'll be like, well, guess what? If you want to send me to the ER, you're paying for the bill. See how fast they'll say no.
Mm-hmm. Yeah. I used to live right around the corner from the hospital, so people were able to come get me and all that, or give me a quick Uber. But I think that people should get the bill.
I
Do
think
have another
that's why they
post
always
here.
make sure never to even when it's a stranger, they make sure not to get your contact information or anything in case something ends up happening. Anything ever happened in public where a stranger ended up calling one, but there was like no effort made to stay in touch or find out what happens to you. That's probably a pretty common thought behind that too. You help the stranger, but you don't even want to hear from them if it has anything to do with the bill.
Yeah, I've had a person call the ambulance that said they only called because, no, they said they only stopped because I looked like someone else.
That's bystander effect in psychology. Large cities, large groups of people, nobody goes and calls 911 because everybody assumes somebody else in the crowd is going to go and call 911. There's a case, I'm forgetting her name, a Italian immigrant lady in New York City back in, I think, like the 1930s. She was stabbed 7 times in an alley in New York City in front of a dozen or so witnesses who all watched, and people walking by on the sidewalks saw her. Um, People in the apartment buildings around heard her, heard it happen, heard her calling. Everybody assumed somebody else was going to call the police, and nobody did. And she died, and her murderer was never found. Was Jeff waving? Yeah.
They all assume that somebody else would call, but that's not the real reason. The real reason is nobody gave a shit. And that's how it is in New York City. You could kill somebody right in front of you, and you're just going to keep walking. It's just the way it is there. Nobody gives a shit about anybody else. If you see somebody getting mugged on the street, you keep going. See an old lady getting pushed somewhere, no big deal. Doesn't affect you.
Yeah, I've heard people say it's not my
Don't get
business.
involved lest it become your problem too.
I'm sorry?
Don't get involved lest it become your problem too.
Yeah, kind of, it's all part of it. People just don't care. It's the kind of
To a
place I
certain
moved out.
extent, you never.
I moved
To
out when people would rather bump into you than move a quarter of an inch to avoid you. And that's when I left. And it's
not a
gotten worse.
friendly bump to you, right?
No,
Yeah. Um, wow. That's
it's really
heavy.
yeah, it's just not one person cares about any other person unless they're in their circle. And then it's only a minimal caring. Okay, end of rant.
I got a post here. It says relationships. Oh. I'm 22 and my mom won't stop bugging me about getting a boyfriend, but I can't stop worrying about what could happen because I have ODSP since I can't work and I constantly have the fear that some guy will just use me for my money and think my seizures are a burden and leave me. Sometimes it feels like sometimes I feel like I'm just gonna be alone forever since I can't do anything for myself. No guy would like a girl that's just like me. What do I do? As a man, I should say you stop doubting yourself. Somebody out there for you.
We really could have used Kate's view on this just a second ago. It's kind of a
He'll be back.
So now this woman is afraid of men taking her money or whatever or something,
Or being a burden.
being a burden. She's just got to have a little confidence, or that's trust is the foundation of a relationship. Or even I know that's pretty basic. I mean, you got to be able to trust people, and if you think everyone's going to steal from you, you're not gonna have a relationship. So you gotta have a little confidence in yourself and in other people. I mean, if you think all men are evil, then you're not gonna get any. Well, that's my opinion as a man.
Gotta
This
put
girl's
yourself out
22. She
there.
just, yeah.
You're gonna find basically what you're looking. What you don't want is what you're gonna find. You know.
Yeah. And about the mom, what do you guys say about that? The mom is bugging to get a boyfriend.
Uh, uh, Anyone else
I
want
go,
to take that one? Because
You should tell her mom she's going to pick up some guy that's living on the street and make him her boyfriend. If that'll make her happy.
go get some random guy. It was
Yeah.
your idea.
All right. You wanted me to have a boyfriend, so here he is.
Go get Pookie. Pookie's awesome.
Get him on me. On broken goods.
He's 22. That age difference is a little.
You're not broken.
Some of the comments. One says, I know what you mean. I'm 25 and I feel the same way. Another comment says, I'm 45 and I feel the same way. I still live with my parents. I had bad relationships over the years lost. Be careful when you can't remember. My ex boyfriend, Effer, actually said, allegedly joking, that sex was fun when I was seizing. WTF. Now, not only do I feel lonely and worthless, but scared. Do not let anyone treat you bad for any reason, and no isolation. Sending healing and love your way. Um, One says, I am 53, 11 years widowed, grown children, 3 medical conditions, which includes absent seizures. I want to get out there to date, but I too feel like I would be a burden. Who would want to deal with someone who has not 1 medical condition but 3? I try to hold on to a Dear Abby quote, end quote. Don't let the past dictate who you are, but let it be a part of who you become. It's hard to remember. It's hard remembering this, but I try to. Another comment. One says, please don't assume that no one will want you. I have noticed that tons of us on this list have a spouse, significant other, partner, etc. Many of them were found from post diagnosis. You're really young and you're going to meet people and have no doubt that you will find the person you need. I am, however, annoyed with your mother. I don't feel really, I don't feel ready to put yourself out there for a relationship. Then don't. I'm sorry that she isn't listening to you. Try to ignore her. I know how easy this is. Take care of yourself. They should have put how hard this is. Not easy.
yeah. Typo, maybe.
Challenging.
Negative easiness.
One more comment. One says, I'm not exactly in the same shoes, but I'd say to date only when you think you'd be comfortable. Like, I'm 23, but I still feel hesitant to have a girlfriend, can say that, can say that don't mention about the money at all to the person you date, and definitely start low and slow. If the person would want you for money, if the person would want you for money, one would be desperate in the very beginning, sorting out the majority. Sorry, but I can't help anymore as I've never had to experience such, but definitely check for red flags if you think he's cheating or seeing someone else, because I've been betrayed a few times in school by those I considered my best friends. Have always been hesitant ever since. Says, is it normal to have random thoughts bouncing around your head? Maybe I'm in the wrong, place to ask for this, but I was wondering if this is normal. The thoughts we, the thoughts we are almost like when falling asleep and going into a dream, but I'm awake when it happens. It is more like thoughts, but they feel so random and they are just not mine. My head also feels very fuzzy. The question is it normal to have random thoughts bouncing around your head? I have insomnia, so that's what's usually going on with me. Is I just got a bunch of thoughts just over and over and over, and for some reason they always seem like the best thoughts that I have, but I just can't get it off my mind. So I'm thinking about it over and over and over. It's always a good thought, just wrong timing.
Yeah, I agree. I was going to say, like, who doesn't have a bunch of random thoughts just bouncing around their heads at, you know, odd times? And I think us with epilepsy, we get it at definitely the wrong time, and we have to definitely control it more, especially because certain thoughts might stimulate us too much and may cause a seizure or whatever. But yeah, we have to be careful with that. But it's not just that person, it happens to all of us.
You mean random thoughts during the day or just sleeping? Just any random thoughts we're talking. Because, I mean, I don't know. Just,
Sorry.
no,
I
I
don't know
mean,
what you're talking about.
uh, just are these random thoughts just anytime during the day or, like just at night?
This person just random thoughts.
All right. Okay. Cool. Yeah, I used to have a lot of them. Uh, when I was a little younger, I mean, maybe 10 years ago, I would, you know, yeah, I was never, I would never stop moving. I had so much energy and I think after the surgery and they put me on clobazam and the Depakote and topiramate does not help. I think it's mostly the clobazam that it kind of I that inner narrative that never shut the hell up. Yeah, that kind of went away, and I really miss that. And yeah, and I always talk to myself during. I have a ritual for going to sleep. So yeah, definitely.
Um, yeah, it's pretty normal. Because I get like that when, um, like the person said, um, the thoughts are almost like when you're falling asleep and going into a dream. Mine's just like that. I'll be trying to lay down. Well, no, I'll be laying down, and these are the times I'm explaining when I have insomnia. It's like I go into a thought, and it's like a thought. I want something I want to think of, but then it's like bad timing, and I can't get it off my brain, but I can't stop thinking about it. So it's just like over my mind over and over. And sometimes it's I look up and 2 hours have passed, and I was like, oh, I thought I was dreaming, and no, I was just laying there, and I was awake thinking of this. I end up putting those pieces together. Yeah, it's just like laying there for that long can get to me, and I'm like, oh, well, I was laying down instead of falling asleep. Like, why am I laying here staring at the ceiling? Is what I get sometimes, and yeah,
here's the problem because the brain goes in loops and you'll get stuck on one thing. And what I do is I tell myself a story so I don't get stuck on one thing. I'm not thinking about like, oh, the dog or something, and that annoying dog or something. And so I'll tell like a science fiction story and it'll be crappy, but it it's good enough to get you to sleep because like it's like meditation, but it's like, you know, your brain's focused, but you're going to sleep. So there's nothing rattling around in your head.
I'm gonna go through some of these comments about the thoughts bouncing in the head. It says the first one says, "If this is not normal, then I'm in trouble." One says, "Yes, ADHD makes it worse, to be honest." Another one says, "All the time, all the time." It's right along with what I was saying. Someone said this would be because of the ADHD, I guess. Another one says sounds like hip hypnagogic hallucinations.
Hypnagogic. That's associated with the transition from awake to asleep. So the kind of hallucinations and sounds and visions and sort of dreamy state that you're in when you're falling asleep, not quite asleep, fully asleep and dreaming, but not entirely awake necessarily.
Yeah.
There's also like another phenomenon, hypnagogic jerks. I don't know if you've heard of that, but there are some people like while they're falling asleep, right as they're in that hypnagogic state, they'll have a muscle spasm and something that very strongly resembles a myoclonic jerk, but it's not an epileptic thing. But the jerk, your arm suddenly tenses or a leg kicks and stuff in such a like an isolated muscle in such a quick, precise way that you couldn't voluntarily replicate it if you wanted to. So it's interesting, like hypnagogic state and phases and stuff and what's happening there is a
Does it
mystery.
does that relate to going to sleep and waking up? Like the state of waking up and going to sleep?
I am not sure. I would need to look that up.
I'll look that up because I always had really bad myoclonic seizures waking up, like that time period. It's
Waking
very
up, not
interesting.
asleep, or not,
Hmm.
or not while asleep or falling asleep, just in the waking up.
That time period, like just after I woke up, it would be, um, you know, a real, it's not, it would be real bad. Just a real, shit. I don't know. I'm out of words. Go.
Were
Uh,
they, what was waking you up kind of thing?
just anything. Just you know, for school or for um, just waking up. And I couldn't.
Right
I
there
had
in the
to.
room.
I had to wait to see what kind of condition my body was in, see if my body was jerking or, and if I went back to sleep, then I would have a seizure. So that was weird. I couldn't go back to sleep. Like I got, if I tried to go back to sleep, the seizures got worse. I don't know. It's
That
very, very,
that
very
sounds tough.
strange.
That yeah, that that sounds tough.
So I
Yeah,
just basically had to wait
like
many hours. And like some days there would be no myoclonic seizure, and other days there would be, I don't know. It was just
just kind of
crapshoot,
full of
a
them.
real crapshoot.
Yeah. And that was you've had the VNS for 7 years now, or has it seizure free 7 years?
9 years. I
Nine.
had the since so it took 2 years to fully work.
Tweaking the voltage and or what it's
Yeah,
frequency
it's we.
and
I
current.
mean, look, let's just say I'm not the best patient, so I can see why it took a little longer with me. So let's, I think it can vary the time. Yeah, I mean, but yeah, it was yeah. That was it.
We are all gonna live that dream that Kevin is living right now, seizure free.
Yeah.
Did you ever think you would be to this point?
Not really. I never thought about it because it was just like my head was everywhere. I was like in a chaotic state. It was just mm, never considered.
It says, anyone else? I start to notice I sometimes start to feel off sometimes. I get the feeling washing over me that I get when I spasm. Doctors are still unsure if they are seizures, but I never spasm during it. It's just a feeling that lasts for a while before leaving. The same tingly feeling on my skin. Am I alone? Am I going insane or being paranoid? Just because I'm not experiencing, I wouldn't say you're going crazy or that you're not, or that you're alone in this. But I can't say that I haven't experienced it personally. Um, does sound very interesting, and that's something to let your neurologist know. Um, take notes of how that's going and when that's happening because I'm kind of interested.
Yeah.
Me too. And I
Um,
always have this feeling like they don't fully know, so they want to see it more.
right.
And, you know, even if they do think it's like, oh, wow, this is a seizure, but it's like they're not experiencing it, you know, firsthand. They can only experience it like, seeing it. But it's harder when you have to live it.
I
And
mean,
of
I
course the
guess
lab.
they could subject the doctors to electroconvulsive therapy and give them some nice seizures so they can sympathize with their patients and know what know what their patients are going through. But I think if anything, that might discourage the best and brightest from studying epilepsy if they were required to have a seizure. So,
Yeah, they'll be tortured.
yeah, yeah, we just gotta figure out how to expand the English language enough to like describe and convey what's actually the subjective experience. So yeah.
It's really hard for us to describe it, but we understand each other because we all know those feelings and stuff. And it's still hard for us to describe it.
Yeah, we all get such different, indescribable feelings.
Communication is just so subjective. And yeah, that's a freaky thing because you can't really get things across to people, even in your own language. Or how would a patient describe an experience? It's purely in your head. Yeah. It's like describing a dream or something. You can't it's there and it's gone. Yeah.
Yeah, I think if anything, language is a constraint on consciousness. Consciousness itself is independent and so much larger and innate to the human experience than language is. Language is kind of artificial to the human experience. If anything, it's proved by how many different languages there are on the planet, and all of them equally represent humanity. So human consciousness can't be contained within any particular language.
Um,
I think that makes somewhat sense. If anything, it's kind of philosophical.
one post here, it says, what can I do to be supportive or helpful of my partner? Hi, everyone. My partner is a 20-year-old male, just got diagnosed with epilepsy. I was there for his first seizure, and now, with his diagnosis confirmed, I wonder what I could do to help him emotionally and how to be physically supportive too. Any suggestions or tips would help me out heaps, and he's quite upset about it. And while I can't fix it, I can make the transition easier. Thank you, everyone. How that person wants to be cared for could be a personal thing, could be. That's just me. Um, how I like to be someone to be helpful, just be there. Just be there. You don't have to have your hand in everything. Just being there while I'm recouping during seizures, and maybe I don't know if he sees you care, look up some stuff. Like, oh, I looked up this. I want to be helpful. If you want to be helpful, just basically learn more about it and be there. You don't have to have your hand in everything because that can get frustrating. When someone who's not your parents try to have their hand and foot in everything you're doing. Yeah, you don't want to ruin your relationship, but yeah, don't be afraid to ask what's going on or how's the person feeling. Uh, yeah, we're fighting to not be a burden, so or trying not to feel like a burden. Um,
I I mean, be around is important, but something that I found difficult was and is um, people who care and whose like personal means of expressing their care, their love, being, wanting to help and do things and fix things for it. I mean, you can't fix this for me. I, I, it's just what's happening, so, being around and being available, I found more comforting than being like actively going and trying to do everything and trying to fix the problem of epilepsy for me. But then it's also probably, in that sense, it's just as much their adjustment to this new norm, and they're trying to deal with the significant change to the life of a loved one, a person that they care about, and that, I don't know. I found difficult to strike a balance between those two, but I mean, be around, ask them what they need, and if there's no actual specific need, then just hang out. If they need to talk, they'll do it in their own time. But if it's something they're still dealing with, then you can't fix their psychological processing of this new diagnosis. That's something that has to come within for them. So that would be my suggestion. Keep it simple. Just ask them.
But I'll read one of the many few questions. One says, deja vu at night. Has anyone experienced deja vu at night? Like, I woke up 2 times in the past few days of deja vu. Like, I'm having deja vu in my dreams, a deja vu of a dream I'm dreaming, and then I wake up. I don't know if this is normal or not. I don't have any other symptoms other than the deja vu, and I don't feel or know if I dream about it because I'm thinking so much about deja vu these days. Deja vu in my not at the nighttime is possible. In my sleep, I would not know. Um, I haven't went through the spells of deja vu, so I would not know. But I assume it would be very much possible at nighttime. But sleep itself, I'd have to ask somebody like Toaster.
Yeah, toaster would be a good one. I don't know. I don't get strong deja vu. I get these weird, like, frequently in the evenings around, around an hour or two before I go to bed, I usually get these sort of brief flashbacks of or memories of what I think what feels like at the time of a memory of the dream that I had the night before. And I'm not sure if it's actually that dream or if I'm just thinking that. And I don't know. I don't know. I don't know what's happening. I don't know why. But yeah, it's not deja vu. I don't feel like that exact situation that I've been in, in that place and time has happened before, but flashbacks of like that dream it feels like it should be in the same category of, memory,
Um,
memory glitches, weirdness sort of stuff.
There's one comment here while you're
I
thinking.
think
You would
that
like
was
to.
Deja Renee. I think Toaster was trying to explain it to me at one time because there was times in like where I went to somewhere where I never been at before, but I felt like I've been here before or I dreamed it before or something like that. But my epilepsy won't let me remember if I dreamed it. But yeah.
I've had some situations that I've tried to remember, even if it was a dream or not.
Yeah, that's happened.
Yeah, that's what I could say I had. I've had some thoughts where I'm like, was this a dream or was I thinking that it was a dream and just lost and all over the place, body confused, mind confused. And then I move on after a while.
You
But
ever had a dream? You ever had a dream where you thought you had a seizure?
a dream where I had a seizure? Yes.
Thought you had a seizure.
Thought I had a
When
seizure?
did a nightmare?
In the dream, you thought you had a seizure.
Um,
Thought
Like I
I
was
had
like outside my own head in the. Hmm?
like thought in the dream that you had like thought or like dreamed that you had a seizure. Like,
That's the weirdness of dreams because they're chronologically weird. Like you
yeah,
think you think did I have a seizure? And then, or I don't know. It's all mixed up, and it's more or less the fear that I had a seizure, and very hard to explain. It's a strange dimension. It's seizure dreams. Yeah.
I've had dreams where I felt like, well, actually, that wouldn't count then. I've had times where I felt like I had a seizure. Um, did I feel like it was in the dream? I've had dreams that I knew that the dream I was having a seizure, and then I wake up like, oh, that was just a dream where I thought I was having a seizure. Or there would be, hmm, hmm, yeah, I've had dreams to where I'm dreaming and I see myself have a seizure, but that'd be like dreaming I'm having a seizure. I wasn't all the way sure on how you were saying it because I wasn't understanding if you're saying like, have I had a dream of me having a seizure? That's what I was trying to get at.
Yeah, basically, like in the dream, in any perception, did you think you were having a did you cool? I mean, yeah. Did you have a have a seizure in the dream? Not literally have a seizure, or did you think you had a seizure? Because yeah, um, either one fits. Yeah, like
For some reason, um, I had a seizure one time, and an earthquake happened at the same time. So I was wondering if I actually had the seizure, or did the seizure just happen at the same time or coincidentally around the time as the earthquake? Because when the earthquake hit, it felt like the middle of my bed was sinking. It felt that much. Um, it felt like I fell in a little pit in the middle of my bed, and then I jumped up and I looked around. And when I looked around, I was just confused as what to happen. Then I heard my phone chirp and say there was a 4.7 earthquake. So I was like, it felt like the center of my bed like collapsed into it, like it fell into a hole. I jumped up and I was like, "Oh shit, what's going on?" And that's what it was.
How big is the 4.7, like 4.6? Like, how
4.7
often
is it's pretty bad. I mean, it could be bad in certain areas. Um,
how often is something like that coming along? Is that an unusually strong thing, or
no, those ones are when we feel like we might get a big one soon. That's what those make us think. But then there's little tremors where you just feel a little shaking and you're like, it's nothing. Ceiling fan, just a little swaying, just a little bit, not too much. Um, yeah. But the ones that are like 4 point something where our house is shaking, and like I said, where I felt mine, um, where I felt like I was sinking in the middle of the bed. Yeah, those
We
were
had
bad.
an earthquake in Philly one time. Kevin, do you remember that?
Yeah, that woke me up. I remember that I thought my air conditioner was falling out.
Yeah,
Yeah, that
I think they said
what?
it was a 4 point something.
Oh, that was
And
a 4 point something? Okay.
yeah,
Yeah.
I feel like when Pookie said 4 point something, I feel like I remember the news saying it was that like
Yeah.
some, but it I remember the earthquake hitting Philly, and I'm just like the first thing I'm like, is this an earthquake? And then I basically text my cousin and my best friends like, did we just have an earthquake? And it's like, yep.
Well, was
Like
it
all of
like
Philly
30
had an
seconds long?
earthquake.
Because it's a shame. I almost like because I was asleep and I missed it, and I wanted to kind of see that, you know?
It was a short one. It was a short one, but it was like big enough that all of Philly felt it.
Yeah. Yeah, we get those every few years, just they're not very strong, but it's pretty interesting. Yeah.
Look, look at that, Pookie. We get earthquakes too.
California, and it's often and it's annoying. Because sometimes you'll just see a little bottle of water, you'll just see the top of the water move like that, and you're just like why the hell are we having earthquakes for no reason? Those silent ones that a lot of people will miss because they're driving or something, or they're just don't notice. Those are like 3 point and 2 point stuff. But the fours, they're noticeable, and they're around 2 to 3 seconds. Not too long.
there was an
Yeah,
earthquake off the Space Coast like not too long ago over by like Cape Canaveral. And my sister said she felt it where she lived. I wonder how big that was. I've got to look that up.
She lives over here.
No, over here
Um,
in Florida, like right off of the it was the the what's it called? The center, the source of the earthquake was right off the coast of the um, Kennedy Space Center. I always thought that earthquakes don't happen in Florida, and apparently they do.
Mm.
Who knew?
Um,
And really small.
yeah, out here, it's real in California. The earthquakes are noticeable, and just waiting for that big one. It's been 30 years. I was a few months old when it happened. Oh no, so it's been 36 something years and some change. I'm born in August. It happened in October of 1989. Um, and that one was bad. San Francisco, it was really bad for San Francisco. Like hills, like cars sliding down hills and buildings falling onto, houses crumbling into the streets and so on. I don't remember all of it. I was 2 months old, so.
Well, if it does come, I want you and yours to be safe, Pookie.
Yeah, the thing about being in the desert where my mom is, um, it's not much out here, especially high buildings. Um, I'm used to the city where there's buildings and stuff next door to you. Out here, they're still building. Yeah, the
Bring your
guy who
PTA.
stayed
Yeah,
who
I would
stayed near
imagine.
us said 20 months ago this area was dirt. We're in a rural area. There's some orchards not too far from us. I'm out in the boring area of the country. Um, I don't know how people get used to this little city stuff. Um, yeah, there's no tall buildings in this city.
Comes with age sometimes too. It's just like I'm tired of the city.
I love the city, man.
I totally get that. It's a little much sometimes. Food's good, but you know, I could totally do the rural, tough word to say, thing. I could totally just, live in a cabin somewhere.
I could do that if it was by choice. Um, I was I was forced to come out here. Well, not by like physically forced. Uh,
We
Yeah.
understand why though.
Yeah.
like who
And
wants to
that's
be out here in the desert? Like,
Jeff.
oh man, Jeff loves it out here. I love it out here. It's great. It's California. Um, the medical system is horrible over here. Um, I got a comment here though on the deja vu at night. One says, "Yeah, I've also woken up with an aura impostictal. Never any concrete evidence of a seizure except for having bitten my tongue once, but I suspect I have nocturnal ones since I often wake up with a spit-soaked pillow, like soaked. I drool. I wouldn't say spit-soaked pillow. Maybe a little spot here and there. Got one here. It says solutions for fatigue problems.
I said, is there a solution for fatigue problems?
Yeah, Beats well by nature's made.
That
It's
won't help me.
you don't know. You gotta try it. Shout out to Nature's Made.
I'm on Escapri. That won't help me.
Man, you never
Thing.
know. You gotta try it.
Swear.
My doctor said, all right, the only way you're gonna get through it is if we pretty much keep you in a coma.
Oh damn.
I thought I thought we didn't like doctors. Come on, man. Diet and exercise is the key. I'm standing by that, even though I'm eating a Snickers bar.
Um, What types of exercises do you do, and how soon? I mean, how often?
I don't exercise much, but
Oh
I
my.
I try to walk. I mean, I walk a lot, but
Walking is the best exercise. I walk any I try to walk everywhere if I can get my independence to go walking somewhere.
mhm.
Out here, it's pretty easy to walk because there's these big long roads. Um, so going places like me and my mom will go to the store. Uh, we do that about twice a week, and the store is about a mile there, a mile back. Decent 30 minute walk, I guess. 30 there, 30 back. Uh, yeah, nothing's close in this town. Used to being city boy where you got a store and a restaurant on the corner and a grocery store down the street. Out here, you need a car to get places unless you catch the bus.
A lot of times it depends what part of the city you live in too, because
Yeah.
you know, yeah,
Yeah, if
Yeah.
you live closer to the downtown area, then you're good.
yeah,
They're where everything is.
yeah,
There's not many corner stores. I haven't seen one yet. A corner store out here.
yeah.
Um,
Maybe you can build one.
with
That'll
what
be
money?
your job.
Yeah, right. Give me some money, I'll be able to store for sure. It is very profitable in this environment in particular. But I got something here that says solutions for fatigue problems. First time posting here, I read quite a few experiences of fatigue problems that stems from epilepsy or from medication. I was wondering if some of you have suggestions to improve the situation. A little backstory: I started having seizures when I was 13. Ever since, I have problems with fatigue. The years 13 to 22, I was able to function properly, sleeping around 14 hours a day and zero concentration, and unable to do physical activity. My max was about biking for 5 minutes. During this time, I spend a lot of time going to appointments and looking for a solution. Tried different medications and a lot of diagnostic tests. It was time. It was a time of frustration, and the outcome of the tests were always of no result. I also have diabetes and developed severe depression, which made it hard to say which issues were caused by what. Around 23 years old, I finally experienced an improvement after many different epileptic medications. I was somewhat able to function on oxycarbazepine. At first, I thought it would slowly get better. Now I'm 31 and things are better, but I am still constantly exhausted and my life and work balance isn't good. I am still not able to participate in sports, nor am I able to slowly improve it over time. For the last couple of years, I was kind of done with constantly looking for improvement before I because I was done with the constantly being disappointed and my hopes getting crushed again and again. But I have gotten to a point where I want to try again to do something. If you have a suggestion that works for you, I have a suggestion. B12 by Nature's Made. Shout out to Nature's Made. Yeah. Haven't had a focal in over 6 months.
Congratulations! Yay! Party.
Okay,
Yeah,
don't
good.
congratulate me yet. Hold on. It hasn't been 6 months. Uh, Next month will be 6 months.
That's
Yeah.
still
Okay.
good. It's still party.
Yeah.
Party worthy. Every little bit counts for us.
It does. Take take the little victories where you can.
Yeah. The only comment says my psychiatrist prescribed me uh armodafinil for fatigue. It helps a decent bit, enough that I can definitely tell when I don't take it. Okay.
It's different for me because I'm constantly like I wouldn't say constantly, but when my medication switches, I have to adjust to a new medication. So there I have to adjust to the new fatigue or whatever. And then if I have an episode, a seizure attack or something, I'm going to be fatigued then too. So it's a constant struggle. I guess that's happened when you're medication resistant.
Yeah. Any suggestions, you guys, for fatigue problems? One, two, none, maybe.
Like to just get up and move sometimes. You're gonna be tired during the day. Um, Maybe just do 20 push-ups. Maybe that'll, get just something to get your blood flowing.
Yeah.
Get a 4-year-old.
Oh man. Yeah.
Take care of a
Get a baby.
4-year-old. Take care of a 4-year-old. She'll keep you moving.
Get you a little baby.
Imagine.
A little baby that does not want to sit still. Definitely keep you tired and it'll keep you moving at the same time. Best of both worlds. How's chasing that little baby going, Angel?
She's she's doing good tonight. She's behaving. Oh well, she's pretty good on always behaving, but right now she's just playing her game. She's quiet right here, so I'm allowed to be on Zoom tonight.
Okay, well, since you're on Zoom tonight, I got something for you. It says, how can I tell apart a nocturnal seizure from parasomnia? For the past months, I've been feeling post-ictalish every day, even though my seizures were perfectly controlled. I set up a camera to monitor my sleep, and I found out that once or twice per night, 1 hour after falling asleep, I do weird things like sitting in bed, turning the light switch on, looking at my phone, looking at my watch, and stuff like that. I don't remember most of them unless I see them on camera footage in the next morning. My mom tells me that they were confusional arousals or sleepwalking, but I feel I have the entire day resembles, but I have the feeling I have the entire day resembles post-ictal state so much that I can not believe they are not seizures. Do you have any similar experiences? I read the first comment. One says,
Right there, they said it right there. If you feel that post-ictal state, most likely you had that seizure, and it could have been a nocturnal one.
Mark.
Uh, something to add to anybody's seizure data collection um, arsenal. We always recommend get an Anycam for the night, but on top of that, wear a sleep tracking and heart rate monitoring smartwatch of some kind, whether just a fitness thing, a Fitbit type, or a full-blown Apple Watch, but something to check and see is does your odd behavior line up with a significant spike in your heart rate. Because if you're asleep, if it's a parasomnia, if you're acting out your dreams, you're still asleep. Your heart rate, on the other hand, when you have a nocturnal seizure, I've been told by my epileptologist that approximately 80% of nocturnal seizures are also associated with a significant spike in the patient's heart rate. So, do you see both of those together? And then, if you do see both of those together, on top of also feeling the postictal, like Angel says, the day after, then that's just another absolute, yes, it was a nocturnal seizure, postictal, the day after, odd movements on a video camera at night, and uh, heart rate spike on my sleep tracker are the three that have always reliably told me, if it's not something where chewed up tongue, mouth, and sore muscles from convulsing also like make clear. Um, so uh, yeah, that's been very helpful in that, because that was something that was very nerve-wracking when I was first trying to figure out how to deal with all of this. Is if I'm having nocturnal seizures like they said at the EMU, how the hell do I know when it's happened? Um, and yeah, those three.
Parasomnia. I need to look up before I.
Parasomnia is like sleepwalking or acting out, uh, physically acting out a dream, movements and stuff that, complex movements that would otherwise be seen only when a person is awake, but are being acted out when someone is fully asleep. Like sleepwalking is a form of parasomnia. Somnambulance is the word for sleepwalking, by the way, if you're wondering. Yes. A parasomnia,
Huh?
somnambulance. The more uh 4+ syllable words the better when you're trying to sound smart.
The more syllables, the better.
Yes.
Beg to differ.
Well, precision in communication is something that's always been very important to me, and I suspect probably pathologically so. It's probably an autism uh, trait of mine, but yeah, I've always kind of sought out the most interesting words.
I miss my old vocabulary.
We got to start a book club and start trying to work our brains and work that back up.
I do have a post here, you guys. It says vertigo and coordination issues. Just wondered if anyone else has this as a result of epilepsy and or meds. Was a bad couple of weeks a while back. Thought it was due to increasing the motrogene, but I don't know. It improved, though not gone. Today it's back with a vengeance and no obvious reason. Meds have been stable for a couple months now. I don't know if it's epilepsy, if it's an epilepsy thing or not. If it's hellish. I lost. Oh no, I looked drunk. Can't walk in a straight line, bumping into walls. Couldn't lift a kettle to make tea. You know the things are bad if a Brit can't make a cup of tea. Cuppa. Um, from cup of tea, cup is spelled Cuppa. I just found that
CUPP,
really
yeah, I was gonna say cuppa. I
yeah.
mean, why did they even say tea? That's cuppa. It's implied that it's tea.
Oh, I'm
So,
sorry. It does not say tea. It just says cuppa. Um,
okay, yeah, you
Kappa.
see? Yeah, half of my
sometimes I
family
read
is
too
from
fast and
Great
I
Britain.
paraphrase
So,
before I get to the next word, and then I go back and fix it. But it says, you know, things are bad if a Brit can't make a cuppa. Had a bum scuffle down, had a bum shuffle down the stairs and crawl back to them because I'm stepping into thin air rather than making contact with the floor. Not dignified. When I was when it was this bad, I went to the GP who just shrugged and said, end quote, talk to your neuro. Have tried, but I'm in a NHS holding pattern. That's basically computer says no. Struggling to type this, scared of not going away, scared of it not going away. It wasn't a question. It was just curious if anybody else has went through this besides them. Um,
well, that's kind of a question. Has anybody else gone through this besides them?
Vertigo, it can land in both medication and seizures. That's the hard part.
Yeah.
I
You
feel like
know,
mine has gotten worse as the time has gone by, but I don't know if that's because all of my meds have progressively gotten more and higher, like higher dosages and more meds. So is that why? Or is it because my
stronger
seizures
men.
are worse? You know, is it? I don't know.
Vertigo is a weird condition. You know, it really is. Uh, my mom gets vertigo attacks just out of nowhere. She has no health problems. Just all of a sudden, you know, she can't talk for like 8 hours. Um, yeah, I'll assume the same that it could easily be affected by medication. Um, I would look into it. Uh, yeah, it's just a very strange disorder. Uh, I don't know what else to add.
Yeah, many medicines affect that. So, like I think even lamotrigine mentions it's rare, but you can get it because there's also many medications that also say loss of balance and stuff like that too, but they won't directly say like stuff like vertigo.
Yeah, like dizziness and loss of balance seems to imply like a vertigo sensation, but
Yeah.
they don't want to commit. I think that maybe there might be specific definitions for what constitutes the side effect vertigo in FDA, and they like there might be a degree of intensity or something that they may not be falling under. But I definitely get what I describe as vertigo from um, something. I attribute it to my meds. Um, but yeah, like riding in a car and stopping and starting and turning and stuff can kind of get a little unsettling. I don't know. And yet I like roller coasters. It doesn't make sense. Um, but speaking of which, I might be going to SeaWorld tomorrow, which could be interesting. I might be testing out the first VNS roller coaster ride. I checked. I cleared it with the VNS therapy people, and they said uh, worst case scenario, uh, the heart rate spike might register on the uh, uh, generator, and it might trigger an auto stim, just like an extra dose, as they call it, dose, which I thought was an interesting term to use.
Yeah.
But other than that, like no harm. So, I've accidentally zapped myself enough to not really be afraid of that. The roller coaster is more significant than that VNS sensation there. So, um, yeah, we'll see.
It says living with the rarest form of epilepsy. Ecstatic epilepsy is when the person experience an undescribed feeling of bliss, pleasure, and euphoric feeling. People with this type of epilepsy are often temporal lobe epilepsy patients with focal seizures. It's absolutely heartbreaking because you could never get a diagnosis fast because while only 50 people were reported in the medical literature since 2016, it's almost impossible to find epileptic people aware of it. Since childhood, I have suffered from this. And musicogenic seizures, another rare type of reflexive seizure. Um, Often thinking I used to visit Heaven's Gate every time I have an episode. I recently discovered that not all people with epilepsy experience this, so I decided to share how my episode feels. Firstly, the type of seizure is deeply connected to the religion, emotions, and physical sensation. It's theorized that most spiritual and religious figures through history had this seizure. It starts with typical aura seizures. Aura triggers of feeling a strong sensation of deja vu before I start experiencing the ecstatic part. I feel like I've gotten taken to the past and grasped the knowledge of everything in the world and a strong emotion of feeling certain and completely obtaining the answer of something so big. My chest starts to feel empty, like I have nothing to worry about. My skin becomes so light, like I have no weight, and mostly inside my head, everything I was thinking about stops as stops. It's like I have no experience that shapes who I am. If you want to understand what I mean, imagine sniffing a perfume from your childhood that has a deep memory tied to it. You will feel strong nostalgia. Take that feeling and double it times 1,000. That's when ecstatic seizure is. We don't experience fear or doom like the other types of seizures. We experience pleasure. My seizure ends completely, leaving me tired and want to know what I experienced. End quote. Was it true? End quote. Where was I? And the most frustrating part is not being able to understand or explain what I felt. Sure, you could make your brain understand how felt happiness in particular moment, but this one exactly is undescribable and like you are no longer a human being. There are a lot of neurologists describing it on Google, and a good amount of research was made about it. Search it up if you didn't understand my words because I'm bad at explaining, but I will answer any of your questions. I just felt like sharing this because it has poor representation around the internet. I'm diagnosed with temporal lobe epilepsy, and I have focal seizures. That is triggered by music, religious books. Only the Quran, though. Only the Quran, though, because I grew up in a Muslim household. That's all, and I hope I didn't yap too much. And I hope this post gets a lot of people because I could really use a few. I could really use a few kind words. Yeah, I've never heard of that kind of epilepsy, static epilepsy. Um, they did say something about musicogenic epilepsy, and I've heard of that, and that's from like sounds and stuff, and music, of course. Yeah, I think the person that told me about that was like it's more from the base of the music and not necessarily music in particular that triggers them. Uh,
I think I recall that, and I think they said that like the bass and also the binaural beats that, where the frequencies are slightly different, and
yeah,
that difference produces a uh, frequency uh, below human perception, but it's still there in the brain's electrical waves, you know. Um, I don't know, but another thing, like with musicogenic, I wouldn't necessarily think that all of them are related to a specific sound, a specific low sound of the bass necessarily, because there's a lot of emotional connection associated with the experience of listening to music, and that uh, I mean, emotional changes could be part of what's triggering in those cases. And it might not necessarily all be the sound, it might be the um, emotional shifts produced by the sound. Um,
Yeah, I that is interesting. That uh, yeah, I don't think it's the base either. Just, I mean, it has to be something, some kind of emotional stimulation. So, because that goes right to the brain, and yeah, some kind of
It's like a
uh,
vibration, I think, or something.
I don't know. I would think it's more stimulation of a certain part of the brain, because that's basically what epilepsy is. It's excitation of brain nerves, and uh, uh, I'll look into whatever you know this is, but
yeah, yeah. I'd be really interested to hear your thoughts on that. There was something I recall reading about earlier this year. There was a study that was published by a team of researchers that were studying how the brain processes music, and they played music to patients in an fMRI machine, and they found that there are two distinct but parallel circuits in the brain that are engaged when a person is listening to music. And one of them is assessing um, the pitch the harmonic pitch of the melody compared to the the bass frequency a you know a vibrational you know um, sense, how the harmonic overtones all um, relate to each other, and the other was engaged in predicting the whoa, sorry, cat fight right over there. The Second Circuit was engaged in predicting um, the next upcoming measures of the music that is being listened to. And um, if I'm recalling correctly, um, I mean, I know that part, the two distinct circuits was correct, but if I recall correctly, I think that they also found that the um, it was uh, perceived as pleasurable to the listener when um, the music being played matched the um, the or agreed with the harmonic um, perception, basically was in key or whatever, so to speak. But the brain's prediction of the next upcoming measures was um, slightly off, slightly incorrect when, basically when the music kind of surprised the listener a little bit, went in a direction that they were not thinking themselves, uh, which I thought was really interesting, like parallel circuits, analyzing pitch and the, I guess, predictability. In a sense, I guess that could be seen as a measure of creativity in the music, how predictable it is as a proxy for generic.
I'm looking up this is Chat GTP, but why does music trigger seizures? The emotional circuits, the limbic system responds strongly to certain music, and the auditory processing pathways, rhythm and pitch patterns activate neurons in a way that can trigger abnormal firing. And the trigger is usually not loudness, but meaning or emotional response.
Songs that have a particular emotional significance might be a
Yeah, that like
yeah,
this person was
trigger.
saying that they were having seizures when it comes to the Quran. And that's a Bible, right?
Mhm.
Don't call it the Bible.
Oh
It
It
is
yeah,
is,
right.
their holy
I just
book.
realized that.
yeah, it is the scripture for Islam. Yes,
There you go.
but
Um,
um,
yeah.
yes,
Uh, it's the book they read. I put it there.
holy
And
book, holy
um,
book.
this person was saying that this one make them have seizures um, because they grew up in a Muslim household. So um, that kind of sucks. Do you think that could be like if they grew up not liking the Quran, or they grew up against it, and then it triggers it now that they're
It could go either way, strong faith will elicit strong emotion when reading, the
Yeah,
of their
That's
fate.
gotcha.
that's the wacky thing about the brain. That for some reason, this passage or song has a significant imprint with this person, and I don't know why. It just strikes a chord. There's like a little bit of psychology in there too. Yeah.
Yeah. Yeah.
Go through a
The
few of these
limbic
comments. One
system, is
says,
that the isn't that part of the temporal lobe?
one of the comments just says, "Can I swap impending doom for this one?" Kind of sounds like a brief mushroom trip. Another comment says, "I have reading epilepsy, which is supposedly very rare. Apparently, only 100 people have it." Wow,
Mm.
reading epilepsy. Gotta look that up. Reading epilepsy.
Do they not elaborate further?
Um, they did not elaborate further. Is why I had to look it up. I must know.
Yeah, that
Reading
sounds a
epilepsy.
little.
It says reading epilepsy is the rarest form of reflex epilepsy triggered specifically by reading, leading to seizures that can significantly impact daily life. Reading epilepsy is characterized by seizures that are precipitated by reading or engaging in language related activities. Is classified as a reflex seizure, meaning that the seizure occurs in the response to the specific stimulus. In case In this case, reading. The condition is more common in adolescents and young adults, particularly in males aged 12 to 20. So, I mean, most of us, we're all out of that range, but that totally sucks.
It sucked trying to go through
Yeah.
school with that.
Yeah, around times kids would be actually reading, so this would be a problem. Um, Another one says, "Once again, I've learned something new from this sub. Thanks for sharing." Another comment says, "OMG, I was born and raised in a Muslim country and Muslim household. They play the anthem from the masjids every time." I'm sorry, I don't even know if I'm saying it right. They play the anthem from the masjids every time it's time to pray. As a reminder, if you live there, that must be such an inconvenience. You
Um,
probably have like 5 seizures a day. My sympathy goes for you.
you on camera?
You'll fight. You'll fight this win with the rest of us. Fight the win with the rest of us. Um, Someone said I can really relate to this. These are interesting. Someone says my auras are euphoric as well. I didn't know if this was unusual. My neurologist didn't seem to care about knowing about what I felt during them. He just cared that my medication worked. I get visions as well. Another comment. I'll just read this one more because I was all
I
over the
think if the
place.
neurologist doesn't care, it's time to get a new neurologist.
Swap the impending doom. Oh yeah, definitely. So interesting. Thanks for sharing. For the last several years, I've had flips of like just intense euphoria, feeling where it makes me laugh almost. I would describe it to my husband in quote, "Oh yeah, no, when I get so excited, happy, I want to throw up for no reason." And it only lasts for a quick second or so, thinking maybe these were normal. Most of the time, I get an impending doom feelings and absent seizures, but since starting the meds, I haven't had any of those happy feelings. LOL. Would rather much those though.
I do have something else here, you guys. It says anyone else is given them a end quote permanent injury. Not sure how to tag this since not sure what to tag this since I'm not exactly in quote ranting per se. More like awareness of potential injuries, a question about injuries. But yeah, one of my seizures last year in September had me fall and seize against concrete, which injured my shoulder. I had these in quote flare ups multiple times throughout the couple months after, and nothing could be diagnosed by physiotherapists or whatnot because whenever I had an appointment, it wasn't during the in quote flare up itself. So there wasn't any proof of anything. Anytime I went to A&E and it'd stop. A&E. Anytime I went to A&E
The
to
British version of ER.
oh okay. Anytime I went to A&E, it'd stop and snap and crackle, and all I feel the pain fade, which unfortunately happened before any X-rays to look at the shoulder while in the middle of the in quote flare up. This Thursday, when it happened again at my local med center, told me to sit down and wait. While I was in agony, mind you, while they checked to see if I could come into the physiotherapist for a quick look while it was in a flare up. Waited for over an hour, never heard back from them. Went to the A&E instead, and it turns out after a couple X-rays and a lot of nice drugs that I've been dislocating my shoulder ever since that seizure. Diagnosis was chronic instability of my right shoulder from the fall, um, leading to weakness and dislocation. I most likely need surgery to correct it. Fun stuff. I'm almost a year free of seizures, and they're still hunting me. LOL. What the hell? Epilepsy? Give a guy a break. Anyone else ever had any permanent or needed surgery or rehab injuries from a seizure? It has me very curious. Now I finally got the mystery solved for my own. I will read one comment before I tell you what mine was. Oh, man. Just last week, I fractured my vertebrae. I guess we'll see how that goes long term. Um, that sucks. I have nothing on that level. Um, I've hurt myself, and I think the worst would be chip my tooth. Uh, yeah, I chipped my tooth. I fell in a hole that I dug for foundation to a patio. I mean that it was 2 feet wide and 2 feet deep. Just enough space for me to fall in it. Right after I was done. Um, yeah.
Yeah, I broke my collarbone a couple years ago. I managed to get out of bed, fall down the stairs, and then wake up back in my bed with my roommate saying, "What the hell happened?" Because there's blood all over the place. But I now have metal in my shoulder connecting my collarbone and a screw there.
Did it hurt?
I mean, I don't remember any of it, so not really. And luckily, the surgery didn't cost me anything.
Yeah.
I'll say it again or show it. Right there.
Did it
Floor
hurt?
testing concrete because of a seizure.
I got something similar, but it wasn't from a seizure. It was from a pedal bike with no brakes.
Yeah.
And
And I had
being
a bridge. I
drunk
had a
and
bridge
dumb.
put in. The front teeth, the front three teeth right there. A bridge was put in, and another seizure broke that bridge.
Oh, man.
And I dislocated my shoulder before too, and multiple fractures in my foot that never healed right. Had to go to physical therapy and everything. Um,
Yeah, I
think
went
they
to physical therapy with my shoulder, and now I can't reach my shoulders where, like, as you said, as my other shoulder.
Yeah, it doesn't work the same way no more. Like one shoulder can go all the way this way, and then this one I can't do that.
Yeah, that's basically the same way with me.
Oh, I thought you meant like touch your shoulder physically. I was
Nah,
wondering
the
how that was for
dislocation.
you guys. Mm.
But yeah, my this happened during the seizure. I walked on to the basically I left this. We were going out one day, a family trip, and I just stepped out the front door. And from the top step straight to concrete.
How many steps were
And three concrete steps, but
there? Yeah, okay, so it wasn't a staircase, like a long one.
yeah. I fell down staircases, trust me.
Mm. Sorry to hear that.
Huh?
I said sorry to hear that.
I think we all been through our own mishaps.
Oh
You
yeah.
know. But this one specifically I definitely remember because the one tooth got stuck in completely came out. And the next two next to it, the nerves were killed on impact.
Mm.
And that's how hard I hit the cement.
I'm sorry to hear that.
Yeah, that's rough.
Yeah.
I was lucky that some random people saw me faceplant on that bike. And then my wonderful friends never try to come in contact with me.
I wish I could say it was from a cool bike incident or something like that, and not a seizure.
Yeah.
I was drunk as fuck, and I was like, "Oh, let's go get some cigarettes. This bike will be fun. I don't need brakes."
Mm-mm. I've rode bikes without brakes and wasn't safe. I did it though, but yeah, wasn't safe.
And
I got some
yeah,
more.
bridges aren't cheap.
I can imagine.
Yeah, I got. I don't know if it's. I don't know. I have teeth that I don't know if it's called a bridge or not, but I have fake teeth that I will randomly show people, and they're like, "What the fuck?"
Mm-mm. I got some more comments here. One says I busted my eye during one 3 years ago, and a big gash emerged above the right eye. It was gushing out pretty fierce, from what I understand, and they had to do stitches, but because of the awkward location of the cut, and also my postictal behavior most likely didn't help. I have been told when I see an ambulance, I turn into a runner. I have kind of a droop now, stitches on my chin from a laceration during another postictal. At least the scar from the stitches is almost gone now, but for a minute, I looked like Frankenstein. Um, it's funny because it said I turned into a runner, but I'm assuming that's what it says because runner is actually a person running. It's not.
Yeah.
Doesn't
Well,
say.
ambulances are expensive. I went less than a mile when I started having my seizures again, and it cost me $8,000.
Ugh.
But I never paid it, so I'm like, yeah, fuck those guys.
Uh,
But I also, to add to that comment, I had a seizure and busted my head on bed frame and I had to get like 5 staples in my head.
Staples, not stitches.
Yeah,
Sorry to
I,
hear
I
that.
think it depends. I think where you like your lacerations are is whether you get staples or stitches.
Mine just seems like all skull, the same spot. I mean, same areas. Um, I will just keep reading these comments because I'm interested in injuries. One says, I always manage to injure my right shoulder during a seizure, and now it just pops out of socket if I move it incorrectly. Also, not sure if this is anyone's permanent, but back in August, I broke my right ankle and my right foot at the same time because of a seizure. Not sure how exactly, and I still walk with a limp and will have to walk and go to physical therapy at probably at least 6 months. Another one says chronic instability of left shoulder. Normally, I have 90% function with it. Another one says chip my wisdom tooth. Another one says I had a seizure and dislocated both sides of my jaw. Now it aches and pops anytime I open my mouth. It makes going to the dentist extremely painful, having to keep my mouth open that long. The doctor also told me this will make my jaw more likely to dislocate in the future. It hasn't happened since my first time, knock on wood, which was 7 years ago, but I still get pain and popping in my jaw constantly.
Yeah, my shoulder will pop a lot and can randomly just ache for a day.
Yeah, I fell and I had a scab right here, and it's like maybe 4 to 5 inches long, like the whole cheek right here felt like. So yeah, had big scab right here from just falling and like cascading on the cement.
Yeah, I
Um,
kind of have that from that bike incident.
mm,
Ouch.
I
uh,
literally had road rash all over my face.
I'm sorry to hear that. Ugh, that sounds
Yeah,
rough.
now I have because I busted my teeth, I have a lot of scar like tissue in my lips.
Few more comments. One says I fell out of the passenger side of the car in the hospital parking lot during my postictal state. Muscle memory causes me to reach up and grab the handle at the top of the roof, and I ended up dislocating my shoulder. It pops out sometimes, and it's easy to get sore, but luckily didn't require surgery like some people here. Another one says my sister had the same exact injury. She had multiple surgeries. She has had a different type of epilepsy than me. This one, what is vertebrae? This one says yes. I fractured 5 vertebrae in my spine during a
Your
tonic-clonic in
back.
2023. My back
It's your
is
spine.
Your back
my
Yeah.
back
bones.
is effed up. It already was with degenerative disc disease, osteoporosis, scoliosis, but now it's finished. But now it's finished off. I have a lot of other medical issues though. Without them, it probably wouldn't have happened. I got something. It says, anyone else? I've started to notice sometimes I feel off sometimes. I get a feeling washing over me that I get when I spasm. Doctors are still unsure if they are seizures, but I never get spasms during it. It's just a feeling that lasts for a while before leaving. The same tingly feeling on my skin. Am I alone? Am I going insane and paranoid? I don't think so.
That
A
sounded a little
tingly
odd to
feeling? I
me.
don't know.
The
Yeah, I don't
tingly
know.
thing? Is that all they're
Uh,
saying is they just have the tingling?
uh, uh, Started to notice sometimes feeling off.
Is someone else seeing this happen?
Um, does
You're not
not.
alone in this. I mean, I've
Not at
had,
all.
yeah. So that's the first thing, you know.
Because
Yeah.
that happens to me with my focal awares. They basically I have the weird stomach stuff and just everything just seems not right, and I get weird tingly all over in my arms and my torso, and it will eventually go away. And I don't remember what else right now because my brain's a little fried, and I have epilepsy.
I
Good
went a
enough.
couple
Good
weeks
enough.
without seizures here lately. I
Say
told
that again.
Tracy, I asked Tracy, I said, honey, I said, do you remember last time I had a seizure? She said, oh, it's been a few weeks. That night, bam. I dropped a bowl of ravioli right over here and ended up in bed a few hours later I came out. She says, do you remember uh dropping ravioli? I said, no. And she said, don't ask about your seizures anymore. You're gone a while. But then again, I have been eating those what do you call those pills I'm taking? Clorazepam, the emergency pills. Those little ones.
Clonazepam.
Who? Clorazepam? Yeah,
Clonazepam
yeah, something like
or
that.
Clonopin.
They look like little Ativan.
Yeah,
Put
it's
them under your
Clonopin.
tongue.
It's a
Anyway,
type of benzo.
yes, exactly. Um,
Envy.
who?
Envy is
Ombi?
the
No,
generic name of Envy is Clonopin.
that one. Yeah, Clonopin.
No, Ambi is it's clonazepam.
Clobazam.
Clobazam.
There we go.
Clobazam.
Clobazam.
I
Yeah.
don't know. It's one of those, but I keep one in
Clonazepam
my
is
pocket at
Klonopin.
work because
Clonopin
even if
is
I'm not sure
clonazepam.
I need it, I'll take it. If I have I don't get tingly or anything like that, but I I get kind of lightheaded, and I just take one of those and it's all gone. So I only had a seizure at work one time since I've been there in like 2 years. So I just love those things.
What kind of
But
work do you do?
I give away samples. It's so stressful.
Actually do have a bit of a stressful job, but sometimes it's stressful, sometimes it's not.
My job is as stressful as you make it. You have a
That's
lot of people that, you're a Costco, so there's a lot of entitled people there. People that
yeah.
feel as though uh, they're entitled to this or to that.
Yeah, I run
Uh,
a very busy pizzeria, which can Fridays are stressful. At least as
Angel,
stressful as I make them.
Angel, can you sit up? I mean, I'm only seeing from your nose to there you
There we
go.
go.
There you go. That's better.
Yeah, I was going to say
Right, we're talking. I hear your eyeballs talking.
If Xanax is the queen, if Xanax is the king of benzos, then Clonopin slash clonazepam is the queen.
Well, I think I told you before. I could take those Advil. I mean, I could eat those
Yeah,
like candy, and they did nothing.
yeah.
My wife Tracy would take half of one and be loopy. I could take those Ativan, and I would take 4 or 5 of them at a time. I mean, I wouldn't keep
Ativan is lorazepam.
lorazepam. Yeah.
Yeah, it's made to basically try to put you to
It's an
sleep.
anti
Oh.
anxiety pill.
Yeah, man. Hmm.
I got something, you guys.
Yeah.
I don't know why, but I grabbed this one and I thought it would be funny. But it says Taco Bell or seizure. Weird title, but I'm not sure, and I haven't had this diagnosis for a while. Um, Last night I had Taco Bell and I was hanging out with my friend who spent the night and also had Taco Bell. He was fine. He was fine. There was nothing wrong with his stomach. Long story short, though, I threw up, went to bed, and got up around 1 a.m. and I almost threw up some more. When I was when I woke up in the morning, I had a sort of deja vu situation, which kind of got me thinking I was not in the Taco Bell, which got me thinking it was not the Taco Bell that messed me up, and it was rather something else. I'm not sure, and I was looking for someone help on the matter. I looked it up, and Google said seizure could cause you to throw up, but I would rather hear other humans' experiences or tell me I'm dumb. That works too. Thank you, people over Reddit.
Almost sounds like food poisoning, if anything.
I've heard of people throwing up after seizures. I've read that quite a bit, being that I read a lot of
Yeah.
posts.
I mean, you can. That's what a lot of people like. I live alone, and people will be like, "Well, you might throw up, and you can easily choke on your vomit while you're having a seizure."
Yeah, been
But that
told that too.
that sounds more like food poisoning, maybe. They're like if they keep throwing up, but I don't know.
It sounds like it sucks.
Food poisoning from the Taco Bell, or
I don't know.
Maybe, but
I don't know. It takes a few hours to kick in.
Yeah, it does take a few hours. So, um, yeah, I couldn't imagine throwing up right then and there. So kicking in later, that does suck. But yeah, throwing up overall, waking up and throwing up, mm,
yeah, it
you
just
get
sounds
that
odd to me.
afterburn, like heartburn. Um, Comments here says, yeah, it took the better part of me a couple dozen seizures with digestive issues to realize that food didn't cause the indigestion, but it was a seizure or triggers causing the digestive issues. Took a long time to realize stress is my killer and not gluten or dairy. Now, of course, there have been many times where the food I got from a fast food chain caused serious issues, but that was due to someone eating next to nothing, being put into extorted labor to clean and cook rotten food and equipment.
Well, also, I bet you could possibly, if you're eating spicy food and you're not really prone to it, could possibly cause you to have a seizure.
Oh, didn't know that.
Spicy
I
food
mean, I'm not
causing
I'm not a
seizure.
doctor though.
That's interesting.
And today I've learned about two new kinds of seizures. Um, Things amaze me every day. They have insular, and there was another one. It was like musicogenic seizures, but it was something else to do with that. Um, yeah, but insular seizures, and yeah, I forgot what it is. Let me see.
I've never heard
Insular
of that myself.
seizures. A form of epilepsy originating from the insular cortex, characterized by diverse seizures types and complex clinical features, making diagnosis and treatment challenging. Um,
That's one of the suspected types that I may have.
Oh, really?
Yeah, I went back after that post when I got off of here and then I went and got ready waiting on my daughter because we were going shopping. And I was looking through my paperwork for my last appointment and it said they're suspecting insular parietal or temporal. I had
It says, what
never
is,
even been told the first two.
let me read this. It says, what is insular epilepsy? Insular epilepsy arises from the insula, a region of the brain located deep within the lateral sulcus, often referred to as fifth lobe of the brain. This area involved in various functions, including sensory processing, autonomic control, and emotional regulation. Seizures originating from the insula can present a wide range of symptoms, making them difficult to distinguish from seizures arising in other areas of the brain. Very interesting, and it does sound like it sucks. Hard to treat. They told you that, Andrea?
Yeah, that's what I'm getting too. And the more I was reading about it, is even like to diagnose the insular, a lot of times they got to do the invasive SEEGs because the scalp EEGs aren't sensitive enough to get to that deepest part of your brain or something. If I'm
Okay.
remembering what I read correctly, anyway.
What are SEEGs?
They
Basically,
screw
they
some stuff in your brain.
inside your skull.
Inside.
Skull. Yeah, not the brain, the skull. I'm sorry. They want to get under
Hmm.
the skull and touch the brain.
Yeah, I think they pretty much like go under the skull and put the electrodes directly on your brain somehow.
Oh, when I had my brain surgery, I was told that they were going to put a patch on my brain and, electrodes for like 7 days. I'm going to say seven because I don't know if it was longer than that. I was tethered to a wall and they had, yeah, a patch and they were trying to, what's it called? Make me have seizures. And it got to the point where they had to take me completely off my meds before I'd have a seizure. And but I guess that maybe that's what an SEEG is when they put that patch with electrodes on it on my brain. What they were doing, they were trying to find out where the seizures were coming from.
Which surgery did you have?
Right temporal lobe,
Like a resection?
right here.
A
That
resection or a
was
lobectomy.
who do what? Lobectomy?
Did you have a
Says it was a
resection or
This
lobectomy or
was 20 years, no, 30 years ago. And all I remember was right temporal lobe, which is right there.
yeah.
Um, but yeah, so I've seen that because I also had these other uh epilepsy sites on like Facebook that I stopped in to check out. And now I get hits from them every day. And oh man, there's videos that I don't think should be posted online. But
kind of videos.
I mean, sure, I understand some of it is educational, of course. But
What
I
kind of
mean,
videos?
people having seizures, and I mean, they go on and on and on, and it's like unnecessary.
Where do
uh,
you find videos of picture of people having seizures?
on Facebook.
Mm.
There's a
I was
number of
looking.
there's a number
There was
of
this. Go ahead.
I'm sorry. There's a
I
number
said,
of
go ahead. He
sites,
said, I'm not sure what.
epilepsy. There's a number of epilepsy sites on Facebook, and I was just checking them out. And now that I went on to them, of course, my cookies, they picked up on my cookies. So now every time somebody goes on there and posts something or whatever, it comes back to me. But people like to
Mm.
post stuff that, I think is completely inappropriate. I mean, and it's like they're posting pictures that of kids having seizures. And I mean, I don't think that's right.
I was looking for videos of seizures and could not find any on the internet. And all you did
Uh-huh.
was go to Facebook. Yeah, I was walking with my bracelet on, and I was at the store, and this lady, um, I was telling her that I had the dog, but the dog didn't have the jacket or whatever, the service dog jacket. So, but I have the bracelet, and it has the little symbol on it or whatever. And she said, "What do you have?" And I said, "Epilepsy." And she said, "I heard of that." And then I said, "Oh, so you know what epilepsy is?" And then she said, "No, I don't know what it is, but I've heard of it." And that's when I told her I have seizures. And then she was like, "What is a seizure?" And I was like, "You never heard of a seizure?" And she was like, "No." And I tried to look up on the internet seizures everywhere and could not find a seizure for some reason. And it's that hard just to find a seizure on the internet.
She wasn't spelling, no, he wasn't spelling it correctly, obviously.
I looked on Google and I looked
I've tried
basically,
too,
yeah,
and you can't find them.
I just looked on
Well,
Google and it had no
go
videos of
on, go on
seizures.
Facebook, go on Facebook and type type in uh the search bar epilepsy, and there'll be a handful of epilepsy groups, and just
I don't use Facebook.
Oh, well, that would be an issue for you then, wouldn't it?
Yeah, I don't know where to look. Andrea, you too. Like, where else do we look? Because
How
on the
about
internet,
Instagram? Anybody do Instagram? I don't, but
not really.
maybe they're on Instagram.
Couldn't find
How
them. Yeah,
about
but
I
how
did
about
I did the
convulsions?
Twitter once and I did the Snapchat once, and
me too.
I figured out that I'm too old and I don't know what the fuck I'm doing, and I uninstalled them.
Oh, okay.
That is not
I'm
reason.
only on there. I mean, I don't ever post anything or reply to anything. I just, I've got a lot of family on Facebook. People in my congregation are on Facebook, and I just, follow along with them. I don't I don't post anything. I very rarely post anything on in fact I don't post things on Reddit. I answer something, but I don't think I've ever started a conversation on Reddit or anything like that. Yeah, I'm not a big social media person.
I got something here. It says confused. Last night I was sitting with my family playing a game on my Switch. I don't remember being tired, but one moment I was playing a game, and then all of a sudden, it was like I was waking up from a nap. My mom kept asking me if I was okay, saying I had a weird look on my face, and I chalked it up to me spacing out. I just don't know how to tell her, how to tell whether
tell whether I was spacing out randomly and fell asleep in the process, or if I had a seizure. I guess this post is more of an ask. Has anyone ever experienced something like this? Or am I convincing myself I had a seizure when I didn't? I have been diagnosed with generalized epilepsy. And that to me sounds like a seizure. You went from laying down to waking up somewhere. Sounds like a seizure. I went from laying down to someone's home.
I've had
That was a seizure.
I've gone from lying down to ending up in another room somehow.
Yep.
If you ask
Mhm.
Tracy, that's my kind of seizures. I'll have a seizure and then get up and go somewhere with not realizing I did it. Well, standing right here behind me in the kitchen. I made ravioli. I dropped the bowl, didn't pick it up, just went in the bedroom, got undressed, got in bed, and a couple hours later I came out, which was a very good. That was a good seizure. I stayed within the house, within the parameters of the doors.
I've had similar things at work where I have coworker who's been able to like see that I've been having seizures where I will like be telling them what to do and then instantly stop talking to them about it and still end up making a pizza while I'm having a seizure.
Is it edible?
Oh, of course.
You go on autopilot, huh?
That's a
Essentially, yeah.
memory.
Yeah.
I was going to say because I can do things while I'm having a seizure. If I was cooking, if I was cooking some, I wouldn't recommend eating it.
I don't know. I can still make a perfect pizza while having a seizure, apparently.
Well, good deal. Good deal.
Probably because you make 300 pizzas every day.
It's more like 500, but yeah.
I
I've
couldn't remember.
I did a rough estimate of how many pizzas I've made in my lifetime, and it was like I did like 300 to 400 for 5 days a week for the last 16 years, and it's like 2 million.
Huh.
Yeah. Mm.
That's quite a large number.
You could probably make
Yeah.
pizzas in your sleep.
I mean, I can literally do it, no hands, eyes closed. It's kind of like
Pretty
a
much.
seizure.
Now you're
You
showing
make a pizza with no hands. You're good. Got some of these comments here from the person confused. It says, sounds like an absence seizure that I get. Another comment said, this is how I would describe my absence seizures. I have generalized epilepsy. Sounds like it might be an absent then. Another comment, sounds like my absence seizures. Another one says, this is how I would describe my seizures. This is how I would describe the type of seizures my niece would get. Okay. Another one says, definitely sounds like a focal unaware seizure. Funny feelings just before will be an aura, but you are probs not used to the type and feeling type. So they change. I had a TC and went into focal unaware with deja vu auras. Then epigastric aura. Keep diary.
What's an epigastric aura? Like
Our stomach drop thing.
Oh, stomach drop. Okay. Epigastric. I got the gastric part. I was picturing like, stomach stuff, but I was not, I don't know. Yeah, that makes sense. For some reason I
Epigastric
was picturing
seizures.
somebody like getting the squirts before a seizure like
Dude, I'm
that.
eating.
Oh, I'm sorry, man. I did.
What are you
I'm
eating?
sorry. I'm sorry.
Stir fry.
I
That sounds good.
It is. My honey made it, so it's really good.
The epigastric seizures, often associated with abdominal epilepsy, manifest a sensation in the upper abdomen, including pain, nausea, discomfort, typically linked to temporal lobe epilepsy. Abdominal epilepsy.
I've never heard of abdominal epilepsy. Abdominal
Atonic.
epilepsy.
hmm Atonic is drop seizures. Gelastic is laughing seizures. Insular.
Elastic, like Gelastic.
Yes.
Okay.
Uncontrollable laughter. My stepsister has that.
I've been having things where it's super hard for me to explain. It's almost like I'm predicting how things are going for like 30 seconds, where like I'm at work, I can hear people talking, and then I almost know like, all right, boom, 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 boom. And that's kind of like how it goes. And it's like I said, it's hard for me to predict this and explain it.
I looked up seizure types, and it's quite a bit. There's focal aware, generalized, focal impaired awareness, focal to bilateral tonic-clonic, gelastic, dichristic seizures,
What's
generalized
that?
tonic-clonic, dichristic seizures, involuntary crying. That is very
I thought
interesting.
that would be like what do you call that when you just start cussing and
Muscle stiffening is tonic seizures. Clonic is repeated jerking. Oh, that's why tonic-clonic, jerking and then repeated jerking and muscle stiffening.
and muscle spasm? Yeah.
Yeah, clonic is repeated muscle jerking and tonic is muscle stiffening.
Yeah, you
So
can have one without the other.
yeah,
Both ways. And
that's
not
good.
always without the loss of consciousness. We have several firsthand accounts of that.
I remember when there was grand mal, petite mal, and now there's a whole volume of different types of seizures.
Yeah, I just wanted to know how many. Someone said it's like 50 different kinds. Um, I want to know a list of some. The average website only has what we know, generalized and focal.
Go to Google and go to Copilot. Ask Copilot how many different types of seizures there are. Well, I got a list off of AI. Can I post it in the in chat?
Yeah, yeah, absolutely. Is that a list of types of epilepsy?
Yeah, I wrote in
Types
there.
of seizures?
Copilot, how many different types of epileptic
Epilepsy.
seizures are there?
No, how many types of different epilepsy there are? A lot of the types of
Uh,
epilepsy have tonic-clonic seizures, so I'm gonna know how many types like out
okay.
there. Couldn't
Okay.
find that on mine, but I do have one that says need help. Okay, so from a young age, I had depersonalization. Not sure why I had it, but often I would not be out of my body, and often, often I would be out of my body and next to me, like I was looking at myself. And sometimes after I have woken up, I had a panic attack. When I was 11, I had some kind of epileptic seizure. I remember sitting on the sofa and then waking up in the hospital. And later, my family told me I was on the floor and shaking. But doctors were not sure if it was epilepsy or not because the tests, they were fine, and I never had any attacks later on in life. Now, for the fun part, after the seizure I never had a panic attack, like again, and my depersonalization went away. And it's like I have better memory after the attack. I'm 26. Uh, I'm 26 now and healthy, but I'm looking for answers. So if nobody can answer or can help give me a clue or some kind of explanation for that, would be great. Thanks. Um, there's no comments here.
I was gonna
So
say that I feel
if
like that's more of a question you should ask your doctor.
there you go.
It doesn't
Um,
really sound like especially if you're not diagnosed, like because they said they were
yeah.
not diagnosed, right?
Um, did not say not diagnosed. That I did not read that and cannot find that. So they weren't didn't say that, but um,
But I can see
yeah.
where someone might say they might have a panic attack and put it with a seizure, or have a seizure and put it with a panic attack. I had a coworker recently who I think was going through manic episodes, he said he had a seizure, but when I talked to him about it, it didn't sound like a seizure and it sounded more like a manic episode. But again, I'm no doctor or anything, but having seizures, it's didn't really sound like a seizure, more like because he's also had manic episodes before. And
I got another post here. It says, "Can an electric shock be a trigger for epilepsy in an epileptic person?" Question: Can the electric shock on an epileptic person on medication trigger epilepsy seizure? My dad, who's epileptic, was electrocuted at work yesterday, and he said it was very strong shock. He's been acting weird and showing signs he usually shows before having a seizure, like talking to himself and being disconnected, um, disconnected in a weird way. How can I ensure it doesn't happen, or any advice is appreciated? Backstory: My dad had a work injury where he fell on his head. After a period, he started getting seizures. He used to be on meds, but even on meds, he would get the seizures every 3 months approximately. 5 years ago, he started new medication, which was amazing, and he stopped getting the seizures, but he would only get an episode if he forgets his medication for a day or two. However, sometimes he would get these episodes where he's unresponsive. For example, we would talk to him on the dinner table and he was not responding, but this has only happened around 5 to 6 months, 5 to 6 months once for like 5 minutes, and then he would just be back to normal again. I'm so grateful that that medicine, it changed his life, but I just wanted a backstory. I just wanted to add a backstory to my question.
yeah, it sounds like an absence. There's things that I've been going through lately. Because like I will be telling someone what to do at work, and then even though I'll be in the middle of talking to them about it, I just kind of drift away.
Hey Jeff, how you doing?
Hi, Tom. Well, I was on earlier, had a seizure and slept for the last 4 hours, and now I'm back.
Oh, welcome back,
Sorry to
my
hear that.
friend.
Thanks, Tom.
Welcome
How are
back.
you? Been a
I'm
while
doing
since I've
well. I
seen
just
you.
got in from work, so
How you? Everything all right?
oh, always, 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 always.
Great.
Life is good.
Good to
You
see you.
betcha. And I'm sorry I haven't responded to your
That's okay.
uh
I wanted you to know that I'm always thinking about you.
thank you. I appreciate that. And it meant a lot to me.
You
It
know,
really did.
we may not believe the same thing, but I have a ton of respect for your commitment.
Well, thank you. I appreciate that. Hey, you know what? God gave us all that free will.
That's right.
That's
Either
right.
God or the aliens.
There you go. Whoever works for you, whatever works
Right.
for you, my friend.
Right.
And not my place. Even God said, "Hey, I don't want you to serve me for you, because you think I want you to. I want you to serve me because you want to serve me."
Yeah, I
Does that
got
make
that.
sense to you?
Yeah, of course.
Okay.
On with the podcast.
On. Yes.
Okay. The question was, can an electric shock be a trigger for epilepsy in an epileptic person? I didn't understand. They said, how can the trigger? They said, can it be a trigger for epilepsy when epilepsy is not caused by electrocution that I know of? You get electrocuted, and then you have epilepsy.
Well,
Um,
Electrocution?
electroconvulsive therapy, isn't that like triggering seizures?
Yeah, I mean,
I don't
it
know
depends on what this person means by the shock or whatever they're saying.
yeah, if it's
it
like
says
a static,
epilepsy.
if they mean like a static electric zap from like rubbing their hair on a
On
balloon and
or yeah,
whatnot, that's
a
probably
static
not,
shock. Yeah,
yeah, probably not going to do it.
no.
When you scale the energy up to a lightning bolt, that might do it. Um, where that middle ground is that they're like actually reasonably thinking about is, I don't know. But it doesn't seem impossible.
Yeah, I
Uh,
highly doubt like statically. You said rubbing your head on a balloon or fabric or whatever. That's not gonna
yeah,
give you a seizure unless, I mean, yeah, it could possibly, but I highly doubt it.
None of us are
Yeah,
capable enough to say what will and what won't, right?
Yeah, I mean,
yeah.
everyone has their triggers, but like that to me just sounds
I
non-existent,
catch
for
myself
lack
doing
of a
that
better
all the
term.
time.
I mean, I had to wear, I wore some random shorts the other night at work, and they were definitely giving me some static shocks, and I didn't have any seizures.
um, I'll read the question again. It says, can an electric shock on an epileptic person on medication trigger epilepsy seizure? My dad, who's epileptic, was electrocuted at work yesterday, and he's said it was very strong shock. He's been acting weird, showing signs he usually shows before having a seizure, like talking to himself and being disconnected in a weird way. How can I ensure this doesn't happen,
So
or
yeah, I
any
mean,
advice is appreciated?
they're not
He needs to
explaining the
talk to his doctor
shock
about
enough.
that.
Yeah.
Yeah,
They're just saying electric shock, like yeah, electricity can literally kill you easily, regardless if you're
uh,
epileptic or not.
Mm.
but yeah, once again, that's not a question for us.
Yeah.
Psalm 101.
Yeah. What's the stupidest thing you've ever did after a seizure? I'm really down today and I need a few funny stories. I'll start. I had a good shake, got up and ran into a wall and fell over. Got up and ran face first into the door and then fell over again. Got up and then opened the door and ran to my neighbor's yard and had a nice pee. Came back and went to bed. I don't remember any of this, but my wife told me so. I guess I have to believe her. It's like something I would do.
That's the wonderful thing about having seizures. You can do stuff as stupid as it might be and not remember it. But
Right.
you've got family members and friends that do remember it and can let you know about it, and you just brush it off. Oh, I don't remember that.
Oh man,
You can
so
blame
many
some
things I've
stuff
done.
on seizures.
Like I still tell myself
Sorry, go ahead.
the seizures where I went and did random things, like getting on a bus and going to different cities and stuff. I want to know what that was like. That was probably the stupidest thing I've done is take buses to other cities and stuff. But um, I also want to know what that was like. If anybody was ever there, I would love to hear that story. I mean, not from you guys, of course, but yeah, if I see somebody who ever says that they saw me on a bus, I'm gonna ask, was it the time I was having a seizure? You guys ever
So
done anything stupid after a seizure?
I don't
Oh
know.
my
That's the
good
question.
gracious! I could write novels.
Give
So
me an
I don't.
example.
Go ahead, Dom.
An example. Walk out into traffic, still in a daze.
Yeah, that's kind of stupid.
Why?
That's painful.
Just things that I've been told that I've done. I can't. That's like somebody. That's like my boss telling me to, giving me something and sell this product to the coworkers. And right now, I can't think of anything off of the top of my head.
Mark, how
Except,
about
yeah,
you?
going to this. What's that?
Well, I was asking Mark, what about him?
I mean, I haven't done anything particularly exciting like that. Probably the dumbest thing I've done after a seizure was arguing with the EMTs over whether or not I actually had a seizure.
Oh, I'm with you on that one.
My position was that no, I had no seizure. I had no explanation for how they appeared in that room, but it didn't matter. I didn't have a seizure.
Okay, Tracy's right here. Let me ask Tracy. Honey, what's one of the stupidest things you can remember me doing after or during having a seizure? She's got headphones on watching TV.
Well, I at least got something to say that I don't know if it was because of a seizure or not, but it was a no call, no show at work, and so I was very drunk. I knew I had an eighth of mushrooms, but the next day I didn't. So I'm pretty sure I ate too many mushrooms while very drunk, and I punched my mirror. And I live right next to fire department, and I went over there, ran over there because obviously I was bleeding too much, and I ended up waking up in the hospital. They told me a few times, like, if you try to get out of here, you're gonna go to the drunk tank. I was like, all right, yeah, I won't do that. But I ended up doing it at one point, and I was like, I just want to go home. I just want to go home. And then went to the drunk tank, and I'm like, God damn it, why did I do this? And I ended up getting some.
Were you restrained at all? Were you handcuffed to the bed when you
No,
got there or anything?
no,
No.
no. I didn't get
That's
any
just,
charges or anything like that. But like you, because they probably thought could probably say that I was more of a danger to myself.
I had something like that happen.
But at the same time, I'm like, no, I just want to go home and go to sleep instead of having these needles in my arms and shit. And
yeah.
Well, I
but
had
like
the
I said,
police take me into custody.
yeah,
I was walking down the street in my hometown, And everybody knows everybody. The police knows everybody. And
Yeah, like I
what?
was like pounding on their door because I was bleeding so much. And then
find out
when the
exactly what the purpose is, they said it's burglary.
the cops came over and they're like, they gotta sleep too, you know. I was like, yeah, you know, I didn't think about that, but yeah, they gotta sleep too. And then they brought me to the hospital and told me multiple times, like, you got to stay here. But there's a point where I'm just like, you know what, fuck it, I'm going home. And they're like, nope, and we're going to the drunk tank.
Yeah, that's what happened to me. No, we're just going to put you in the drunk tank. We'll call your brother, and if he says he wants to come get you, then we'll let you go in his custody. My brother didn't want to come get me. So
But
I
I told
spent the
my
night in the drunk tank.
yeah, I told my place of work, I was like, yeah, I was just having a seizure, but I 100% ate some mushrooms. Too many
Yeah.
mushrooms.
To come down from an eighth of mushrooms is kind of like, you want to be in a cozy place, like not the drunk tank.
Uh-huh.
Or in
So
a hospital bed with
I
needles in your
get you.
arm.
I get you. Yeah. I I understand your position, your need to leave.
Yeah. It's just like I gotta work tomorrow. Like, let me go.
And you see, that's it with me. I mean, the town I grew up with, everybody knows everybody. Everybody knows me. They knew I was epileptic. And they just brushed it off. That's just Tom, he's having a seizure. Just send him over there in the corner. He'll be all right. You know. Or when I was acting up, well, either take him home or take him to the drunk tank.
Yeah.
So I actually want to have a question. I do have a question, rather. So I haven't touched THC in about 6 months. I've been drinking way too much. Do you guys think THC can help me quit and
What?
quit drinking?
THC help you quit drinking?
Yeah.
I mean, switching addictions is
That's
isn't
it. You're
any better.
switching from one to the next.
Yeah. But I know I can quit
I
THC
think you can do it.
easier than
Yeah, I think it's a
because
switch of addictions.
I know,
but at the same time, THC is medically more better for someone with epilepsy anyway.
and
So
and the reason why I'm thinking of splitting these addictions is because when I stopped drinking, I stopped sleeping well.
Well,
And
the
sleep
problem with
deprivation is
drinking,
my number one, is like definitely my number one trigger is sleep deprivation.
well, the problem with drinking and taking anti-epileptic medications,
Mhm.
they'll put you in a hospital.
I mean,
Medication, yeah, anti-seizure medication. In a lot of cases, they're barbiturates, and they don't go together.
Uh-oh.
Jeff, Mark,
THC is a totally different animal.
I think Mark had his hand up first.
I would like to hear what Jeff has to say before. I don't mind waiting.
I think having once had an addiction, the only way you can stop drinking is for you to stop drinking. THC will help you in that you'll still get that feeling of being high, but you can only stop drinking if you want to stop drinking. whether
Amen.
THC or helps you or not. It's up to you.
That's right.
You can stop
Oh yeah,
without
100%.
THC. You just have to decide you want to stop.
That's right.
He
You have
wants
to
to
have a
stop.
goal.
He
I
wants to
absolutely
stop and he can stop. He doesn't want the withdrawals.
exactly, yeah. And the
That's
Well, you're going
part
to
of
have
withdrawals
life.
can
withdrawals either way. You either
That's
way,
part of
even if you
life.
just start,
it's part of life, yeah.
you
But
will have withdrawals.
the it's not the withdrawals, it's the sleep deprivation that I get from not drinking. When I drink, I can easily go to bed. When I'm not drinking, it's hard for me to sleep, especially when I'm trying to stop.
When you smoke, does that help you sleep?
It can, yeah.
Now, are
How
you
much do
talking
you
about
have to smoke?
smoking pot for THC or
Yeah.
taking powdered THC?
I mean, last time I was taking THC was edibles, which I feel like was too high of THC in my opinion, to where it's like drinking beer compared to liquor.
Well, I
What?
haven't drank or smoked or done edibles in 24 years.
Yeah.
So I'm not uh a good person to ask there.
Yeah, I get that.
Smoking will help you sleep. There's no question. You can get strains that'll help you sleep,
Yeah.
but and they're better for you than drinking. But
Yeah.
as far as stopping drinking, you have to make up your mind to stop. Whether you're if the THC is going to be a substitute, it's a better substitute than drinking.
And yeah, and then like I said, I haven't touched it in at least 6 months, but like last year I was able to stop drinking for about half the year. But this year I've been not really touching THC and I haven't really been able to quit drinking.
Here's a,
Well,
Yeah.
you
here's a
can if you can stop drinking, then you can get some sleep medication.
Yeah,
I
and
mean,
And that'll
Mark,
help.
I'll
That would
take
be
can you give
better
us the
off.
scientific reason for this?
Yeah. What's Mark got to say?
I'm sorry, I missed that.
Uh, so, I mean, I agree with Jeff 100%. The only way to stop drinking is to stop drinking. Yeah, you gotta want to do it. Um,
which I do want
I
to. It's just
yeah.
hard. Like I can't do cold
Well,
turkey. Otherwise,
hard is
How much do you drink? Like, and what? Like, I
I drink.
don't know. I don't want to pry too deep if it's something you're uncomfortable
Oh
sharing.
no, I'm absolutely comfortable sharing. I drink PBRs, 16 ounces, 6 pack, every night, which is about 96 ounces of 5%.
Um, I mean, have you tried starting by, doing five?
yeah, just weaning off.
Not
Exactly,
let
yeah, like
yourself
weaning
drink
off.
the six,
Well,
you
But I
know?
feel like if I am able to smoke, it'll help me drift off or wean off, whatever the word is,
Yeah.
more
Um,
easily.
I have a friend, I mean, my best friend here, he was in a sort of similar situation. He was drinking really frequently, um, and uh, um, um, he started getting the 1-to-1 ratio of THC, CBD, vape pen cartridges. So they're like the not the high octane
So yeah,
um
I'm looking for
stuff.
flour compared
Yeah.
to because I've done a lot of dabs and like I said, I was eating a lot of edibles,
Uh,
but I feel like going to flour would because it's not as potent.
right. Well, that's why the 1-to-1 CBD ratio, CBD to THC ratio is helpful because the CBD, um, well, okay, so there's two cannabinoid receptors in the body. The CBD1 is what the THC binds to and what exerts the central nervous system effects. It's what gives the high. The CBD2 receptors are the peripheral nervous system. So more of like the muscle relaxation, not the the cerebral stuff. So um or not they're not CBD1, CBD2. It's CB1, CB2. So CBD binds to CBD2 and to CBD1, but it activates CB2. It doesn't activate CB1. It um, occupies the space, so to speak. So when there is THC in the system, the CBD that has bound to a CB1 receptor is there and has bound more strongly than the THC. So basically, consuming the CBD with the THC kind of puts a ceiling on how far the intoxication can take you. So when my friend was trying to wean off of the beers and everything, he would drink, uh, one beer fewer each night, and then he would take a few sips of off of this the CBD THC ratio
Yeah.
pen to kind of help, and it was, it would give some, you know,
So yeah,
some
like
mental high, but it wouldn't be blitzed. And the CBD itself also is helpful for relaxation and sleep, even without the psychoactive effect. So he has told me that he absolutely credits um, those ratio vape
yeah,
pens as
well
helping
yeah,
him get
vape
off of.
pens, yeah.
So
I just
it's not
also
flour,
sorry, go on.
but I'm sorry, I'm just wrapping up. It's not flour,
No,
but
you're
it's
talking
it's
great.
what my friend has found proven effective for him.
Yeah, it's just the pens and all that feels too potent in my opinion, but could also potential. It's the fact that I live in New Hampshire and out
Um,
of New England. It's the only fucking state that is not recreational.
Mm.
And but I also work with a guy. His girlfriend works in a dispensary, which they've talking with them has helped before. And I just feel like if I get flour instead of a pen, can possibly help better than, but I was also eating a lot too many edibles, I would say, where I feel like the edibles and the chemicals of THC and CBD were hiding up too many seizures where I was having, where I was like, yeah, I'm too high compared to I'm just having a seizure. And now that I'm on Vimpat, which has definitely helped with the type of seizures I've been having, it could possibly help me a lot better. But the fact that a flower is just a smoke, an easy smoke, and the fact that I live in New Hampshire, it's like I don't know. But I'm glad to hear guys' opinion about it.
Is a THCA flower available there for now until the Farm Bill?
I can't really say yes or no
Okay.
because I'm not 100% sure. But like I said, I was eating edibles for the last like 2 years, and the last 6 months or so, I haven't touched THC.
Well, that'll reset your tolerance. That's
Exactly. Yeah.
a pretty big break. So
Yeah.
honestly, you're gonna be back to pretty almost a novice smoker. It shouldn't
Uh-huh.
take much, you know.
I got something here for you.
I appreciate your input.
Huh?
I was saying to Mark, I appreciate his input.
Yeah.
But go ahead with
It
Pookie
helps.
with what you're gonna say.
I was gonna say I have a post here. It says, "Has THC plus Delta causes seizures for anyone?" Asking on my husband's behalf. He likes to smoke this THC Delta pen, and to me, it seems like his seizures started coming back when he started smoking more. He really loves it though, so I don't know if he's in denial about it possibly having an impact. He had a grand mal seizure last Wednesday, which was his first in a few months. He had one on Tuesday and one on Thursday. He tells me he forgets his meds sometimes, and he's going to work on being more strict about it. But I don't know if that's true or not. Ambulance said his blood pressure was really high. Someone called one on him when I wasn't around. Not sure what that indicates either. He's a heavy set man, doesn't eat the most healthy. Don't know if it's a mix of not taking care of himself, missing meds, or this THC pen. Anyways, anyone have got any negative effects from it? Anyone got
Well,
anything similar happen to them?
to add a bit to that, I last time I had a grand mal was in March when I wasn't drinking, but I had a lot of edibles. And whether those because of either or, I don't know. But like I said, I don't know why I was having it, but I don't know where it's going with this.
Um, I read a couple questions. A couple comments. One
I feel
says,
like there should be more information added with it because there's certain anti-seizure meds that won't work because of the marijuana basically.
Hmm.
And I have one of them. That's the best succeed.
What is that for?
It's for my absent seizures.
What meds are you on?
I am on methoxamide and Xcopri currently. I was on Vimpat, but Vimpat stopped working. It's because I'm medication resistant.
So is that like every other year or two you got to switch meds?
Yeah. Every time my seizure starts coming back up and they start ramping and they got to, switch up the meds. I think the last time before this was the Keppra switch, where they kept trying to increase the Keppra dosage and it wasn't stopping the seizures. It was just, doing the Keppra rage more.
One of the comments here says, I get twitchy when I smoke. I had to cut back a lot when seizures got bad. I get high blood pressure. The high blood pressure may be from sugar, and it may be worth bringing to the attention of his primary care doctor for them to check a hemoglobin A1C. High blood sugar is concerning for diabetes, and if he has undiagnosed type 2 diabetes, it could also be impacting his seizure susceptibility. Read this last comment. It said, weed helps keep my seizures away. The Delta, whatever it is, stuff brings on seizures and some weird visions.
Please take your medication as prescribed or whatever works for you. We're not doctors.